Hi, everyone, and welcome to the fourth annual The Way to My Heart Patient Conference. The theme this year for the first time ever is Save My Piggies. It's time. It is time for the patients to tell all. So get ready for the unscripted, candid stories of patients and their experiences along their PAD journey from around the world. Gaps in healthcare are leading to unnecessary amputations for patients suffering from a disease more prevalent and deadlier than all cancers combined, except for lung cancer. To demonstrate the gaps in care for patients with peripheral artery disease, or PAD, nearly 24 patients are gathering today to share their experiences. Sessions will address the need for a democratization of access to diagnostics for all with high risk factors at an early stage of disease, a proper vascular assessment prior to amputation, and access to a potentially limb-saving second opinion if amputation is presented. Sessions will also address success with walking as medicine and the struggles with smoking cessation. But before we get to our keynote, a few disclaimers that we do have to do. Got a little housekeeping here. The advice and views offered are for educational and informational purposes only. Do not act on any information provided here without the explicit consent of your own healthcare provider. Also, the views do not necessarily reflect the hosts of this program, The Way to My Heart, its board of directors, its volunteers, or its staff. And if you are using the Zoom link to participate in viewing today's seminar, it is being broadcast live on YouTube, Facebook, and LinkedIn, as well as the Way to My Heart's website. So if you do not wish for your face or your name to be public, then you can leave this Zoom link and go to youtube.com/The Way to My Heart and view this seminar anonymously. If you do have any questions during this seminar or insight to share, if you are on the Zoom link, please raise your hand or kindly let us know in the chat box, and we will call upon you to ask your questions or share your experience at the right moment. For those of you that are watching on different platforms across social media, go ahead and place your question in the comment section, and we do have our team scouring the web looking for your comments and insight to share, and we will bring them into the conversation. But make sure if you are on the Zoom, do stay muted until you are called upon. And with all that being said, I think Dr. John Phillips, it's about time to kick off the first of its kind Save My Piggies event where PAD warriors raise their voice to inspire the best care for poor circulation. So welcome our CLI fighter, my partner in crime, and the creator of Save My Piggies, Dr. John Phillips.
Kim, thank you so much. This is, a culmination of a lot of hard work. I would say you've done the majority of the heavy lifting here, but we have been partners now for at least a year and a half. And the idea of Save My Piggies started probably 3 or 4 years ago in my mind, when I just, as an individual who works with patients who have ulcers and who are struggling with peripheral arterial disease, it got to me that these patients had no options. Sometimes, at least that's what they were told. They didn't have an outlet to go to, and they were struggling to try to find the right physicians, and I say plural, to help them. And through the grace of God, you and I were connected. We did a couple of intro podcasts together, and ultimately it has kind of led to our radio show, and then this first ever event. And I'm so happy that we're able to do this. And Save My Piggies is about patients. It's about patient testimonials. It's about learning from patients and getting their perspective to their disease process. That disease that you mentioned is often worse than cancer, most cancers.
Yeah.
And through to the Way of My Heart, it is a venue for patients to get together and share their thoughts and concerns and answer questions, and then Save My Piggies here to let them hear their voices. So from the bottom of my heart and the tip of my piggies, I thank you so much for putting this thing together, and let's get going. Let's have a good conversation and hear from our patients, because I'm really excited for what this is going to bring.
Yeah, me too. I mean, this is going to be literally a powerful 5 hours of patient testimonials, unlike anything anyone has ever seen across the web or any broadcast media. And I'd like to kick things off with our fireside chat. And we do have a couple amazing men that are joining us. First off, I'd like to introduce the one, the only, legendary Harlem Globetrotter, Larry Shorty Coleman. Hi, Larry. Well, Larry is, where did he go? He needs to unmute. Here we go, kicking things off. We got to get things unmuted. Larry's journey started quite a few years ago. Actually, he was a former athlete, as we all know, and very famous in the Harlem Globetrotter world. And he ended up, his mom actually had an amputation related. They said it was related to diabetes, but now he's wondering if this was also a poor circulation related and just was not called peripheral artery disease at the time. And fast forward, he ended up experiencing, some leg cramps and symptoms of PAD. And he goes to the hospital. And of course, they want to go straight to amputation. And he said, absolutely no way. Right, Larry?
Yes, I agree 100%. That was the craziest thing I ever heard.
And so when did you start experiencing symptoms? I mean, you were an athlete. Poor circulation is probably the last thing you expected to hear that you would be suffering from.
Yes, by far, because it started out like it was a cramp in my leg or just a muscle spasm. And then it got worse. It felt like someone was stabbing me in my calf of my left leg.
And so how long between the time you started experiencing those symptoms and actually seeking care for them? Because I would imagine that you probably thought you might have had a muscle cramp, you pulled a muscle, it was some sort of athletic injury, but not something that would be a chronic ailment.
You're 100% right. I thought it was just something that I had twisted the wrong way, or someone could have hit me in it while we was playing basketball. But I waited for like 2 to 3 weeks, and the pain got worse and worse. And then I went to emergency, and that's when it all started with let me amputate. We probably gonna have to amputate right away. And I was like, oh no, this ain't happening. So I had to stay in the hospital, and I waited probably after 8 surgeries and realized that it was deeper than just a muscle pull or muscle spasm or cramp. And I said, the pain was so excruciating, I had no other choice but to make the decision without having knowledge of it. And boy, but I still wake up every day.
You do. And so during the time that you were in the hospital, when they said amputation, did they offer you any other option, or what was the reason for amputation upon your initial presentation of symptoms of leg pain and leg cramps?
Well, that was just an emergency doctor, and everybody there was saying once he went out and made his statement that he's going to have to amputate right away. And I said to myself, and I prayed about it, and I said, there's no way that's going to happen. So I asked to speak to about 6 other doctors, and they said he had no business telling you that. We first want to see if we can save your leg.
Good. And so they tried. And how long between the time that you initially went to that hospital and you ended up having to go back to the hospital following, you said, 8 procedures where they attempted to, I would imagine, restore blood flow using minimally invasive tools such as wires and balloons and that kind of thing? How long, what was the time frame between that first hospital experience and the second one where you ultimately ended up with amputation?
Well, it lasted about, I'd say, maybe a month, because I was really not wanting to have that done. And basically, I went from one doctor to another and trying to get it done. This doctor was supposed to be great at opening up the blockage or clot. It was a blockage, really. That's what they was telling me. So it took about a month, and I had to be hospitalized.
And I'm imagining, what was the pain like? Must have been excruciating.
Yes, the pain was very excruciating. And I'm here to tell you, it just felt like the nerves and everything was set off all at once, feeling like someone stabbing you in your calf, and it just blew me away. And I was like, something got to be done.
And
And
at
then,
that
of course,
point, where you realized something had to be done, could you imagine that there was any other option that could relieve that pain except to cut it off?
I think with all the drugs they was giving me, and the pain was still there, and I was like, this is not helping. And like I said, I'm the first to say I didn't have the proper knowledge of it, and so when you're trying to save your leg, you just go through these doctors, and hope they're telling you the truth.
Yeah, do you know what type of procedures they did to try and open up your blood vessel? Do you know if they took the wires and balloons down into your calf and into your foot, which, having worked with you now, over the past year, I know that you have a lot of below the knee disease. And so I'm curious if the doctors, or if you knew whether the doctors had tried to take those tools and open up those vessels below your knee, or if they just stopped at your knee.
Well, they tried several things. They used a balloon. They went in with what is this? Some type of wire, and then what is it called? Put in a stent, and none of that was working.
None of it was working. And so
No.
what was the catalyst for you finally saying, you know what, I can't do this anymore. I can't go through this process. I just can't imagine that anything is going to work. Doctor, it's time to amputate.
Yes. After eight surgeries, and the pain was still there, and just as great as it was in the beginning, I was in the hospital, and about 3 o'clock in the morning, I said, I'm not getting any sleep. I'm stressed out about this, and pain got so great where I told the doctor, just remove. He said it would be below the knee, which he tried first. And I went through that process, and like the majority of people, it got infected, had staples in it, the biggest I've ever seen. And believe it or not, it went above the knee. All right.
Larry, if I might ask a question, or
Yes,
it's not uncommon for patients who have the pain that's so intense to say, you know what, just take the leg. But so you have the amputation. What about your other leg? Was your other leg healthy, or did you have problems with that one as well?
During this time that I had my left leg amputated, I didn't have any problems with my right leg. But it's a great question, because now I'm going through pretty much the same thing with the other leg. But thanks to Kim and Dr. Red and his staff, it's much better than what it was, because it was getting pretty bad. Weak. It was getting weak. There really wasn't no pain there. It just, excuse me, it was getting very weak.
Sure. But the other issue too is now you have an amputation on one side. You're an active guy, you're a former athlete, and you want to get up, move around. So now you've got to get that prosthesis, that whole process rolling. And you also have to keep the healthy, quote unquote, healthy leg healthy so you can ambulate with that. So I mean, you've got a big hill to climb at this point, right?
Yes, I do. And believe it or not, this is my second prosthetic leg. And it, when I put it on and I walk in the house, I just started back doing therapy, strengthened my right leg first for about the first two to 3 weeks, she said. And when I put it on, I could tell that the right leg gives out sometimes. Not a good feeling because not nice to fall and not know how you're gonna land.
Yeah, I can't imagine. So, Larry, what gets you up every morning? Like what motivates you to get out of bed? Because there are a lot of people in your
I think,
situation. Just mail it in.
yeah, for anybody that's going through what I'm going through, uh, the good Lord that wakes me up every day really gets me going. I have that moment of, oh man, why can't I just get out, walk to the bathroom, brush my teeth, wash my face, use the bathroom, and so forth. But I get past it by knowing that I probably could have lost my life experimenting with all these different doctors. So I know I'm still here for a reason. And I'm the type of person that I won't give up on trying to walk. That's for sure. I'm going to give it the biggest fight of all. And I advise everybody else to do the same. Don't let one limb, two limbs, three limbs just think positive and say, I'm still here and I got a reason to be here.
And you know what, Larry? I mean, you are incredibly inspiring. I still remember that first phone call when you called our Lifesaver hotline and you said, "Hello, is this Kim? This is Larry Shorty Coleman. I hear you're going to save my leg."
Yes, and then you sure sent me to the right doctor because he's on top of it, and I've had about 4 uh, appointments with him, and it's been really, really a good thing because he didn't say he's going to do surgery. He said he's going to do a procedure. So he was able to do on my right leg, open up 2 blockages, and one he could not. But he said, your blood is still flowing pretty good, so we're not going to do anything at this moment. Just want you to come back every 3 months.
And any regrets now?
No, I don't have any regrets. You make a decision, and I'm the type of person I live with it, and so far it's been pretty good. Only thing I don't like about it, it's difficult for me to get back to the type of work I want to do and not have to be in pain, or I'm not ashamed of it because I want everyone to learn from it. Kids, grown-ups, because I'm not the only person going through this in life.
Not at all. And I'm curious. I want to go back a little bit about, living, life as an amputee. And what is it that doctors may not realize when they say that you need an amputation and they haven't exhausted all efforts that are out there, and they consider that amputation is better for the patient, that they're going to be so much better off. What is the reality of life directly following the amputation? You are sent home in a wheelchair, and how long before you are able to get out of that wheelchair, your wound healed, and get the prosthetic fit so you can get on your feet? What's that time frame?
Well, when I first went to therapy, they was telling me that it's probably going to take me a year to walk, which I didn't want to hear. And I had different people calling me, wanting to use, being a former Globetrotter and come to Florida. I went to Florida in Orlando and to POA. And you wouldn't believe it, I did walk the second day there. And I was, boy, you talking about it, a very happy individual. But that was only the beginning. There's no way I'm going to keep going back to Florida and back to Georgia. So,
Hey, Debbie, I can't get it out of this enlarged screen. I've never had that.
And so, what were some of the challenges when were at home and, you would wake up in the morning and you would end up having to use the restroom? Did you ever forget that you were missing a leg, and ended up trying to get out of bed and, oh my gosh?
very, very good question, because that happened about 2 or 3 times. But after you fall, you start to realize. And then most craziest thing, I had a dream I was playing basketball, and down on the floor I went, hit my head, and I started saying to myself, move over further to the wall and try to end some of these dreams and move forward with what the situation is, not having but 1.5 leg. But believe it or not, I take the lumps and the bumps, but I tell you, it depresses you really bad, especially the falling part.
Yeah. No, I can imagine. I mean, that's the part that we hear it all the time from a lot of our fellow PAD warriors that are here and who will be speaking later on in this conference, that that's one of the toughest things. And that's where, how many trips to the emergency room do you end up having as, a recent amputee, and as you're trying to learn the process and get used to life with one limb?
Well, you really don't have a choice once it's already been amputated. It's up to you to put that first foot forward. And when you get the prosthetic, your goal should be to take 1 step leading into 1,000,000 steps if possible. But
Right.
It's not easy. I make it sound easy because I'm a very competitive person. And for those that's not, just think of others. Like I look on the Google and see people with no arms, no legs, and they're doing miraculous things in life. And seeing kids really does it for me. But I have respect for everybody that's an adult too that's going through it.
And I have one more question for you, Larry.
Yes.
Hypothetically, there is some new legislation that Congress is considering. It's called the ARC Act, the Amputation, Reduction, and Compassion Act. And one of the aspects of it is to require Medicare and other private group insurance to cover early testing for PAD for all of those with high risk factors. Having a family history with your mom having diabetes and having had her leg amputated, you would likely qualify for early testing. If there was early testing, such as with colon cancer or for women with breast cancer, would you have volunteered to go in and been assertive with your doctor to go get tested earlier rather than later?
I would prefer to go earlier than later, because it's individuals out here like Dr. Phillips and plenty other doctors. But I'm so glad he comes on and enlighten us with some of his professionalism as a doctor. And hearing him make me think that I could have saved my leg. But in reality, it's gone. So I would definitely want to join that act that you're speaking of.
Yeah, I think it's really important. What are some words that you would like to share? Let's say for, lawmakers and doctors and even patients alike, that would inspire them to be to do something different, when it comes to PAD and to improve the care with PAD?
Well, I would like to tell anyone that's going through talking about having an amputation, do research on it yourself, as well as calling someone that can put you on the phone with a doctor, or going to see him if it's local. And the most encouraging thing is this: fight to the end before you give up your limb, whether it be your little piggy or it be your broomstick, is what I call mine now. And stay prayed up and just deal with it. Because if you wake up, that's the greatest part of all.
That is absolutely beautiful. And John, any final questions for Larry before we just thank him so much for being here and all of his inspiring words?
No, I think that's exactly it. His inspiring words, the fact that he's never given up, because a lot of patients kind of give up, and they don't have an outlet, to a forum to kind of interact with. And this is the beauty of Save My Piggies and the Heart of Innovation. We have a lot of ways to help people, not only as physicians, but also through the Weight of My Heart and connecting patients to other patients, and kind of, it's a support network basically. And Larry, keep that positive message, keep doing what you're doing. You're inspiring people, and you're saving piggies, my friend.
All right. Thank you very much. And you're doing a great job yourself. And Ms. Kim, Way to My Heart was like a door opener for millions of people that don't know what you're telling them every Saturday. Imagine if this was on a TV show, they would be glued to it. They probably have tears, but the tears would surely turn into a smile, because you accepted the fact to have your leg amputated. But in reality, you still have another leg, because I'm told that PAD travels. It stays with you for a lifetime. So whatever you at and whatever you're doing, do your homework. Even though that's some hard stuff to do when you say do your homework, but find the right person and get more than one device. And try to fight the pain as much as you can. But drugs that they give you, they only make you feel like it's okay for a minute. I'm just saying a minute. It could be 30 minutes to an hour to 3 hours. But when that 3 hours is over and the medication it's adapt to your system, that's just like chewing gum. When the flavor's gone, you got to get rid of it. So I wish and pray that everyone keep fighting. And we're here as a family, and feel free to contact Kim if you need to speak to me. I'm not a lifesaver, but I'm an inspirational person that wants others to feel as good as I do after this situation. And I definitely was feeling greater before.
Thank you so much, Larry. You are so courageous and so inspirational. We appreciate you so much. I'd like to bring in Jason from North Carolina, who almost ended up with an amputation. Larry, Jason, say hello. This is so amazing. He's out at the football game with his son with two legs attached, because he has fought so hard to save his piggies. Dr. Phillips, say hi, Jason.
Hey, how y'all doing?
Thank you so much for joining us. You are so courageous and also inspirational. Would you mind sharing your story of when you actually started experiencing? How old are you first? How old are you?
I'm 41 years old.
You're only 41 years old. And you started experiencing symptoms of poor circulation when?
Probably like 39, 38.
And did you go to the doctor right then and get a diagnosis?
Just
And immediate.
with vein thrombosis.
Oh, so they diagnosed you with a DVT first.
Mm-hmm.
And they didn't at that point check you for any arterial issues.
No, not at all.
And at what point did your symptoms progress?
Right before the amputation, it went to the point that I couldn't sleep at all.
And what did you have amputated? And who amputated?
My right middle toe was it was a vein and vascular place in Greensboro, North Carolina.
And did they perform an ultrasound or anything like that prior to and tell you that it was related to circulation?
No, ma'am.
And did you have a wound on your foot?
Yes, ma'am. In the middle of my middle toe, right foot.
And did they explain why the wound was there?
They thought it was from this my dog had scratched my foot, so they thought it was like some like bacterial type stuff.
And so it got infected and they said amputation.
Mm-hmm.
Did they try to unblock any arteries or do any sort of attempt to open up your blood vessels? Well, we lost Jason at that point, so we'll have to bring him back, Dr. Phillips. If you want to jump in for one moment, I'm going to hopefully get him back.
I think Jason tells a story that is very similar to a lot of folks that are first diagnosed with peripheral arterial disease. Number one, they're not sure what's going on if they have a little ulcer. Number two, sometimes it gets missed by and not through the fault of any physician or care provider, but it's just overlooked. And it's one of those things. So for patients who have diabetes, particularly, and those who have risk for developing peripheral arterial disease, we tell the care providers, make sure you take their shoes and socks off, look at their toes, scan for ulcers, because they get missed. And a lot of times patients can develop a little kind of black dot, as I call it, on the tip of a toe, and that can lead to a major amputation. We see it not infrequently. And so it's important for patients to be aware of some of the first signs of peripheral arterial disease, not necessarily just the pain when they walk, but also, discoloration and ulcer that's forming that shouldn't be there.
Yeah, and that's what's true. And we're still trying to get him. His phone might have died. He's out there at the football game, and it's so amazing and inspirational to see someone that I was just working with 3 months prior who ended up posting on a social media page that had no relation to our page at all. And one of the folks in our social network ended up happening to be in that other group and seeing the post and guiding him to us. And that was absolutely incredible that we've helped so many people in our network that they're now, it's like diaspora, and they're getting the word out, and they're able, with their reach, being able to bring people in. And at that point, his toe that they had amputated, the wound was not healing. And at that point, they said, you know what, we now need to take your leg. We need to perform a below the knee amputation. And still at that point, he had no idea it was a circulation issue that was causing it. It was, hey, you have an infection, your toe's not healing. Now we got to take even more, not just a transmetatarsal. No, we need to take you below the knee and take all of that. And that's when they came to us, and we were able to get him to a vascular surgeon in Charlotte, North Carolina, Dr. James Antizana, who was able to go in, unblock some of the arteries below the knee. He is a diabetic. And so with diabetics, they tend to err towards the side of, a lot of plaque below the knee and into the foot. And so for him, he's a young guy. It's type 2 diabetes, not even type 1. And so it was very rare to see that he ended up with plaque that had built up that quickly to the point where it was truly blocking his blood flow to his feet. And that was incredible. But Dr. Antizano was able to open up those arteries below the knee and into the foot. And he did this the day before his amputation was scheduled. And the moment that I know, is this incredible? He had the revascularization done on Monday. On Tuesday was the scheduled amputation. And he called me from the clinic when his foot was warm again and said, "Oh my gosh, I am calling and I am canceling the amputation." And now we're a couple months later, and he is on his feet at his son's football game.
It's an amazing story, but it also highlights the fact that it's so tenuous, right? Because if he wouldn't have been connected through you guys, he'd be missing a leg, and that's wrong. Like I just it's great what we're doing here, but it shouldn't have to be this way. Like people know, and we've talked about cancer, right? We've talked about if I feel a lump somewhere, I know that that's not right, and I know something that needs to get looked at. But folks don't know that an ulcer on their toe or a discoloration of the foot is a harbinger of potentially something very bad and life-threatening. People don't know that. We don't have to have a, save my whatever when it comes to cancer, because people know. And yes, there's cancer screening things, and maybe that's what we need to pivot towards. And we've talked about this too, about screening patients for PAD. But it's crazy that you have to have these conversations to say, no, I'm not having my foot cut off. Let me find somebody who can help me. And if I've exhausted all options, fine, you've done your best. But it just blows my mind. And this is why, you do what you do, and we do what we do, Kim.
I know it's so true, but sometimes doctors will tell me that, oh, these are just the exception to the rule. But in fact, statistics show, when you look at the Medicare data, unfortunately, more than 50% of all of these PAD related amputations are being performed without even a proper vascular assessment prior to. And that is something that the ARC Act is also looking to address. What it's looking to do is withhold reimbursement for amputation if a vascular assessment was not performed prior to, hoping to inspire people to take steps beforehand to do a more exhaustive evaluation of the vascular system to see, is it possible for anything with all of the new tools and techniques that are available? Is there anything, whether it's endovascular or surgical, that might be done?
Well, and Douglas said in the chat, the answer is simply education, right? I mean, so it's educating patients, it's educating physicians, all types of physicians. But yeah, there's always an option, I think. And there are patients that we see, we've talked about on the show, that they've run out of options. And at some point, like in Larry's situation, the pain becomes so excruciating and he becomes so debilitated that you have no choice. But let's reverse engineer it, and let's figure out how to stop this from happening. Let's get people the care that they need for their diabetes and reducing their risk factor. And I think we're touching on this at some point today, is tobacco cessation. I mean, smoking is something that you can do. You don't have to smoke, right? And so, like, education's the key.
I totally agree. And as Larry mentioned, I mean, he did have 8 procedures prior to finally deciding that he couldn't deal with it anymore. Nothing was working and he needed amputation. But you and I both know that different doctors, different tools, different techniques, different philosophies can lead to different outcomes. And so it might be possible that the doctors who performed those procedures might not have been trained in more advanced current tools and techniques that have really evolved over the years. And maybe if he went to a more advanced CLI fighter, which he has right now in Dr. Douglas Red in Atlanta, who is fighting really hard to save his remaining leg, maybe the outcome would have been different. But we're all, I think the entire industry and clinicians and physicians and everyone, we're all learning. This is an evolving practice right now. There's still so much research that needs to be done before even guidelines, standardization of tools and techniques can be made.
Yeah, 100%. I mean, we've talked about this on the show as well. There's there's a secret sauce to fixing someone's blocked artery in their heart. We know how to do that. We can reproduce it. It lasts a long time. There's no real secret sauce with respect to guidelines and standardization for the most part in PAD work. Because as you know, we debate whether or not we should use this tool or that tool. We debate whether or not we should use this balloon or with medication or balloon without medication. We debate whether or not we should fix a blocked artery in a patient who only has pain when they walk, as opposed to, letting them continue to walk and build the collaterals or the bypass vessels that we talk about. There's a lot of debate, but I think debate is healthy. It stimulates conversation, it stimulates education, and patients are becoming more and more in tune to obviously their bodies, but also the treatment plans for them. And that's why I always say, I'm kind of your coach. Here's a playbook that I'm going to give you. There's lots of different plays we can execute, but you're the quarterback. You've got to throw the ball or hand it off, and you've got to make that decision because it's a group, it's a team sport in treating people with PAD.
Yeah, no, very, 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 very true. I just was getting back, Jason, for just one final thought. I was able to get him really quickly, just so that we can get his final thoughts before we move on to our first real session of the day. Jason, can you give just some, final thoughts here? I mean, in terms of, it was probably very frustrating for you to be offered a below the knee amputation without even an attempt by your doctors initially to restore the blood flow.
Yeah. Say that again.
So it must have been really frustrating for you to be offered the amputation without them even trying to save your leg.
Oh, yes, definitely. That's why I reached out. I had an appointment set for the next week, but I reached out. I just went on Facebook and luckily you reached out to me, point me in the right direction.
And what would you like others to know that they could learn from your situation now that you have had your blood flow restored and you were able to avoid amputation?
Well, definitely get a second opinion, hearing if you can. Try everything you can before them take it.
Yeah, you're probably breathing just a sigh of relief right now, because if you had not reached out on Facebook, and I mean, it took a lot of courage on your part to trust our organization just straight off social media, right?
Yes, ma'am. Yes, ma'am.
But you're glad. Yeah, I know you're glad you did. And so I'm so excited to see that you're out there at the football game with your son. How does it feel to be standing out there on 2 feet?
Feels great. I didn't think I was going to be able to do it. At one point in time, I thought I wouldn't never be able to walk like this again. So I am now, so grateful.
And what changes are you making in your life to remain on 2 feet?
I'm trying to eat a little different, a little bit more walking, no smoking, definitely, and just trying to keep moving.
Well, we appreciate your time. We appreciate your courage, and we appreciate your inspiration. And I hope your son's team wins today.
Appreciate that.
Thanks so much, Jason. We really appreciate your time.
No problem. Y'all have a good one.
You too. Such an inspirational story. I'm glad we were able to get him back before we finished this session this morning. It is just heartwarming to see that Jason, 2 months ago, he was on the verge of amputation, and because he reached out and the way to my heart answered, we were able to get him to a limb-saving second opinion. And even more, what's even inspiring is he and I had a conversation yesterday about his diet, about walking, and he is truly taking steps to better health. And as our friend, and we're on Zoom, so we have people commenting here, a lot of patients on here that are commenting and asking questions and things like that. And one of them, Douglas, is saying education is really key for everyone. And we need to get the word out that PAD is serious and it can be prevented, and we can stall its progression if only we had early diagnosis. And that brings us to our first grander session of the day. It's all about the journey to diagnosis. And we have several folks that are going to be chiming in on this session. I'm wondering if Dr. Phillips wants to jump in before we get started with this session with a few thoughts to really paint the picture as to why we are focusing on the journey to diagnosis.
Well, because that's where it starts, Kim, right? You have a patient who potentially has a life-threatening medical process or ailment, and the diagnosis gets missed quite frequently just because, well, a number of reasons. But it's important, I think, to hear from the patients as to what, their experience, because I have my own experience as a physician. And when I see a new patient for a consult, I mean, we kind of work our way through things, but when they're coming to see me, they've already had the diagnosis typically made of peripheral arterial disease and maybe have an ulcer of sorts. But this is where the process starts, the diagnosis. And so I think it's fantastic to explore this and hear from patients.
Yeah, no, I totally agree. I'd like to bring in our first courageous patient with PAD. I'd like to open up the forum to Marcia, who has been with our organization for now, I think, more than a year. And she is one of the most inspiring in our group, constantly out there pushing herself to walk, walk, walk. Marcia, welcome.
Welcome. Thank you. Thank you for having me.
So I want to start from the beginning with you and your experience with PAD, and talk about, from the very first moment that you started experiencing symptoms that you didn't know at the time were related to something called peripheral artery disease or poor circulation. So bring us back to that moment and what you were feeling and what you were thinking.
Well, during COVID, a girlfriend and we started going on little hikes. And when I say little, I want to emphasize that because I didn't get very far. And I couldn't figure out, we just go a little ways and I was in pain. And so we went every Friday. We called it Hiking Friday. And I was trying to get in with a new doctor at that time, but with COVID, it was very difficult. Everything was shut down and people were sick. And so I wasn't able to get into a doctor for a long time. And of course, I just took it easy because it hurt to walk. I continued smoking my cigarettes. I was doing videos during COVID, cooking videos with butter and cream and, all the
something we all enjoy, right?
Right. Well, because I didn't know that. Anyway, eventually in April of 22, was it 22? Yeah, it was just last year. I finally got in with my doctor. She was brand new. She's a great doctor. She's African-American woman. And so I just love her. And I told her that my leg hurt. And I said, but it doesn't hurt all the time. It was typical claudication, which I didn't know. And she says, it sounds like you have PAD. And I'm like, what's PAD? So I started Googling and I found you. Of course, I think I'm going to have an amputation. And that was the beginning of my journey. Found a great doctor, thanks to you, about an hour and 20 minutes away. And I knew smoking and diet and exercise were the three things I should, improve on. And those are the three things that I was doing horribly at. So And now I quit smoking. I eat healthy. My cholesterol's great. My triglycerides are great. And still having problems walking, even with intervention, because I scar. I'm a scarer. So that's kind of where I am today, but it's been an eye-opening and educational.
I'm curious, what was the time frame between you first experiencing symptoms and when you were finally able to get the appointment for diagnosis? And do you think that if it wasn't COVID and if you could have gotten in sooner, that maybe you might have been able to act 6 months sooner and prevent any sort of intervention at all with a walking program, diet, and smoking cessation just that much before?
Well, only God knows what the difference would be. But it was
It's a loaded question.
Yeah, it was probably, it was in 2020, summer of 2020. So it was probably June. And it was 2 full years before diagnosis. So, and after diagnosis, I started immediately. Once I knew what it was, I was like, I like my leg. I paint my toenails, I get pedicures, I take care of it, I thought, from the outside, but I wasn't taking care of it on the inside. So I started immediately. I would think 2 years maybe would have made a difference, but I don't have a crystal ball, so I don't know. But I started immediately, and then the smoking, of course, that was a challenge. I found out in April that I had PAD and began the testing, the ABI test and Doppler ultrasounds, and I quit smoking in May. So it took a little while. You have to wrap your head around everything, but I did.
And what was your secret to smoking cessation? I know we're going to be addressing this a little later in the conference as well with many, and you may want to chime in at that point. But since you're sharing your full story right now, I know it's a struggle for smoking cessation. One, what was the struggle for you in quitting? And two, how did you persevere?
Oh, it was the most difficult thing I'd ever done. Like everybody who reaches a certain age, you have struggles in life and ups and downs and problems with kids and losing parents. And through it all, cigarettes were my best friend. They were my comfort. You get upset, have a cigarette, get more upset, have another one and a donut. So I loved my cigarettes. I loved them. And they killed my mother. And that was one, on top of having the diagnosis, that was a strong factor for me. But I knew I had to do it. And for me, I prayed and prayed and prayed about it, that please take this desire from me. And I don't know that the desire really went away, because I really like cigarettes, but I gave them up. So there isn't a secret. It's hard, but you have to do it. You have to make a choice: my life, my legs, or my cigarettes. And that was a no-brainer. And now looking back, it's the best thing I've ever done. I mean, I'm free. It was like a ball and chain, and I didn't know it. Everything I did revolved around, where can I have a cigarette? How can I have a cigarette? I'll have 2 cigarettes before I get there. Oh, okay, I'm going to leave now because I want a cigarette. I don't have any of that anymore. It's freedom. So please, I implore anybody out there who's smoking to give it your best shot. It's worth it.
Wow, that's amazing. And we talk about the ARC Act with requiring Medicare and other private group insurance to offer testing and be assertive about offering testing, such as with colon cancer or with breast cancer, right? If you have high risk factors, would you have, knowing that you were, I think you mentioned you were a little overweight, you also were a smoker, would you have actually gone in sooner, even without symptoms, to get tested?
Absolutely. I mean, I get my mammograms, I get my colonoscopies. I go to the doctor regularly. I was just in between doctors. And truthfully, I don't think my other doctor would have known what it was, because many primary doctors do not know what PAD is. I was really, really lucky to have found this fabulous doctor who knew instantly. But yes, I certainly would have done testing. I certainly would have. And I was pretty lucky with finding a great doctor, thanks to you, in Cincinnati, Ohio. And he got me in right away. He started testing right away. I didn't have problems with my insurance. And so, I was on the road. My journey began.
Good for you. Thank you so much for sharing your story. I want to bring in Nancy. Nancy, go ahead and unmute, and let's hear about your PAD journey and the moment you started experiencing symptoms, whether or not you knew they were related to poor circulation.
Thank you, Kim. I'm so glad to be here. I had a heart attack, and actually my heart stopped beating, and I had a heart attack afterwards. On the way to the hospital, I had an EMT that revived me, and had 2 stents put in, had a defibrillator put in. I had suffered diabetes and coronary artery disease for many years, but they missed a couple blockages on 2 years in a row on a stress test. But after that, I was back to work within 3 weeks after all of this happening. But during the year after that, I started feeling some pretty strange symptoms of things like couldn't walk up a flight of stairs good, a lot of pain in my calves. I line dance, and I was having trouble line dancing, tripping over my feet. And when I went back from my checkup with my cardiologist, I gave him all the symptoms, and he said, "Oh, we got to do a stress test." So we did a stress test. It was fine. So I was relieved. I had no idea what was going on, and went on for another year like that. And the pain was getting worse. I had trouble walking. And so I went back again and told him I felt this heaviness when I was climbing upstairs. I had all these symptoms. And he said, "We got to do another stress test." So we did. The stress test was fine. My heart was fine. So from there, I left his office, and I went to see a spine doctor after that. Had a lot of tests done. They said, "Oh, you got some arthritis in your hips." And I went to physical therapy for a while. Then from there, I said, "Well, I'm going to see a chiropractor, see if he can help me." So I went 2 months to a chiropractor. He said, "I'm not helping you at all. I suspect you have PAD, and you need to get an ankle brachial test." So I went, and yes, I had it, and I was diagnosed with PAD by a chiropractor referring me, really. From there, I was referred to a vascular surgeon at a large medical university here, where she monitored my legs every year, then every 6 months. I don't remember her ever checking my neck, but I went to an endocrinologist, my endocrinologist physician assistant. She listened to my neck in 2021. I had the heart attack in 2015, and said, "I hear a swishing noise." So she sent me for an ultrasound, and sure enough, I had a 70% carotid artery blockage. From there, my vascular surgeon tested me every 6 months, kept an eye on it, felt that, well, it's too risky to do surgery. And they also monitored my legs, because I have PAD in both of my legs. From there, this doctor, my vascular surgeon, ended up moving away. And in the meantime, I had a friend recommended Kim and her support group, and I had gotten involved with that. And I got with Kim, and Kim recommended that I see Dr. James Antizana. And he ordered right away for me to get a CT scan of my neck. By that time, my neck was almost 95%, 90% blocked. So he recommended and referred me to a neurosurgeon in Charlotte. And in June, I had TCAR surgery. And I went through it fine. And now in 2 weeks, I'll be going to Dr. Antizana and having an angioplasty on my left leg. So it's been a journey for me, a long journey. It took 2 years to diagnose me. And I just don't, I'm so happy to be with this group. and so proud of everything that they are doing. So excited to see Johnson & Johnson recommending us, our group, now for people that are getting PAD to go and get involved with our group, so we, so Kim can help them. So that's my story. But
no, you've been on such a journey, and I'm curious because I'm assuming that every single time you went back to your doctor, you said, come on, doc, I don't understand what's the relationship between my heart and my legs, because I am telling you, my legs hurt. I have cramps. I can't walk up to the stairs without stopping and waiting for the relief.
Mhm.
Another stress test. Aren't you only checking my heart again? What
But
kept you, going, and what ultimately did you say to this chiropractor? Because usually chiropractors don't manage your legs, they manage your back, they manage your neck.
Right. I kept thinking it was my back. I had no idea. And I think that's the problem with so many people that I meet. They don't realize, they don't know anything about PAD. They don't know about circulation issues. I kept thinking it was my heart, my coronary arteries in my heart, around my heart. And I really didn't know much about PAD. And I kept thinking, okay, it's got to be my back that's giving me this pain. And that's kind of what I was led to believe. And people would say, oh, you have sciatica, so, that's, I probably should have pushed harder, but I really didn't know. And I think it's people just don't understand this disease, don't know about it. The word's getting out now. It's starting to get out more. And that's what we really need to work on. And also, having our primary care physicians and cardiologists realize it. Sometimes I think they're so specialized that they're not realizing that, with something like all the symptoms I had, I should have been just sent for an ankle brachial test, a simple test. So
we did a survey in our network, and we had more than 400 people respond. And 70% of them said when they first presented with textbook symptoms for PAD, leg cramps, leg pain, neuropathy, then they were misdiagnosed. The top answers in terms of what they were diagnosed with, aside from PAD, upon first presentation, was exactly as you said. Number one being back problems, sciatica as part of that. Number two, diabetic neuropathy. Oh, it's just your diabetes. And in fact, as Larry Shorty Coleman had mentioned during our keynote, that his mom was only diagnosed as having diabetes, and that's why her leg was cut off. There was no discussion about poor circulation with her prior to amputation. And then we had Jason during our fireside chat that he was saying that there was no talk about poor circulation in his arteries before he was offered a below the knee amputation. And so it is education that we need to be offered to not only cardiologists, but the primary care physicians. And I do think that if we have legislation that requires earlier testing for patients with high risk factors, that is going to make a huge difference in terms of public awareness. Because I would imagine that you would have fit in that category and they would have done testing 2 years sooner on you.
Mm-hmm. And I would have had the testing done. I'm very preventive in everything I do. And I'm a little mad at myself that maybe I didn't push hard enough, but I was doing everything I can and relying on my doctors and going to specialists. And, so now I know knowledge is power. And I would have been doing a lot more 2 years sooner. And I mean, right now, all my numbers are down. I walk half hour to an hour every day. I swim laps. I try to line dance. I'm not real good at it anymore because of the pain in my legs. But, I stay active and I'm eating healthy. I'm doing everything I can to fight this. But I didn't know for 2 years. And I hopefully doctors will start, maybe testing can start being done. It really needs to be done sooner on people. Anybody that's a diabetic or has heart trouble should have tests, I think. But
thank you so much. Nancy, you are inspiration. I really appreciate you sharing your story. I'd like to bring in Darla as well, that wants to share her journey. Darla, welcome. I think she needs to unmute. We always need to work on the unmuting. It's always difficult to get people to jump in. Hopefully she'll jump in. Darla.
Good morning.
Good morning.
Hello?
How are you?
I'm good.
Thank
How about you?
Thank you so much for jumping in and sharing your story with us today.
You're welcome. You want me to get started?
I would love for you to get started, please.
Okay. Like Nancy, mine was a long journey. I was at the time like 61, and I thought I was aging. And no, it was very painful to walk. It took me 5 years to get diagnosed. I kept going to the doctor and saying, I can't walk. It hurts. What's going on? And they went to my back, and it really wasn't bad, but they would just give me pain pills, which I don't like to take, and I didn't, because I thought, well, this is the aging process, and my age is. I did have a history of family heart problems. My dad died at 52, waiting on a transplant. I had a little brother that had a widowmaker, and another little brother that died at 15 days old with heart problems. So, of course that was in the back of my mind, but I couldn't get anywhere with that because they'd listen to my heart. They'd ask me questions about it, and that it stopped. So I would keep going. I did the whole Bengay, every hot and cold, icy cold. I did all of that for years. And so I started researching myself and found your Facebook page. And I went to the test to ask for, and it was the ABI. So I went, I did do the chiropractor thing too, and he said I was a mess, but my back was okay. But he was just saying I was out of alignment. I needed to get that done. So I did that for like a year prior to this. So wow. I go back to the doctor armed with the knowledge I learned from your Facebook page. And I said, first of all, I set him up kind of because I was getting kind of sassy at that point. And I said, hey, how are the pulses in my ankles? And
good for you.
Yeah. And she goes, oh, they're great. And I went, okay, I want an ABI. And she looked at me and she goes, well, they're expensive. And I said, I don't care how much they cost. I want one. And so they sent me over like the next day to the hospital to get one done. And I'm laying there, and they brought in machine number 2 because they thought machine number 1 wasn't working. That's how bad I was. They think I didn't know that, but I'm pretty aware. And so the next day I get a call that I have an appointment with a surgeon, and he's going to be contacting me. And so I was like, what's going on? Well, your numbers weren't good. So I said, I want them. I'm coming over and I'm getting them because it's not on the CMI chart. So I did, and they were horrific. And I met with the surgeon. And when I first walked in, he goes, where's your wheelchair? And I said, what? Yeah. What wheelchair? I don't have no wheelchair. I've been powering through this for 5 years. Why, I might have to stop a lot, but I powered through. I would mow my yard. I would do one swipe and stop and sit down and get back up and do another. It was bad. So he's like lecturing me and like, this is, you need to have a bypass, aortic bifemoral bypass. And I'm just like, at that point, I'm like, oh, whoa, you know what? And he's going on and on and on. Did you smoke? Yeah, I did, and I finally just stopped him because of his attitude. And I went, can you fix it or no? And he said, I can. And I said, okay, I'm leaving now because I have to absorb this. I have to get back on that Facebook page and see what's going on. So he said, well, we can't do it right away. We have to do all of these other tests first. So they did all the testing, and they stopped when I was in I can't remember what it was called, a CT scan. No, it was actually in an operating room, and they put the dye through, and they stopped like in 3 seconds and said there's no sense in going any further. So they came into the hospital room at that point and did an echo, and it came back okay. And so then I'm on my phone Googling, of course, and I'm thinking, okay, what is the gold standard for detecting heart disease or heart issues? And it wasn't the echo. No, it wasn't. So they scheduled, what was it called? It was a stress test, a nuclear stress test. So then I had to go back for that. And that's where they found that I'd had a heart attack at some point, and they wanted to know when and where. And I was like, I had no idea. So the cardiologist then that was going to clear me for this big surgery, he says, oh, Darla, it's very small. Very, very small. Don't worry about it. We're going to go ahead with your surgery. So they did. And I knew it was going to be bad because I did pick up a friend from your Facebook pages that was a mentor. And she was like giving me all this advice because nobody else did. Like, Darla, get food ready. You're going to be in the house. It was 3 months recovery time. So, and when you get out of surgery, to expect this, because nobody told me in the medical field, what that was going to look like. You're going to wake up with IVs coming out of your neck. You're going to be on oxygen. You're going to be out of it. Don't bother taking a book because you're not going to be reading. So I was in ICU 7 days. I didn't get to eat, drink. I got a cotton swab in my mouth once in a while. And then my sugar dropped way low, which I was never had any problems with that prior to. But it dropped, and I got a glass of orange juice, and I remember being very thankful. I came home on oxygen, came home with a walker. So I didn't know, my family, I didn't have the support. They asked the surgeon, when the day that I got released, they came to get me, and they said, can she go to a nursing home? And I was like, no, I'm going home. And
Wow.
The surgeon looked at them and said, I have a feeling Darla's been taking care of herself for a very long time. So I did get to come home, and he sent a nurse, PT and OT to the house for those 3 months. Well, the PT and OT I got rid of rather quickly because I was like, one day I was laying in my bed and I thought, I can't do this. I got stuff to do. I got to work. I'm a single person. So I folded up that walker. I shut off the oxygen. I have a pulse ox, by the way, so I knew I was okay. And the PT came to the house and said, Darla, what's going on? I said, I'm done with it. I'm done. I got to get better. So after the 3 months, I wasn't allowed to leave the house, and it was hot out. So every time I went outside for a walk with the nurse, my heart rate just went crazy high. And that was something I didn't know quite how to figure out. So when I went to see the doctor to get clearance to go back to work and to get back to life, I said, can I have cardiac rehab with this? Because I just, I'm not progressing as fast as I should. And they're like,
Right. It was an aorto
it's
bifemoral bypass, right?
Right. So they ordered that, and I went out for my first one out to hospital, cardiac rehab, and they got the crash cart. There's people like twice my age walking and just doing great. And I'm like, what? And they said, your heart rate, are you on any medications, any beta blockers, anything like that? No. So anyway, I went back to see the cardiologist, and they all got copies of my readouts. And he was still like, "Oh, you're fine. You went through a lot. You're fine." And I'm like, "I'm not fine. I'm not fine. I need a left heart cath." And he goes, "No, you don't. I will see you in a year. You are doing great." And I'm,
And yet you're
and my family,
symptomatic.
yeah, my family was even thinking that something was wrong with me. Like finally told them I had this surgery in July. I told them at Thanksgiving, I said, "Guess what? I get to have a left heart cath." Only because I told the doctor, I thought to myself, I was fast thinking. I said, "I can't breathe." And he looked at his assistant and he said, "Order her a left heart cath and throw in the carotid artery scan too. Good luck with your test, Darla." And I said, "Oh, you're not doing it?" I was like, "Thank God." And so I told my family, I said, "I get to have a left heart cath." And they just thought, nobody said a word. I go, "Oh, you don't believe I need it."
And
And
so what was the
so
ultimate
anyway,
result? You actually did, in fact, need it, and they were able to.
I had 2 stents in my LID artery.
Wow.
Yeah.
Do you know
So
how
I
much it was
feel
blocked?
like it was like 80 something, 83, maybe 84. And I have another artery, which I don't even know which one it is, but they're repeat the left heart cath next November.
They're going to do
so
a general,
every
yeah,
3
heart
days.
cath, and they go in and they'll check out all the arteries and see if something more needs to be done. But your story is absolutely, incredible. And the fact that you fought and fought and fought. One final question. I mean, do you think, because an aortobifemoral bypass is frontline treatment, it is the gold standard even still, because the aorta is such a sensitive place, and you don't want someone, if you have 100% blockage in your aorta, you don't want someone just poking around with wires and catheters and things like that, because the risk of death is so high if someone perforates that vessel. So a lot of doctors do err on the side of going straight to an aortobifemoral bypass, because also it's durable. If done right, it can last above 20 years, right? But do you
Right.
think that if it would have been caught 2 years sooner, that you would have
Or
been
5.
able to, excuse me?
Yeah, it was 5 years. I suffered
5
with walking.
years.
Yeah.
If you were
Yeah.
diagnosed 5 years sooner and you were able to get on appropriate medical therapy or medicine therapy, along with a walking program, change of diet, et cetera, do you think that that would have made a difference for you? I know it's
Oh my
always,
goodness.
armchair quarterback,
Yeah,
right?
but it's so true. I still think that to this day. I think because there have been, like my carotid arteries are also closing, like they're like at 70%. So that's another thing. So then now I'm on all this medicine and they're not messing around. Let me tell you, I am on the highest dose of cholesterol medicine there is. I'm on my, and I don't know if metoprolol is like a
Metatriptyl.
heart drug. Yep, usually, typically, and that's like short term after you've had a heart procedure. But I'm 2 years out, and I'm still on really high Brilinta. I'm on Zetia, Zetia, however you say that. But I feel like some of this medication is causing other things. You know what I mean, like side effects of.
Right.
Now
And
all of a
so
sudden I
one of
have
the
gas.
that is really important is every 6 months to schedule a medication review with your cardiologist. I think that that's always important. It's something, my dad is a heart disease patient as well. And every 6 months we review the medications he's on to talk about side effects, to get some extra blood work to make sure everything is looking good. And so that might be helpful for you. We really appreciate you, Darla, Nancy, Marsh, participating segment. Any last pieces of advice before we move on to the next session, Darla?
I just do. I just think just educate yourself, get on Kim's Facebook page, get all the information you can, because you are ultimately the only one that can advocate for your health. I feel that the sooner the diagnosis, the better, because now it's not only PAD, it's CAD, it's coronary artery disease, it's kidneys, it's everything. Your arteries are very, very important. It should be one of the first things checked, not one of the last. And a person shouldn't have to push so hard to get answers to why things aren't right.
Right, especially when you're actually symptomatic. And that's the biggest thing, is if you are presenting with symptoms, that is a good time to provide advanced diagnostics sooner rather than later. Thank you so much, Darla and Marcia, again, as well as Nancy. We really appreciate your time. Now, more than 50% of all PAD warriors who end up with an amputation do not have doctors even performing a proper vascular evaluation prior to amputation. But another issue is that doctors may not be trained in advanced limb salvage clear into the smallest vessels of the foot as a Hail Mary to even saving the leg. And that could be part of the reason that amputation rates remain high as well. We have Jasmine, who's here right now to share her story with her dad. She has been advocating for her dad for the last 6 months to try and save his leg. Jasmine, thank you so much for your time and being here and sharing your story.
Hi, Kim. Thank you. I'm happy to be here.
Would you bring us back to the beginning with your dad and the first indication that you had that he was suffering, that there was something going on with his legs?
Yes. So it started off with a small splinter on his toe. And so he thought that's all it was. And he went to one doctor, they cleaned it, and they sent him home saying there was nothing to worry about. And he's diabetic, so that immediately got infected. And it was like a week later, it began swelling up. And because of the pain, he went to his primary care providers, which is California Hospital. And that was the first week of June. They performed x-rays, sent him home with 2 weeks of antibiotics, telling him not to worry. And after one day, he went back because he was in pain. And after being there for 2 weeks, they performed surgery on his toe to take the infection out, is what they said. And from there, his toe developed gangrene. And all they did during this time was monitor it for 2 weeks, performing MRIs for the most part. And eventually, it turns out he only had 2 veins pumping blood to his toe after like a month of being there, or 3 weeks. And then even one of the physicians admitted that they didn't have the proper specialist for small veins. And so his solution was amputation. He was like, well, we don't have a specialist for small veins, so the best we can do is amputate it, like without even suggesting a specialist or anything. So that's when I knew I had to do my research, and I took initiative, and I found Kim and Weight to My Heart, which I was super grateful for because she helped me with everything. And even before I found her, I was already giving because I'm the baby of 10, so I didn't want to be just doing everything. I wanted to take everyone into consideration, but I knew that I didn't want to get it amputated. And so luckily with Kim's support, she helped me take him out of that hospital because they were also discouraging me from taking him out. They were saying that if they discharge him, it's going to be my fault if something happens to him. And they didn't want to give me any paperwork before, when I wanted to take him out, they were like, oh, we got to get permission from the doctors, and just delaying the process. So I still didn't get him discharged till the next day because they also were saying that they needed the right wheelchair. And so we just brought our wheelchair because I just figured they were going to just keep coming up with stuff to keep him there because they really wanted to amputate his toe. the lady was like, the doctor's already here. And I was just like, no. So
just they wanted to amputate. I was under the impression that that was just going to be the beginning.
no, yeah. So let me
Yeah. Was it just his toe, or was it they were talking even more, possibly a transmetatarsal of all of his toes as
yes.
well, as next steps? Like, we can't just stop here. We'll try this first, but then we think it's going to progress to this.
Yes, exactly. They were like basically saying that amputating the toe was worst case scenario, but they still wanted to do it. And yeah, they informed us that if they amputate one toe, they might have to amputate. Yeah, eventually they wanted to amputate all of them because they said there was no more blood circulating. But because I knew that they said there was still 2 small veins pumping blood down there, I was like, I have to try to get a specialist to see the veins. Like, and the only way I could do that is to get him transferred, because they already said that, they don't have the right specialist. And so yeah, they didn't.
And that's where
recommend.
we had the conversation, and that's always a tough conversation for our team of PAD navigators who answer our Lifesaver hotline to have with people, because we cannot even allude to the idea that you need to transfer your family member or even yourself to another hospital, especially if they're talking about an infection that might go septic. And that's the toughest thing. I mean, we can share with you that there are options in the area, but for you as a family member to make that decision to check your family member, in this case, your dad, out against medical advice or AMA, what was going through your mind? What was the final trigger for you where you said, I got to do this. I just have to take the risk?
You and your support, your knowledge, just me being able to tell the doctor like, oh, did you guys do a retroangiogram or something like that? You told me to say. And he was like, what? Like, he didn't even know what, like, he was like, how'd you learn that? Like, who'd you hear that from? And I was like, I have someone helping me out with this. I have a limb salvage specialist. And so once I saw him, get like intimidated by me just asking something that should have already been asked, I knew like I had to just get him out. And just, yeah, learning about a limb salvage team. Like, had I not done my research and found your website, I would have never known anything about limb salvage team, or the nearest one, which was Verdugo Hills, which is in Gardena, not too far from me. I'm right here in like downtown. So it was only like a 20-minute drive to get such, better service. And my dad was actually being tended to.
Talk about that experience, and what was the process that you went through there, and how different it was from your previous experience.
So the main thing was they attended him really quickly. There was actually a lot of like staff. I even had some lady bring me a warm blanket while I was there waiting with him, because we were there all night. And yeah, even though it was packed, they still gave him a bed in the hallway, and he eventually got a room. But I could tell he was way more happy just being in that hospital, because at California hospital, he just looked very sad. And another thing is that it's because he's diabetic, I know he's not supposed to have a high caloric diet, and that's what they were giving him at California hospital. And at Verdugo's, they gave him a heart healthy diet. So no sugar, high veggies. And so that was something big that, I even questioned the nurse in California hospital when they brought my dad enchilada and rice. I was like, isn't he not supposed to have so many carbs? Like, it's like a half plate of rice. And she was like, I don't know. Like, she didn't know as a nurse about a diabetic not having.
So what was the team like for you at this other hospital? because I know at this hospital in particular, they tap into the University of Southern California's limb salvage team, and they jump in, and the moment someone presents in the emergency room in the most advanced stage of PAD, which is critical limb ischemia or critical limb threatening ischemia, CLTI or CLI, that their team is called in immediately to assess the patient. So you had both podiatric specialists and vascular specialists that were tending to him immediately and creating a strategy to save that toe.
Yes. Yeah, so that was a really big difference also, is they were all like well informed of what to do. They didn't seem intimidated by any questions. They were able to answer everything. And yeah, like you said, it wasn't just a vascular specialist, it was also podiatric specialists. So it was.
And so they actually performed an angiogram, and they were able to open up. I know that at the other hospital, they talked about them. It's interesting. I hear this all the time. Doctors talk in terms of veins when it's actually arteries. And doctors have actually told me the reason they do that is because, well, patients don't seem to know the difference anyway. So it's easier to just talk about it as if it's one. But my theory is, you know what? You just need to explain to them. You have some lanes running south and some lanes running north. The lanes going south, which are called your arteries, those are the ones that are having an issue, and we're not getting enough oxygen, because it sounded like there was one vessel that was shut off that, was not supplying oxygen and other nutrients clear to that wound in order to help it heal. So they went in and they were able to open up at this hospital the small vessels all the way down the calf and into the foot.
Yes.
And I bet that brought a smile to your face, and you're thinking, everything that I heard from the way to my heart, wow, they're actually doing.
Yes, it was a big relief. My whole family is like very grateful, and you kept up with any question I had. Like, I felt like very much support from you. Like, you're like a blessing for sure. My dad is like so grateful. His skin is growing now. His toe is still there. He has blood pumping. They're doing there's monitoring it. He does have bruising on his thigh, but yeah, so far they say it looks healthy. The infection's gone and he has no more gangrene. So
and he has every single piggy
yes,
intact.
the most important one too, his toe. Yeah, is unbelievable to think a splinter can cause a hole in your toe, but they definitely opened it up. Like, it was the toe was open very a lot when the first surgery they did at California Hospital, and that's just what led to it, in my opinion. Yeah, they didn't offer anything. Yeah.
It's interesting that that with your dad having diabetes, that no one, how old is your dad?
73.
73. At 73 years old, when 1 in 3 diabetics over the age of 50 has peripheral artery disease, that he was not tested sooner. So I assume before, and I hear this all the time, until a patient who is diabetic is a toe step away from amputation, meaning that they stubbed their toe, somehow a wound appeared, whether they were getting a pedicure or he ended up with a splinter and it just did not, the open wound after you removed the splinter just did not heal, got infected. And that's the first sign that they have poor circulation, because I would imagine that your dad probably has been told he has diabetic neuropathy.
Yeah, I'm not sure. My dad doesn't even speak English, so that's also why it was important for me to step in, because he was just going to say yes to amputation. He didn't realize the risks of it being cut off. And I started learning more about the risks and how a lot of people pass away because it just doesn't, heal as a diabetic. So yeah, it was like I was doing everything I could to prevent that. And I'm glad I found way to my heart in you, because I definitely never would have learned anything about it. And as the baby, I'm the only one that's like still has I have my bachelor's. So I feel like I had to do something, even though I'm the baby. My family, they just, I don't know. It's not even just my family in general. I think people don't do their research. Like, but for me, it was like
Yeah.
life or death situation. I was like, I have to. And I found you so quick, like maybe after an hour or two, like of doing research while I
But
was.
culturally, is it something that you feel that your family just, someone has a white coat, they have the title, they must have the only option for my dad?
Right. Yeah, that's the problem is, yeah, people just don't get a second opinion. And I think it's very important. And one of my coworkers who was diabetic, that's exactly what happened to his friend. Is he was getting offered amputation and then he went somewhere else and they saved his toe. And because I heard that story, that's when I did my research, and then I reached out to you, and yeah, you got me the best hospital I could ask for.
And he's standing on 2 feet, which is absolutely amazing. And you ended up saving your dad's piggies.
Yes, thank you. He's very grateful. He's changed his life a lot now. He's being more healthy and taking care of himself.
Fantastic. Thank you so much for joining us and courageously sharing your story and that of your dad's, and for advocating for him. We really appreciate you being here.
I appreciate you and your time and all about everything about this company. I am very grateful. So thank you.
Thank you. And we're going to continue to stay in touch because we're in this together. It's a lifelong journey.
Yes, thank you. I appreciate your support.
And I'd like to bring in Michelle. Michelle wants to share her story as well, which has been quite a journey, right, Michelle?
Oh, yeah. Yep. You hearing me okay?
We are. Gosh, where should we even begin with your story?
Well, I just practiced telling a friend my story in the shortest possible amount of time because I can really go off on these topics. But it started with a foot wound like everybody else. First, let me say I'm incredibly blessed that the only body part I've lost to date is one little toe, which, it's my little toe. So it's kind of a problem for me to not have it. I like it, but I'm good without it. I'm grateful I haven't lost everything. So let's start. I'm just going to run it through fast. And then, Kim, if you have any questions, maybe we can elaborate on what you find to be interesting.
Okay.
So toe wound, normal everyday toe wound, started with a blister. We need those wide toe box shoes, people. But it was a blister on the side of the little toe that expanded into a crater, got infected. We cured the infection once, came back. Now I have gangrene starting at the tip of my toe. Wound care specialist number one and podiatrist number one, they failed to do anything that healed. They did counterproductive things like putting iodine all over it, and just a number of really dumb things that I now realize should never have happened. So the wound progressed to gangrene at up to the first section of the little toe when I switched to another provider. And they're like, oh, well, this is going to need an amputation. They threw every antibiotic known to man at it. The antibiotic does not heal the infection. Now I'm thinking, gee, either I have something really, really alien and resistant in my toe, or the medicine's not getting to the toe. So there's when my wheels started turning right then. But, the second doctor also suggested, well, maybe we just take it off. It's just a little toe. I'm like, yeah, but it's my little toe. I don't want to lose a body part. I was talking about crazy things like maggots, let's get rid of the dead tissue, but all they want to do is debride. And shove more failed antibiotics at the situation. We even did hyperbaric oxygen therapy at an exorbitant amount of money it cost to do that. It had no effect on the problem. It should have had a little effect. It probably kept me from losing it sooner, but it did not heal or fix the problem. So here we are in an amputation. I go to the surgeon and I said, so if the situation is such that the antibiotics are not getting to the wound and healing it, what makes you think I'm going to be able to heal an amputation? And he said, well, we really don't have a choice at this point. We have to hope for the best. All right, so I did it. Guess what happened next? The wound of the amputation did not fully heal. The doctor's like, well, we can put some more stitches in it if you want. And I'm thinking to myself, let's drive the infection down further into the foot and see if that works, you know? So intuitively, I knew that sewing it shut was not the answer. So I continued to quote unquote offload, which it's amazing the lack of common sense. The wound and where it's located and the offloading strategies they suggested were not compatible. So I kind of did my own thing, cut the boot open, made a little hole for it, you know, all that stuff. But so it doesn't heal completely. We get some progress, does not heal completely. It starts to get more and more infected. This whole process is taking like a year at this point, almost a year. New Year's Eve, I just couldn't do it anymore. The pain was so incredible. I was obviously in CLI, but I didn't quite know it yet. But the pain was night and day. Narcotics were not working. Ibuprofen by the handful was no longer working. I couldn't sleep. I was sleeping sitting up. And the wound care doctor is still fooling around with different combinations of antibiotics. And I went into the office. I said, listen, whatever you guys are doing, it is not working. Luckily, the doctor was not there that day. It was a PA who said, let's just say you failed wound care and I want you to go to the ER. I'm like, you got it. I'm in. Go to the ER. They check me into the hospital. Of course, me being diabetic, I need to add that because we know it's an important causal factor. But I have blood sugars, you know, under 100 because I'm on keto. You know, my carbs are very low. My blood sugar is under control at the time. I need to add that. It's very important. So I'm in the hospital like, oh, we got a big diabetic foot wound here. Da, 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 da. She's infected. Do, 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 do. The attending's coming in. How are you feeling? I feel like shit. Oop, I shouldn't say that. I will refrain from using inappropriate language, but it's very hard at this part of the story. So here we are. I'm in the hospital. They're feeding this diabetic person, just like the previous speaker had said. They're feeding me all these carbs. I'm like, why are you giving me carbohydrates? You know, mashed potatoes, Jello, sugared Jello, and the like, when you know I'm diabetic. Oh, well, we can just give you more insulin. Great idea. So there's that, combined with the fact that they're sending me a podiatrist who's digging in my foot and I'm screaming. And he's like, you shouldn't feel this. I'm like, what do you mean? He said, well, you have neuropathy. I'm like, I don't have neuropathy. I feel absolutely everything. There's not a single part of my foot that I cannot feel. Well, that doesn't make sense. I'm like, no kidding. So he's digging around. He's like, well, at this point, you know, the infection is this, you know, we think it might be osteomyelitis, even though I had an MRI that ruled out osteomyelitis, I might add. They probably just missed it on the MRI. It has to be osteomyelitis. Best thing we can do for you right now maybe is, you know, amputate the foot. But first I'm going to debride this down to, like, oh, no debriding. And I'm already thinking, I'd read about arterial ulcers and the symptoms. I already know this has to be an arterial ulcer, the way it's acting, the way it's shaped, the pain, all of it. Not to mention my foot is now swollen up like a cantaloupe. So I am definitely sure that they're wrong at this point. So I said, no, you will not do debridement on me right now. And so the attending comes in. I hear you're giving my staff a hard time, or my other doctors. I'm like, you know what? I'm gonna give you a hard time too. You can go. I do not want you anymore because you are not solving my problem. But never mind, but get me somebody else and keep the podiatrist out of my room too. So the new doctor is a PA and I'm telling her my theory. I'm like, listen, I'm thinking right now, I'm not getting blood flow to this foot. Otherwise the antibiotics would have done something. And I'm thinking I want a vascular study. And she's like, you know what? I think you're onto something. You need to tell the doctor. So I said, I want a vascular study. Well, that's really not necessary. You have history of diabetes. You have history of smoking. All the more reason why I need a vascular study. We now know, right, Kim?
Exactly. So, and I'm
So
so impressed with your research on your own that you were able to put all the pieces together.
yeah. So they're still saying, you know, the vascular study is unnecessary. And I said, look, there's this thing called the ADA. I have diabetes. You are discriminating against me and making assumptions about this disease and what his process is and not giving me the medical care I'm asking you for. You have two choices here. I'm going to call a press conference or you're going to do a vascular study. And that's that. And sure enough, they had a guy come through, a vascular guy, and he's listening with the stethoscope. And he's like, you definitely need a vascular study. Guess what? My SFA is 90% blocked. There's almost nothing going on in the lower leg. The foot has absolutely no blood supply. It's a wonder that, so they discharged me from the hospital. I had an angioplasty shortly thereafter. And the wound was healed in 2 months.
That's
And it
incredible.
immediately showed signs of healing. The CLI regressed immediately. You know what that is, right? Everyone listening, if not, Kim already said it a little while ago. Critical limb, I say asthenia. She says it the right way, probably, because my knowledge is mostly book-based. But it was clearly that, and it regressed immediately upon getting blood flow to the foot, completely healed in 2 months. Now, this is where Weight of My Heart comes in. So it turns out that the nice vascular guy really wasn't a trained person. He probably did the angioplasty more roughly or not conservatively like he should have. It reblocked pretty quickly. And so this quote unquote limb saver tells me that we can't restore blood flow to the lower leg. We can't go into the lower leg with these procedures. And I'm like, I'm sorry, I just got done reading numerous medical journals that indicate that you can. And this woman who I met on Facebook is telling me that you can. Well, then go find someone who can. So Kim hooked me up with a great doctor. I've had a number of other procedures since. I have both legs. All that while I was sitting around waiting to heal wounds, the PAD started really affecting the other leg because I'm sedentary. I'm not moving for almost 2 years. I'm not walking. They're telling me to stay off it. So that, of course, made the situation worse. But we are now on the right track. I'm taking a wonderful medication. I have a great doctor I really trust because of Kim. And he recently told his PA, the PA and I had a debate about something. I don't remember what it was. I wanted proof that Repatha was useful and okay. And so he brought the doctor in. He's like, "Oh, Michelle, how you doing? Listen, she directs her own care." He said to the PA. So, all's well and ends well. Obviously, we're all fighting this disease. I'm now walking 2+ miles a day. Wounds are all healed at the moment, knock wood. I have my little dog, and she and I are out 2 to 3 times a day. And I'm not even counting the steps at work because we're not allowed to have our phones. But things are going very well, and it's largely because of getting the proper interventions and having the right people on my team.
Isn't it amazing, though, that it took to the point to which you were a toe step away from amputation to actually, know that something was actually going on? You didn't know prior, or did you have any symptoms prior to that wound? And you didn't have neuropathy?
None. I have nerve damage now from all this BS that went on with my leg, and the foot and the healing process. But no, I could feel everything. I got tested annually. There's no neuropathy.
Do you think just because you're so active and you're so driven that you might have overlooked maybe a little bit of weakness in your leg or some pain or some cramping at some point?
I knew it, and there was claudication. I just didn't know what it was called. And I chalked it up to being in my mid to late 40s. I just thought my body's starting to give out a little bit, but it didn't really slow me down until the wound issue. Yeah.
Wow. So your final piece of advice, your story is incredible, and you're inspiring in that you really have done your research and you found the right research, and you even went to the extent of reading scientific journals and the studies that were done that proved that below the knee and into the foot revascularization is possible when medically appropriate and in the right hands with the right tools that are advanced in techniques.
And I would just chalk it up too. I mean, I'm not like exceptionally intelligent. I'm pretty well educated. I have a couple of master's degrees and whatnot, but not in medicine. But I would chalk most of it up to common sense. I think a plumber could figure out this case. A plumber understands how liquid moves. Anybody who understands how liquid moves should be able to figure out that there was a blood flow problem.
And that's what's amazing to me. The moment that stood out in your story is when you said, "Hey, doctor, are the antibiotics actually getting to where they need? Are they able to actually reach this infection in the toe? And I would have thought at that point, and I think that's where you were a little frustrated as well, you would have thought that logically, common sense would have told them, bing, 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 light goes on, we need to do a vascular assessment.
Yep. It's shocking. And I know it happens every day, especially people with a diabetes diagnosis, people who are in poorer communities, people without adequate health insurance, people who are not able to advocate for themselves. I am sure that many of these amputations are unnecessary. And it's so sad that people have to go to that extreme to advocate for themselves.
Thank you so much, Michelle, for joining us, and also we really appreciate your time. I want to get to our next speaker, because as Michelle pointed out, I mean, a second opinion is really critical when it comes to limb salvage. And we have April on the line to share the story of she and her sister fighting to save her dad's limb. Thank you so much, April, for joining us. She needs to unmute and join us. April and her sister both reached out to me in two different ways. One actually reached out through our Facebook page, and the other one through our Lifesaver hotline. And they were explaining to me that their dad is on the verge of amputation. And so I got to know them very, very well, through this situation that, here he is. His foot is going gangrenous, and he's having a serious issue, and all the doctors want to do is actually amputate. I'm trying to get her right now. I think she's having problems with her phone. Let's see if we can get her to jump on here. I might just end up calling her on her phone as well, so that we can move this forward. You can hear it ringing. Let's see if hello, April.
Hello.
Hi. Good morning. Welcome. Thank you so much for sharing your story, that of your sister, and that of your dad.
Thank you so much for having us.
Would you mind bringing us back to the very beginning of this horrific journey that ultimately has, thankfully, I hear your dad is finally discharged. He was discharged yesterday, right?
The day before yesterday.
Fantastic. So take us back to the very beginning of this journey that is now, thankfully, we have a happy ending.
Yes. I still get a little emotional because it was really scary.
Yeah, it is. Just take your time.
Basically, my dad has never been to the doctor, to the hospital, since he was like 7 years old. So he's never been seen or treated for anything. So how it started was, so it started out with my dad. He couldn't breathe, and we had to call 911. When they brought him to the hospital, they thought that he had pneumonia, and so that's what they treated him for. And then after tests and labs, they found out that he was actually in heart failure. So then he started having pain in his legs, and they said it was diabetic neuropathy. And then he started getting these little pink spots, like on the bottom of his feet. So his cardiologist sent him to a vascular doctor who said he didn't have good blood flow. And they recommended him to see a podiatrist. So my dad winded up, so in this process, putting stents in the upper part of his legs by his groin. And we thought at first they were only going to do 3. They wound up doing on the upper legs, and then they ended up having to go back in and putting 3 more on each leg on the bottom part, and on the bottom of his legs. And so he got like 6 stents. The podiatrist that they sent him to cut his skin and his nails, and that's when his toes started turning black and purple. When we had asked him what it was, he said it was healing just fine, that it looked like it was healing. the podiatrist said that it looked like it was healing. So at my dad's next follow-up appointment, which was like 2 days later at the cardio doctor, she saw his feet and said it was not healing and that it was gangrene, and didn't understand why the podiatrist didn't do anything. So right away, she called our local hospital and did a direct admission for my dad. After talking to them, right away, they said that they wanted to take my dad's foot and maybe even his leg. So my sister and I started doing research, and that's how we came across Kim. Thank you so much, Kim, for advising us, because she advised my sister actually to contact another doctor named Dr. Joy. And at first, I think my sister did it because the nurses told us that if we asked for a second opinion, everything stopped. And they attempted to put, that's when they attempted to put the bottom stents in, but they couldn't do it. The cardiologist called another doctor, and luckily that was the one that Kim had recommended in the very first place. And they told us that they were going to amputate his toes to restore the blood flow, but Kim advised us that, hold on, let me see, sorry. So to restore the blood flow, and then, so we started advocating for him and said, no, we didn't want that done the other way around. And then Dr. Joy said, because it was, because initially he couldn't do the bottom stents because my dad's feet had too much pain. They were going to turn it around, and then they were going to they were going to amputate the toes and then do the stents. But then we started questioning if he did that, if he cut off the toes, then how, and we still didn't get the stents in, how is he going to get the blood flow to his toes? That would just make it go up more, the gangrene up more. And so we just wanted to be like such a mess, and it was so crazy for us. We were just going back and forth between everybody. And then, during this time, my dad started feeling that, or my sister as well, started feeling that our podiatrist, the one who was going to actually do the amputation, was just like, they didn't like him. They just didn't like him. And they felt that if he didn't do those things that he had done and, to send my dad to the hospital right away, that maybe all of this could have been prevented. So basically, it was just so crazy. All of this happened like within 2 weeks. He got the 6 stents and like in different procedures. Then we had to go back and forth and back and forth. And, my dad was not being exactly like very cooperative. They would tell him that he had to stop smoking, and he would just be like, well, I'm going to still smoke on I'll smoke and I'll quit on my own time. And just, I want to eat this food and I'll stop slowly. So as they were hearing what my dad was saying, that's how they wanted to just kind of go further than just his toes. They wanted to go up further and maybe so we had to talk to my dad and just tell my dad, hey, Dad, like, you need to get on board with everything. And, you just do what they say. You need to, like, follow their instructions, or else it's going to get worse. And we just really had to really, really, really be involved in what we're doing with my dad. And we were talking to everybody that we could talk to. Kim, all the doctors, like, they were calling us. Me and my sister were taking notes. We were talking to all the nurses. And we finally told them that, no, if we wanted the least then possible. We didn't know that we can ask that. We didn't know that we could tell them, we don't want you to cut the whole leg. We want you to save what you can save and just take like the bare minimum, the life-threatening parts, which was the toe and the heel. But they winded up only taking his big toes on both sides. And they restored blood flow, and right now everything is looking good. He was in the rehab center, and he just got home the other day. So that's pretty much
That's fantastic. I mean, there's so much that you've gone through, and it's really courageous. I mean, to be able to stand up where your dad's in the hospital, and to be able to stand up and say, no, I need blood flow restored. I need someone who's trained in opening up some of the small vessels in the calf and the foot. Why not at least try? If you're planning to cut off the leg anyway, perform a below the knee amputation, then what do we have to lose then that leg anyway at this point? And so you ended up getting a second opinion from a doctor who was willing to at least try to open up those vessels. And Dr. James Joy was able to do so. He was able to minimize the limbs that were amputated. And so you said that only one toe on each side has been amputated. He's discharged from the hospital. And the big question, how are you doing with his lifestyle modifications now that he's out? Is he picking up the cigarettes?
Actually, he not. He did ask my sister to get him puffer. I don't know what that is, but he asked my sister to get him puffer. And we said no, absolutely not. He wasn't too happy. He's still in a lot of pain, and because he's not there at the hospital, I haven't really got with my sister yet to see how she's doing his medication. She's in charge of all of that. But I know that he still has a lot of pain, but basically we just told my dad that if you come home, we're gonna take care of you the way that we know we need to take care of you, and not how you want us to take care of you.
Fantastic. Well, we're going to wish you the best. Thank you so much to get to work, and we just appreciate your courage and your inspiration, to always seek an opinion and make sure that doctors at least attempt to restore inline flow prior to any amputation. That is the Society for Vascular Surgery guidelines, as well as that of the American Heart Association. So really important that people advocate for themselves and see if it's possible to minimize any sort of amputations that are occurring. Thank you, April. We really appreciate your time, and we'll keep in touch. And I'm going to be there to support your dad. As I have said to everyone, it's a lifelong journey, and we are always here for you.
Thank you. And I did want to add one more thing, if that's okay.
Sure.
The thing that I recommend the most, and Kim also advised us on this, is that be very involved, ask questions, do your research, join your support groups, reach out like how we did with Kim, get all the information that you can get, and just really, really be informed. If you don't understand anything, ask, look it up, take notes, so that way you can remember things. Get to know your nurses, and if your patient or your loved one, you are going to be there for a long time, be nice to your nurses, be nice to your doctors, give them thank you notes, buy them coffee if you can. Just things like that they appreciate, and you know what, they do tend to take a little better care when you show them appreciation.
Yes. Thank you so much. That is such a nice thing to say, because our hospitals and facilities are all short-staffed right now, and they're overburdened and overworked, and we just really appreciate the effort that they have. And it is really nice to just take a deep breath and be able to offer appreciation where you can. Thank you so much, April, again for your time and for joining us. And we'll talk to you very soon.
All right, thank you guys.
I'd like to bring in now Steve. Steve is also here. He is going to talk about getting a second opinion and just how important it is. Steve, thank you so much for being here and sharing your journey and the importance of a second opinion.
Well, thank you, Kim. I'm glad to be here. I hope you can hear me.
We can.
Okay, let me start. I'm a young 73-year-old male. I had a heart attack 4.5 years ago, which came as a surprise. I wasn't expecting that. Recovered extremely fast from it, got active again, got on the healthy lifestyle. And then 2 years after that, I'm out walking, and it was like somebody shot me in the calf, which I discovered was claudication. Now, all this was before I discovered you and the weight of my heart and how great you guys are. So I walked through it probably for a month, figuring maybe I just tore a muscle. Didn't get any better. Called my cardiologist because I was taking rosuvastatin, a statin drug. And he said, yeah, it could be that. Why don't you stop it for 3 weeks and we'll see what happens. So I stopped the statin for 3 weeks. Did not get any better. I called him back and he really didn't offer much. He just said, well, just keep on walking and keep in touch. I said, well, sort of funny, but okay. So I figured, well, if it's not the drug, maybe I did hurt a muscle. So I went to my orthopedic surgeon and he checked me out and he said, no, he said, your leg muscle is fine. He goes, let's do a pulse test. I said, okay. So he did it. And he says, you have a very weak pulse in your left leg. He said, I can order tests for you. I said, I'll go back to my cardiologist, but I appreciate it. So now I call my cardiologist back. He goes, well, that's good. He says, if you want, I can order some tests for you. I said, well, that may be nice, doc. Let's do that. So he did. Came back, I had a totally blocked left iliac. He said, I'm going to refer you to a vascular surgeon in our practice group. I said, okay. So 2 months later, I get an appointment with him. First words out of his mouth is, you need a fem-fem bypass. I said, okay, what is that? He explained it. Take, the blood from one side to the other. I said, what happens if the other side blocks? He goes, well, that's a good question. Never did answer it. I said, is there anything less invasive? He says, no, not for you. You need this bypass. I said, okay, I appreciate it. I said, I don't think I'll be using you. I have a sister-in-law who had a top position at Ascension Health. I asked her, I said, find me the best vascular surgeon that you're aware of within your group. She did. I went to him. He says, a wire can easily be passed through that blockage. He said, be glad you did not get to fem-fem. He then referred me to a interventional cardiologist. He got me in 9 o'clock in the morning. I walked out at 1 o'clock pain-free. That was 2.5 years ago. Then I discovered you right after I had that, and we talked a little bit. Wish I knew you before, probably would have saved me 6 months of pain. But anyway, if I did not get that second opinion, I would have had a tube running between my intestines with the possibility of blocking. So that's my story. Whenever I need a procedure now, I will always get a second opinion.
Yeah, no, I think that's critical. And for people to understand, a fem-fem bypass is where they have a tube that reroutes blood flow from one leg to another. And the issue that we have is, we tend to see those go down frequently because in many people, by the time they have this fem-fem, the legs are already mirroring each other. So there's disease in both legs. And if the disease progresses in the one leg that is feeding the other, then both are going to end up suffering. And that's going to be a problem. And so you're probably thankful, at least at this point, you're 70 years old, you're out there, you're living your life. You've only had a little puncture with a wire and a balloon going into your vessels. Just kiss it, just push that plaque aside just a little bit so you can get out and get moving and be on your way, because you're a military guy, right?
Yes, I am. Former Marine.
Thank you so much for your service. And I bet you're feeling so good. How much are you walking now?
I probably walk anywhere from 5 to 7 miles a day walking. And then I go to Planet Fitness 5 days a week for 90 minutes. I teach Wing Chun martial arts, and I just started taking up Korean sword fighting, Koryo Gumdo. So it makes my wife happy because I'm never around, but it keeps me busy.
That's fantastic. I mean, do you ever wonder if, having, the high risk factors, what if doctors had been more on the preventative side and had said, hey, you have these high risk factors. we're going to perform this ankle brachial index test or ABI test to measure between, the blood pressure in your legs versus your arms, just to see if you were on the road to plaque also building up in your legs.
No, nobody ever did. And I wasn't astute enough I didn't know about it, basically. I should have been smarter probably. But after the fact, I asked my primary care guy, I said, Doc, how come you've never done a pulse test on me or others?
Right.
And he just sort of looked at me like, don't waste my time asking these questions. We'll see you in 6 months or a year or whatever, and waved me off. So, yeah, it's a shame. But I feel great now. My interventional cardiologist did say there's a 50% chance of it reblocking in 5 years. And I said, well, what happens then? He said, don't worry about it. We'll go back in, we'll clean it up. So that made me feel a lot better than a bypass.
I love that. But also by the same token, these doctors can go in there and clean things out, clean things out, clean things out. But it's really up to the patient when it comes to peripheral artery disease to be a true partner in care and do their part in making sure they're compliant with the medications as prescribed, making sure that you're doing a regular walking program. And what we have found as well, and we'll get into it a little bit later, is, as Steve just mentioned, is getting to the gym and doing some resistance training and weightlifting and things like that to help build back the muscle, because we find with the legs, with less blood flow, your muscle kind of gets a little weak in there. And so if you're in there pushing it, your body is answering, it's building its collateral vessels and helping to do its part, right, to help keep that blood flowing down to your feet so you can remain intact.
Absolutely. And I'm not afraid to push it. People say, aren't you worried that, you could have another heart attack? I said, yeah, I may, but I'm going to enjoy it if I do. So
thank you so much, Steve, for your story. We really appreciate you. It's amazing and very inspirational.
thank you, Kim.
I'd like to bring in Douglas. Douglas also has a story to share about the importance of getting a second opinion. Douglas, thank you so much for being here and offering to share your story as well.
Good afternoon.
So talk about, why is it important to get a second opinion, and what difference could that have made in your case?
Well, listening to the stories today, I just think about one thing. I have an aorta bifemoral bypass. I have an axial bifemoral bypass. Both of them have failed. And I remember sitting in a chair in Houma, Louisiana, after I met y'all, that I was able to get to Dr. Walker in Louisiana. And listening to the stories today, I remember him walking in and saying, Mr. Salisbury, if you had seen me 2 years ago, you would not have had all these procedures you've had done now, because we know how to get through what we could have fixed the first time. And it was only after that I met him, after meeting you in the way to my heart, that I remember driving home from Houma, Louisiana that time thinking, I wish I had known this 2.5 years ago. So it's that is that important. And that's why I think today the part about education for us as patients is so important. Is that we become educated on our on PAD and everything we need to know about it, so that when we sit, like Steve said, when I asked my PC the second time, he said, just do what they tell you to do. And it was like, oh, well, okay. So I had an aorta bifemoral bypass, because, they're the doctors, they got the coats on and they know what they're doing, right? And until I got educated, which y'all helped me get educated, it made a big difference in where I'm at now. And I think that brings back that whole point about us as patients needing to become educated on our care and really becoming engaged in the best advocates for ourselves, like Michelle did. Like every story you heard this morning, how they became educated, and then they actually said, no, wait a minute, time out. We're not going here. Time out. We're not doing this. Time out. Because what about this? What about this? And don't you wonder, I have a doctor standing. So I was in the hospital a couple months ago. A doctor walked in and said, you know what? I never heard of your condition. And my first thought was, well, you need to turn around and walk right back out the door then, because it's like, how can you stand here and say that and you've never heard of myectomy when it's a big deal? And to say, actually to be able to hear him say, I had to look it up this morning. Well, you want to touch me now? No, I don't think so.
Wow, that's amazing. I mean, even with your heart as well. And I wanted to bring up the case that yours was not only an issue of the legs, it was also an issue of the heart. And I think that this is important, that 3 in 5 people who suffer a heart attack have PAD. And I think that your story exemplifies the importance of being proactive as a patient, that if you not only have CAD, coronary artery disease, and you have ended up with a heart cath or not, making sure that the doctor does check your legs, right? Because that is a high risk factor. But vice versa, if you do have PAD, it is imperative that you get your heart checked. But no one checked your heart until it had already progressed to a point where you needed to get in and be sent through the emergency room and have an immediate procedure.
I was having a procedure done in Houston, Texas, and I was on the table, gowned up, everything, and the doctor looked at me and he goes, "How are you feeling?" I said, "I don't feel good right now." And they put all the leads on me and everything and checked my heart. And he goes, "You're having a stroke. You're out of here." So I went straight to Methodist. And I remember I went to Methodist in Houston, and in 10 minutes, this doctor walked into the room. He goes, "We're going straight to surgery, and we're going to put a defibrillator in you, and we're going to check your heart." And I'm thinking to myself, hold on, wait a minute. I've only been in this room 10 minutes. I'm cold. Give me a warm blanket. I'm cold. And now you're telling me I'm going to have heart surgery. And it's like, wait a minute, what's going on here? And that's when, through that process, is when I found out I had apical hydrotropic cardiomyopathy. And that's 3 years after dealing with all these other surgeries that I found this out. And next thing I know, I'm having open heart surgery in the hospital over a month. And my defibrillator went off 3 times while I was in the hospital. So it's like, and that's why again, we have to stress the importance of education, asking these questions, becoming engaged in our own care.
Yeah. And being very proactive and encouraging doctors to be more proactive, whether it's a primary care physician, whether it's a podiatrist, whether it's a vascular specialist or a cardiologist, to be proactive with people who either have CAD or have PAD, to take a holistic approach to the care of these individuals, because we have a human superhighway that's all connected. And if you have plaque buildup in one area, it is likely occurring in other areas. If you have a vascular issue in one area, likely in other areas as well. So improve education, take a holistic approach, and make sure, especially for patients, seek a second opinion. I believe we have Valerie that is here as well. I'm not sure. I just want to make sure. Is Valerie here and wanting to share her story before we move on? Valerie? No? Okay. So Valerie is not on. I just wanted to make sure, because she had mentioned to me a few moments ago she wanted to speak and she might have fallen off. I'd like to move on to our next session. Thank you so much to all who have participated in the session and driving home the importance of getting a second opinion. But I want to also turn to lifestyle modifications, because I think that they're paramount in improving your life and your limb. Before any procedure, we know that if PAD is diagnosed in its early stages, walking can truly work for so many. If a committed walking regimen, though, doesn't start improving symptoms within just a few months, then we know it's worth having that discussion with your vascular specialist about a potential intervention and surgical options. But several patients on our panel who were on deck for amputation and not the best candidates for either intervention or surgical options have actually been able to defy all odds and persevere with a regimented exercise program, walking in particular. And we are going to hear their stories now, and we hope that they actually inspire you to push through and build your own natural bypass. I want to bring in, first off, because I think that he is literally so incredible, Kevin Morgan, who just came back from Finland, where he competed in the World Ironman Championship. Kevin, you continue to absolutely amaze me with your perseverance and just continuing to push past your PAD, as well as you had an aneurysm as well, an aortic aneurysm.
Yeah, where would you like me to start?
I'd love for you to start with, I know we've talked about your aneurysm before. I think it's good because that was your first indication that you had some sort of vascular issue going on, and then we'll quickly get to what happened and how you discovered PAD and how you were able to persevere with PAD with just an exercise program.
Okay, well, it goes back further than my aortic aneurysm. Right now, I'm
Does it?
80 years old, but back in my early 30s, I was studying human platelet function using my own blood and discovered I had severe genetic hypertriglyceridemia, not a hypercholesterolemia, but I knew this was going to lead to trouble. I mean, I have extensive training in pathology, which really helped a lot. Anyway, I tried to correct that with diet. Diet helped somewhat. And then I consulted with a cardiologist who put me on statins, which I stayed on for a few months. It did no good. And then I saw the muscle lesions induced by statins in the soleus muscle of a rat and never took them again. Essentially induces rhabdomyolysis, which is destruction of muscle. And then, fortunately, in my early 50s, I started Ironman training, and I was still monitoring my blood lipids. Remember, my resting triglycerides were over 2,000 instead of being about 100. And my HDL was less than 20 instead of being 80. At that point, 1 year into Ironman training, my HDL went up to 80, or just up to close to 80. My triglycerides dropped down below 150. So exercise corrected my genetic hypertriglyceridemia, but I knew eventually it would lead to arteriosclerosis. It was bound to get me eventually. In 2009, I ran the Boston Marathon, so clearly I learned how to run. And but in 2014, my running fell apart. I started getting numb feet and later pain in my calves. I self-diagnosed the aortic aneurysm in 2010 at UNC. And Mark Farber's team put in a stent in my distal aorta, which is still keeping me alive today. And fortunately, here I was with medical training and a really good vascular surgeon. So I went to my routine aortic aneurysm stent graft evaluation in 2015, and they ran as a routine an ABI test. And I was told by Mark I definitely had fairly severe PAD due to blockage of my right popliteal artery, and the left one was on the way. I asked about angioplasty or a stent. He said, with your particular condition, that's extremely dangerous and you could lose your leg. He recommended a walking program. Funny, surgeons are funny people, but this guy's really great. But he's definitely on the spectrum, as am I. Anyway, he suggested 3 30-minute walks a week. I didn't say anything, but I mean, I ran another marathon 2 weeks later up in Maine, and I had the same problem. So then I realized I had PAD, and I started to think. And over the next 7 years, I've slowly managed to not just reverse the progression, but to make things better, but it's been quite complicated. I describe a lot of the details in a book that I think Kim knows about already. I thought, well, I'm getting trouble getting blood to my feet due to blockage of my popliteal arteries. And I can grow collaterals with exercise. I was aware of that. And I've probably already grown a lot as it was with all my training. I've been doing Ironman training for about 25 years. It's just part of my life. So the first thing I thought, well, the pulsatile pressure from my systolic heartbeat will drive blood to my feet. So I need to try and prevent any reverse pressure waves. So I went to a very low impact running style. Then I thought about blood flow through my feet, and there are arteries that run between your metatarsal bones. So I started working with yoga toes and spreading my feet. That certainly helped. And then I was thinking about how can I help venous return? Well, the veins have valves, and they pass up through my calves. So I noticed that if I flex my toes, it would contract my gastrocnemius and soleus muscles. And so I did that as part of my walking and running. So I gently stroked the ground, and that definitely improved things. I focused very much on running with my whole body. That's a long story. I do a lot of cross training, of course, as a triathlete, Ironman distance triathlete. And water running is really a great way to get training for running without actually putting the stress on the blood supply to your feet. And then recently, I changed a couple more things. The most important one of which was contracting and using the muscles in my feet. So now when I run, I almost pull myself along by my toes that grasp the ground, but you have to do it in a controlled way. And I would say that all these different methods I'm using, which are based on understanding the anatomy and physiology of the blood supply to my lower limbs, is allowing me to continue triathlons, even though I'm at the back of the pack. But I hate to say it, but 80-year-olds are always at the back of the pack. There's not much you can do about that. And I found hearing these stories about people getting really bad advice from doctors, and that has not been the case for me. It really is true. Self-education is critical. I was very fortunate to already have medical training as a veterinarian and pathologist. But if people don't have that training, if it wasn't for Kim, a lot of people would have lost a lot more feet and toes and legs. And so what you're doing, Kim, is great. And so I work on it. I write, I got my little book out there that describes what to do. I can understand why most people can't do that amount of training right now. But if you have a walking program, it is critical to keep pushing. You have to keep pushing the boundaries all the time. If I stop running, I start having trouble walking. If I don't walk long distances, I have trouble walking short distances, because those collaterals that you grow through training, they don't want to be there. They'll disappear if you don't use them. And they also, for the first mile or two, take a while to open up. So don't assess your progress by the first mile, because it's the worst mile. And it always is in running anyway, PAD or no PAD. And you've got to keep pushing. And so I push by running, but I cross-train with cycling and swimming and all that stuff. But what you're doing is right. Self-educate, number one. Number two, have an exercise program and exercise intelligently. If you can get as far as running, don't heel strike. Study body movement, but definitely understand the anatomy and physiology of lower limb blood supply. It's really important. And you'll be surprised what you can do. Finishing Worlds was really tough for me. It was a half, it's a standard half Ironman race under really, really hard conditions. The course was extremely hilly, which is the worst thing possible with PAD. But I managed to finish. I finished past the cutoff, but they kept the whole course open for me. And there was a whole crowd of people seeing me finishing, and they handed me a medal. And when they put the medal around my neck, you know what I said? I said, "Can I have some pizza instead?" So people thought that was pretty funny, but that's what I really wanted. Anyway, exercise works, but you have to keep pushing the boundaries. That's my story. And no, I'm not on any.
No, I think I'm
not on any drugs at all.
It's so interesting because you would think we had Larry Shorty Coleman, a legendary Harlem Globetrotter, at the beginning of our fireside keynote conversation. And he couldn't believe that because he was so athletic and always running and active and doing his jump shot, like how could he develop plaque in his leg arteries? And why wouldn't he have already enough collaterals around the blockages to the feet? And I'm sure with you, being a marathon runner, that it had to have crossed your mind as well. And I would think that it would almost be demotivational that, wow, I have been working out and working out and working out, and yet I still have plaque buildup in my legs.
Well, I was fortunate to know that I had a genetic hypertriglyceridemia, so I was waiting for this to kick in. If you didn't know that, I can see how it would be demoralizing. And I honestly think this is 80% mental grit and 20% training. If you don't have the mental grit, it will break you down. You'll start drinking or taking drugs because of the pain, and you'll give up. I mean, it will break you down. And so the mental part of the story is really important.
And what goes through your mind? What do you tell yourself on a daily basis to just push through and persevere with those leg cramps?
I often say to myself, stop being a baby, Kevin, and get on and damn well do it. And then I do.
Good for you. I mean, not everyone can. I mean, it is a painful, it's like you have a tourniquet wrapped around your leg and it is cutting off all the nutrients, in the blood, and your nerves are screaming and your muscles are screaming and they're like, feed me, feed me, feed me. But, with you, how did you exercise different in order to actually, because I could imagine now your pain, your cramping is actually less than it was when you initially went to the vascular surgeon and said, can you do anything for me surgically or endovascularly?
Yeah, and he recommended against it and recommended the walking program. So then, I just applied basic physiological and anatomical principles to solving the problem. The thing about dealing with pain is with PAD or with competitive cycling is all about pain control. If you watch people winning the Tour de France, you just look at their face. Those people are in agony, but you have to know the difference between good pain and bad pain. Good pain is when you are training yourself and pushing your limits. Bad pain is when you are injuring yourself or overtraining. And I've been doing Ironman for 25 years. I've always had a sport of one kind or another. And a lot of it involved intense cycling. So I'm very used to dealing with pain. Pain doesn't stop me doing what I'm doing. And it's the same for PAD. And I've been fighting this PAD now for nearly 8 years. And I'm definitely making progress as I learn new tricks. But you have to be patient. Another thing that's really important is when you're in pain, relax. Think about that.
I know it's counterintuitive, right?
You kind of crunch and tense up. All that does is contract muscles and impairs blood flow. It doesn't help. So learning to relax in spite of the pain, especially your feet, is quite important. And it's a trick. Like in competitive cycling, if you're doing a really hard hill climb, you have to relax your hips because most of your power comes from your core on the bike. And so if you don't relax your hips, things tighten up and performance drops and pain increases. So I trained myself to relax myself on hill climbs, and I could do a 6,000-foot hill climb without any problems at all. And because of relaxing my hips. And so you learn these tricks. You have to listen to your body. Just got to listen to it. Don't, for heaven's sake, put things in your ears and podcast it or listen to music. How can you listen to your body if you're being distracted by nonsense in your ears? So that's all part of it. So when you get pain with PAD, look at the pain. Don't try and run away from the pain. If you look at the pain, you will find it diminishes. It's just a fact. So you have to relax and you have to look at the pain. It's like, yeah, right, whatever. But it's actually, that's what you need to do.
And so I'd like you to share the name of your book. It's on Amazon because you share all of these tips and tricks, and you do have a PhD. So there's a lot of science behind the theories that you present in your book. Would you mind sharing it?
Yeah, it's How to Fight the Crippling Pain of Peripheral Arterial Disease is the name of the book. And my author name is Kevin Thomas Morgan. I do have a PhD, but it's in neuropathology. Most of my real training came from studying general pathology for the American Pathology Boards. But in this case, I mean, I'm basically a researcher. So my approach to a problem is fully understand it. And I do that by, number one, I read, I hear other people's stories. Listening to today's stories, we're like, oh my God, I've seen this stuff. It's terrible. And this is why patients need to realize they are their own best physician. Their physician or surgeon is just a tool in their toolbox, as is their nutritionist and how is their friends and their lifestyle. But they have to be their own physician and understand the condition. You don't have to understand the whole of pathology. You just understand plumbing of your feet. That's all you have to know.
Right.
But you have to understand that plumbing.
Thank you so much, Kevin. And if anyone wants some help buying that book, please go ahead and direct message me, KYM@thewaytomyheart.org, and I'm happy to get it and send it to you. Thank you, Kevin. You're such an inspiration. We really appreciate, all of your tips and the motivation that you provide across our network. So thank you again.
Yeah, one marketing comment. Reviews on Amazon definitely help, and they're very hard to get. I really appreciate it. And anyone can get a free copy of the ebook by going to my website. If you go to scroll down to the button, you can download the ebook for free, which you can read on your phone very easily. Anyone with PAD I think it would help them to read that book. It really, it's always progressing. I made a video describing the latest advances in my attempts to stay young and stay on the Ironman course, but I don't do anything as much as Kim does, who really helps lots of people.
And I hear that Kevin Morgan is also going to be the cover boy for a magazine that is coming out very soon. I think it's called Health Grades, and you usually see this magazine in primary care offices. So congratulations to you on that. Hopefully not only inspiring people here, but in other places as well. So thank you for all you do.
Thanks, Kim. You're great.
I'd like to bring in VJ, who is actually leading by example and showing us how it's done. VJ, look at you on your treadmill. You are certainly getting in your steps. I've been watching you this whole conference. I think that you have now gotten in nearly an hour already on your treadmill.
Hopefully you can hear me. I'm always on my treadmill. I love my treadmill.
Has this been something that you've done your entire life, or is this something simply post PAD diagnosis?
I discovered walking as a hobby probably about 2019. Loved it, getting out in the fresh air. And it was brilliant. But COVID happened and the lockdown, and that made it quite difficult to get out. So I started doing YouTube videos on how to walk inside your house. And I just really enjoyed hiking, getting out, exploring different places, and it was all going wonderfully well. And then I went on holiday for a couple of weeks at a time over the summer of 2022. And then when I came back, I went to go on a hike in September last year. And my legs started cramping. It just suddenly, after walking 20,000 steps every day at least, just set off walking as normal. And it's like, oh, my legs hurts. And kind of just thought, oh, I've strained the muscle. Just need to rest it for a few days. So I rested it for a few days and then tried to walk again. And I got around about 150 meters and it just started cramping again to the point where I had to stop. And that happened for a few weeks. And I got quite alarmed by that. So I went to the doctors and they said I'd worn my hip bone out by all the walking that I did. They said I had sciatica, so they sent me off for x-rays. And I got lucky. I was Googling and I came across the term intermittent claudication. And then I got looking into it and it said it was peripheral artery disease. And I thought, oh, that's not me. I'm fit and healthy. I'm young. It can't be me. And then I tried to find a pulse in my right foot and couldn't find one. So I went back to the doctors and said, just humour me. Just check my right foot and tell me you can find a pulse and I'll leave you alone in peace. And he couldn't find a pulse in my right foot either. So within a week, I saw the specialist. They did the treadmill test, an ABI test. And then they told me I had PAD. And they did an ultrasound as well. So they detected where all the blockages were. And it was weird because I loved what Kevin was just saying about good pain versus bad pain. I think for a few weeks, I barely walked because I thought I was doing more harm than good. I was scared because I thought I'd damaged the muscle and you should rest it. And as soon as I found out I had PAD, well, then it's a fight to be fought and I'm going to win it. And it was just right. And I just got immediately back to walking, went off hiking, climbed hills and mountains and just thought, stop this. I'm not having it. And I've just walked every day since. For me, I embrace the pain. I think it's a good thing. It means that I'm working the leg hard. It means that I'm pushing through those collateral arteries. And I don't like pain. I don't think anybody likes pain. But for me, it just makes me feel like I'm achieving something positive. I'm achieving what I'm meant to be doing. And when I found that after about 6 months, walking in itself wasn't causing any problems at all. I could walk miles and miles and no pain. That's when I started aiming for the mountains really high because hill climbing was still hurting. So that's why now, at least once a week, I've downloaded the All Trails app. So I find a nearest hill, nearest mountain, and just get in my car and I just drive to it and I just set off and I just walk it. And I just feel really exhilarated afterwards. I feel great and I love it. So then I heard about the Yorkshire 3 Peaks challenge and I thought, well, I'm doing it.
Explain the 3 Peaks challenge for people who don't know how rigorous this
crazy.
is and
It's
what
crazy.
you accomplish.
The crazy thing is a lot of people can't do it, even if they don't have PAD, even if they're regular gym goers. So I felt really scared trying to do it me without, years of training. But basically it's a circular hike. It's 25 miles and you have to complete it within 12 hours to get the medal and tick off the challenge. And it involves climbing the 3 highest peaks in Yorkshire. And it's relentless. I did it in 11 hours and 32 minutes and I had to run most of the last 9 miles back. And I don't run, but when I got to the top of the 3rd peak, I thought I can do this. I've got to get there before that 12-hour mark. So yeah, just went for it, hit the ground running and made it.
Incredible. It's interesting though that your claudication started when you started your walking regimen. And that must have been a little frustrating for you, right? Were you active at all before? What was a day in the life like for you?
Walking, I was desk-based. I'm an academic, a researcher like Kevin. So I sat at my desk all day, every day. I love reading. I love my books. So I just would get up in the morning. I'd sit at my computer all day, all evening. And I wouldn't walk anywhere. I'd always drive to the shops. And I was feeling a bit despondent, like I didn't have a goal or something, a hobby outside of work. And I got talking to my friend and she said, well, I love going walking. You should come with me. So I went on a walk one Sunday and I just loved it. I felt exhilarated. I felt really, really exhilarated. And I intrinsically knew that I found my new passion in life. I just knew. I just looked at her and said, this is me. This is what I want to do with my spare time. And that's why when I got diagnosed and the claudication kicked in, I really cried because I thought, I'm never going to hike again. How can I hike now? It's a dream gone. And what am I going to do with myself? But yeah, I think everybody feels like that when they get the diagnosis. It's a real sense of overwhelmingly panic. But then, Kim, I found your group, The Way to My Heart, and I found that I posted in those very, very early days of my diagnosis, and I think it was Kathy who replied, and Patricia Kennedy replied, and they were like, forget this. This isn't a death sentence. You've got it. Keep going, and you're going to be absolutely fine. And you said about the lady who was in her 80s or 90s. She'd had it for years.
Yep.
And it was just so comforting. I can't express my gratitude to your group and to yourself for giving me that reassurance that I needed in those very first few days of being diagnosed. I was just so overwhelmed by everything. And to be told that it doesn't need to be a death sentence, you can do all of these things. I got lucky as well. The specialist at the hospital, I just wanted surgery because I thought, all right, you have surgery, they fix it, it goes away. And the surgeon just said to me, he said, you're really young. It's got a life expiration date on these surgeries. So leave it to the very last chance. He said, if you come to me and say you can't function day-to-day life because you're in so much pain, we will do the surgery then. But don't rush it. And I was so lucky because I hear the horror stories where people have just gone in very early on and said, right, we'll do bypasses, we'll do this. And so they didn't. You just sent me away with a walking regimen. And you were saying something
Right.
earlier.
And it's, go ahead.
What you were saying to Kevin is that I was already doing 20,000 steps. So it was really scary when the doctor was saying to me, well, all you've got to do is walk for 30 minutes a day. And it's like, I'm already doing that.
So how is it going to make a difference if I'm already out there walking? I'm walking 20,000 steps.
Yeah.
Like, how many more steps do I need?
Well, that was a dangerous thing.
Pen?
That's when I started going up to 30,000 a day, thinking, well, I've got to do more steps. And I ran out of hours in the day. You know, there's only so many hours you've got. And that's when I realized I needed to find more effective ways of walking. So the hill climbing, hiking over mixed terrains, making it more challenging itself. And that's when I really started pushing the hiking and the hill climbing. And I love it now. I genuinely love it. It's brilliant.
Good for you. I am so inspired. Please keep it up. And thank you so much. I know that it's always tough to share the story, but you have such a contagious energy and we really appreciate you. And I know that so many are going to be inspired by both you and Kevin and how you've been able to persevere, because it really is not as easy as it may seem to push through that pain, and not everyone can do it. But if you can, and you can really get your mind, you know, set, you know, that I'm going to do this, then it can work. And you and Kevin are both proof of that. So
I had 2 natural childbirths. So if you can do that, you can do anything.
That's true. Yes, Kevin.
I mean, apart from Michigan Weatherby, I was a veterinarian. I spent time in Weatherby, Yorkshire. Great state, great county. Anyway, increasingly I use hill repeats, running up hills. You have to take it to the point of pain to make progress, which is what your last speaker just said. So hill repeats are really useful. That's all I wanted to say. And
thank you for that, Kevin.
Great place. Bagone.
Well, thank you for the opportunity to talk as well, Kim. So love to all of you. I'm going to have to get off very shortly, but I'll stay for another 10 minutes.
We appreciate you. I want to get to Rachel. She has a very different story, and it's the story of so many that are in our network that end up with a very late diagnosis where walking may not be enough. Rachel, go ahead and unmute, and I'd love for you to join us and share your story as well. Hi, Rachel. Thank you.
Hiya. Nice to meet you. So basically 6 years ago, I started getting a lot of cramps in the legs. The walking became an issue. I went to the GP, and because my thoracic disc came out in my back and I had it fixed and I've got 2 discs out at the bottom, they kept putting it down to trapped nerves or sciatica, and just told me to do what I was doing, keep taking the medication. And then 4 years ago, we was out with the dogs and I was walking, and that was it. It was just a complete stop. I phoned the doctors while I was stood there, and they said, if you can get here. I said, well, I've got no chance. My legs won't move. It was like my legs were in a cement bag. We finally got to the doctors a few hours later. He had a look at me, checked my feet, and said he couldn't find a pulse in either foot. So I was rushed straight off to the hospital, did all the scans, and they said that I had blockages in both legs. They told me to walk, see if we could get it going, but obviously the walking became a huge issue for me. It started to increasingly get worse. I had to stop work. And then last year I had an angioplasty in the left leg because they said the left was worse than the right. Within 3 weeks, it failed. I went straight back and said, look, this pain's come back in the calf. I feel like my leg's going to explode. And they said, yes, it's failed. So the surgeon that I saw said I couldn't have a stent because I've got an allergy to nickel. And then they rescheduled the surgery for June this year. And I was on the table and I was screaming from start to finish. They told me it'd be 40 minutes long. I was on the table for over 4 hours. Something went wrong halfway through. Everyone was rushing out. He said, we need to do a thing called an up and over and put a puncture in the right side and go back through. He said it was blocked right up to my groin. So anyway, I went home. I felt great. The left leg felt amazing. Once again, obviously getting over the surgery, that's one part. I went back 3 weeks later and said, something doesn't feel right. I'm in a lot of pain. They told me that they'd done muscle damage and nerve damage, but everything seemed fine. 2 weeks ago, I rang them back up again and I said, look, you're going to think I'm going mad, but something's really off with my leg. The pain is worse than it ever was. So they said, come down. I went down. The nurse seemed very patronizing and I was starting to get really upset and emotional because I felt like she didn't believe me. She said she finally found a pulse in my foot and said, oh, that seemed great. And then I thought to myself, I can't leave here without help because I suffer a lot with a lot of other problems. And my doctor walked past and I said, Mrs. Khan, I said, please, can I just speak to you for a minute? I said, I feel like this lady doesn't believe me. And her exact words to me was, you was only here 2 weeks ago and we scanned you and everything was fine. I said, but anything can happen. I said, I wouldn't be here if I didn't need to be. I'm in absolute agony. I'm struggling to walk around my house. I can't get up the stairs. I'm actually living in my dining room. I've got a toilet next door, which is just handy, and the kitchen's there. So anyway, she went to the scan lady and said, yeah, they can fit you in. And I said to the lady, if anything's wrong, please just nod your head because then I know it's not in my head. She nodded her head. I came out. Mrs. Khan says, can you take a seat? She said, I'm really sorry to tell you, but the stent's collapsed in the bottom half of your leg. And I said, what stent? I didn't even know I had a stent put in. I was told I couldn't have one. She said, well, I wasn't your surgeon. I don't know. So she said, all I know is we're going to have to take veins out of both arms on your leg because I did have a scan last year and they said my veins weren't very good. I got this letter from her and this is what's so confusing. So the man rung me up after the surgery and I said to him, what are you going to do about the right leg? And he said to me, just walk. That'll cure it. And I said, you're having a laugh, aren't you? How can I walk when I'm having problems still with this leg? And I was getting so upset. And I said, all right, just leave it. I'll speak to you in 6 months. The letter came, I tore it up. And then I got this other letter from her saying that I reviewed Rachel in clinic. She was previously diagnosed with bilateral SFA occlusions. She then went to have a left-sided FFA angioplasty and stent in early June. Immediately post-procedure on the 9th of June, she had a duplex scan that showed the vessel in patient since, however, has had increasing rest pain and where she is having no sleep, back in the chair, barely gets any sleep, doesn't get around the house, and the pain's come back with a vengeance. On examining her today, her foot looked ischemic, if I've said that right, and therefore requested a duplex scan, but it wasn't her, it was me that requested it. She had a reading of 73. I don't understand all these numbers. That shows that she is got occluded and she has a monophasic flow in her lower leg and foot, which would explain her symptoms. Technically, Rachel needs a left-sided fem-pop bypass, but unfortunately, on previous scan, her left-sided long staphenous vein is very poor in calibre. And at the time, we also scanned the arms, and these also show that they are unsuitable. Wow. So we had it, and I nearly passed out. I needed a fan because I was on my own. My husband was trying to park the car, couldn't park at the Queen's because it's so bad. And I just felt I've been feeling so alone for a long time.
I imagine. You know, when you're in that much pain, and we talk here in the US about legislation that if you have these high risk factors, that they're looking at being more proactive in offering the testing for PAD sooner, when walking as medicine is incredibly effective. But sometimes when you get to the point of critical limb ischemia, such as what you've experienced, that, for some, walking, they can, get that mental grip and push through it. But not everyone can. And it's not that anyone is any less of a person. Every single person presents differently. And actually, some patients do not grow collateral vessels as well as others. And there's still so much learning that researchers are doing in this case. I would imagine if you would have known sooner that you had this, that walking would have been something that you would have done 30 minutes every day.
Yeah, no one believed me. And I was working 12 hours a day as a chef. I was on my feet constantly. I'd come home, walk the dogs, do the dinner. I was healthy. Everything was fine. But my mum had this, my mum's sisters. Unfortunately, I've lost my mum. A heart attack finished my mum off, bless her. And she was only 52. And I'm obviously scared that I'm going to go down that route. But when she told me this in that office 2 weeks ago, she said to me, if we don't do something, you'll lose your lower limb in months. But if we do something and something happens, you could still lose it. So I'm very confused. I saw the anaesthetist last week and he said, because obviously my diabetes isn't that good. I mean, I take over 107 tablets a day. I take such a crazy amount. It's scary. And that's my life. Good job. I like being at home and I'm a home person. I've got a great husband, but I just feel very alone in this. And after speaking to her and what I've just told you, it's like everything's changed. And this letter that came today is now saying, unfortunately, she's not suitable for further and vascular treatment and therefore considering for a prosthetic femoral something bypass with a vein cuff. I mean, what the heck's that? That wasn't even discussed. I've got no idea what this is.
So it's really important when we're dealing with PAD, and this is such a great representation of it. It's sad, but we see it a lot where, there needs to be so much more education that is provided by a care team, not simply in a letter, but in person, having a candid discussion. It can't be done in 15 minutes. It could take 30 minutes to an hour to really sit down and explain and work on a strategy, right? Procedures are not the end all be all. And as we've talked about, and even VJ talked about, and what your situation exemplifies, once you have one procedure and then it's another, and it becomes this revolving door. And that's why it's so important to start the process with 3 months of medicine and a regimented walking program, making sure that the diabetes is under control, because even one sugar molecule can continue to cause damage to the vessel, leading to those, small LDL particles kind of getting in there and pushing the vessel wall out and creating more narrowing, more blockages, right?
I mean, I wanted to come on here today because not only do I find you inspirational, but the group has been so kind to me whenever I've posted on Facebook and helped me through some really dark times. But they've left it in my hands to make the decision what to do, because they're saying, because I'm on a lot of pain medication after having such a big operation, their meds are just the same as the meds I'm on with the morphine. So therefore the pain's going to be so hard to keep under control. And then he's worried about infection and me being in hospital for months. But is it better the devil you know, or the better the devil you don't? Do I do it? Do I not do it? Do I risk losing my leg in a few months? What do I do? I really don't know.
In talking and listening to Kevin and VJ, is there any hope, or do you feel motivated at all to give a little extra push and taking yet another step? We don't know if it's the solution. In your case, no one does. But is that something in hearing? For them, the pain is excruciating, but they're pushing through it. There's a difference between, good pain and bad pain. You don't want to injure yourself, but there is a line.
Yeah, I mean, I go out with the dogs every day. We've got 9 dogs. We live right on the woods, so we just open the gate and we go. I try, but I am not even getting past 2 bus lengths now. I was able to walk a lot further before I had to stop. But now it's like I'm becoming like I'm walking on the moon, and I'm literally coming to this really slow stop. And then I'm crying and I'm angry and I want to push through it, but I can't. It's so hard.
And so many can relate to you who are watching this right now. And I just appreciate you sharing your experience. We are not going to have a resolution to this. We don't know what the ending is going to be at this point. And I think that that's why it was so important that you courageously, you're going to make me cry too. You courageously came forward and you're sharing. I can see tears in other people's eyes as well. We appreciate you so much. And Douglas, did you want to jump in? You have something to say.
Yeah. I just want you to know, Valerie, that you have every single one of us in this group standing behind you, beside you, behind you, and we're helping holding you up. And if you want to get up and walk around the living room, get a hold of me. I will walk back and forth in this trailer with you until you can't walk. And then we'll take one extra step with you. Just realize you are not alone. We are, every single one of us here are with you, and we got you, okay?
I know, but you know, when they don't believe you and tell you to walk, and it's like, hold on a minute, something's wrong, and they don't believe you. And a lot of it, they kept saying it's your age, you're too young. Why am I too young? Anyone can get anything these days. It's just very hard, very hard. But
yeah, and
we're with you.
Dawn Marie wants to say a little something too. Dawn Marie, do you want to jump in? I can see Dawn Marie has tears in her eyes as well. Dawn Marie, go ahead and unmute.
I'm with you. I'm 45 and I lost my leg. So, and there's somebody else here the same age. So we definitely know what you're going through. So you're definitely not alone. Yeah, you're not alone. So when they say you're young, yeah, I couldn't even get into Walmart to go past their little gate to even enter the store. And I would be crying and my legs would cramp. So I know what you mean. My feet were going to break. It felt like someone was snapping my ankles in half. So I definitely know what you're going through.
I don't go out because I get embarrassed. People look at me, how I walk, when I just have to stop because of the cramps. My foot's twisting, my toes bending back, and I feel like everyone's staring at me. They're probably not. It's probably all in my head. But I'm only 43. I really don't have a life.
Well, you need to get past what other people think because they don't know what you're going through. And I know what you're going through, and that's how I felt. So I ended up in a wheelchair. But then my life in a wheelchair chasing children got to be too difficult. So I had surgery. But later on in this program, you'll hear my story about why I lost my leg. Mine was a different case. You know, yours is different from mine. So when you hear my story, I don't want that to have any impediment on what your decision later on your treatment is. But mine was different because I have something we didn't know about, but we'll leave it for later on. But you're never alone. There's so many people out there going through this. And you're close to my age. So I know I had a heart attack. I have 3 stents in my heart. I still have a diseased other leg. Like, so there's still the unknown out there. I'm in the same boat. Like, I have a prosthetic, it cramps. My right leg cramps the same way it was cramping when I had 2 legs. And I stop and I cry. And you know what? I say, I don't care what these people think, because you know what? They're not in my situation. Yeah. So they can look at me with the tears going through and I don't care. I've gotten that skin over the last 2 years that I could care what you think, because I'm living my life to the most I can. With my kids, I'm out there food shopping on my own, in a wheelchair with 1 leg, pushing the carriage. You can do it. You can't sit there and have that look like, oh, I'm in this situation, my life is over. It is not. You're breathing. You're here. You know what I mean? You're here and you're not alone. You're never alone. Never alone.
I mean, I lost my dad shortly after my mum. My
grandma's just died at Christmas. I mean, I've got it's just so sad. You don't have anybody around you now like that, but you have you're not alone. Like, you could take my number. I've already helped other people go through this. My cousin's girlfriend lost her leg right after I lost mine, but she lost it in a car accident. And you know what? I gave her my phone number, and she was calling me at 4 a.m. Like, I can't do this. And I was right there for her, because you're not alone. Like, everything you're going through, I'm going through. I mean, my husband. So you're not alone. I lost my husband at 35 from diabetes. Wow. Like,
That's
so
the thing.
I mean,
that's the thing, Valerie, where we can say you're not alone, because Kim lost her mother. In the last 2 years, I lost my mother and my sister. Dealing
I
with
watched the
everything I've
nursing
been
home.
through.
The nursing home killed my grandmother. I watched that. Like, we're all in this together, honey. I don't want you to ever think you're alone, because you're not alone. But it takes you to reach out to us, though. Like, it's going to take what's in you to reach out to us, because everybody's gone through something. I smile every day, but girlfriend, this is fake. This is fake. Yeah. It's fake. I cry. I break down. I still question God. Like, why my leg? I say, why my leg, not an arm? Because I could still walk and run after the kids. What kills me is when I go to the park and my daughter says to me, Mommy, push me in the swing. There's one thing I can't do. Can't push her in the swing. Can't get to the swing in the wheelchair. But life is still doable. But you have to reach out. Like, you can't say you're alone, because there's many of us. Like, I'm telling you right now, I'm here for you, but you need to reach out for me. So after this, you find out from Kim, and I'm there for you. I'm there for anybody, because that's the only way to get through it. You can't get through it alone. And I probably got boogers going down my face. I didn't even grab tissues, because you made me cry. I was staying strong. But you made me cry, because don't think you're alone.
Can I make a comment?
Yes, you can. Of course.
I'm very suspicious of all these pills you're taking. If you're on statins, they cause muscle damage and they can cause similar symptoms. If you're on a beta blocker, it prevents you from exercising, getting your heart rate up. I suggest you reassess your pills.
I have. When I spoke to someone a few weeks ago, my grandma kept saying, Rachel, these tablets, one must be doing something that counteracts the other. If I showed you everything I was on, I didn't realize I'm on 23 different tablets. And I even questioned this, is any of this doing any more harm than good? And they've told me I can't come off any. I feel like I'm rattling some days. I feel physically sick.
They can't make you take them. I mean, if it was me, I've been on, I was recommended statins. I stopped taking them because I've got medical training and I knew they were causing trouble. I refused to take a beta blocker because the stent increased my blood pressure to a very dangerous level. I went on an ACE inhibitor and I slowly weaned myself off of that. But you're taking a whole army of pills. And let me assure you, having worked in pharma for about 20 years, they don't know what these pills are really doing. They may pick a particular target, like for statins, it's HMG-CoA reductase, but there is no way that's the only thing it's inhibiting. So I'm not telling you what to do. I'm a veterinarian, not a doctor, but I would stop taking the whole lot and see what happened. And if you find you need to put them back in, put them back in. If you're taking 20 different medicines, nobody on this planet knows what they're doing to you, and they may be contributing to your problem. And so I would
this is something that, it's important. I think he brings up a good point, just that it's important that you have the conversation with your doctor, and we suggest making sure that every 6 months you have a candid discussion with your doctor to ensure that you're on the right medications. I want to bring in Dr. Gupta, though, for some final thoughts, because we have to move on to the next session. In terms of her situation, Dr. Gupta, she's, torn. I mean, bypass, walking. How do you work with a patient in this type of situation, and how do you help them to weigh their options?
Thanks, Kim. So a couple of points, because I don't know your complete story. I kind of got in towards the tail end of what you were saying. What I understand is that you have failed endovascular revascularization to your femoral artery. And I don't know what your tibial vessels look like, what kind of bypass, landing zones they have on your anatomy. So, there is a very strong data now, which, you could interpret it in many ways, but there is a definite place for a surgical revascularization, especially if you have a very good landing zone and you have good tibial outflow with decent patency. What I understand from what you were saying is that you don't have good venous conduit, your own great saphenous vein or large saphenous vein, as they say in England. So what they are talking about is using either a cadaver vein or using a PTFE graft, which is a synthetic graft vein for your bypass, right? So that's an option. So that's a discussion I think you may want to have with your vascular surgeon as to what are the long-term patencies of each of these options, whether they're going to use a cadaver vein or they want to use a PTFE graft, right? So that's your surgical, and then outcomes from the surgery, patency of the graft, your overall chances of having wound infections and mortality and morbidity sort of risks and benefits. Now, if you have diabetes and you are a smoker, I don't know if you're a smoker or not, but okay, good. So, but if you have diabetes, then I think the first goal for you has to be to get a good handle on your diabetes. Okay?
That's what you said.
Yeah, because if your diabetes is not under control, any intervention, whether it's endovascular or surgical intervention, carries a very high risk of wound infection.
Yeah,
right? And delayed healing. So before we go, either trying to work on you endovascularly or surgically, the first goal should be to get a good handle on diabetes, right? So so you could talk to your GP. Where are you? I'm sorry. Are you in England or?
hey, but I mean, I can wake up in the night, do my sugars, and they're 22. It's ridiculous. I've not eaten nothing.
So you have a brittle, sort of poorly controlled diabetes. So it is important that you have a discussion with your GP and maybe get a consultation with endocrinologist, right? And I heard Kevin mentioning about, and you said that you were on 100 odd pills.
I thought I was on 20 different tablets. I'm on 20
medication. So polypharmacy is a big issue, correct? So many times if you go to one GP or the other GP or one specialist, the other specialist, the tendency is to just give a pill. So you could talk to a pharmacist.
I just did, and he said he can't take me off any.
The pharmacist cannot take you off of the medication. But what you can look for is, are there any significant drug-drug interactions? Okay.
I said no, but I think there is. I think they're telling me fib, because everyone that sees me always says you're a very complex case. The doctors can't do anything for me anymore. I always need treatment elsewhere. I mean, I've just had an MRI because there's something wrong with my neck. Now the C5 disc has come out. I mean, I can't take much more. It's just my whole body's just giving up. It's terrible.
So no case is complex. It's just that somebody has to sit down and take time to go over everything. Okay. So there is nothing complex. The medicine is pretty simple. You just have to put two and two together. Okay.
And the good thing about being in the UK is that you do have there is a shared decision-making experience, and that all of your doctors, do have conversations with one another. And it's probably, and Dr. Gupta, you would agree, I think it's time before the next steps is, before they do any other procedure, is to say, I'd like to schedule a meeting with you, GP, after you've talked to everyone, and let's put all the pieces together and map out a strategy going forward. But I really appreciate you being here. I appreciate your courage. I'm crossing my fingers that the next time, we have you on, it's going to be, a good result. But continue to keep persevering, and we are here for you every step of the way. Thank you so much for being here.
Thank you. Much love to you all.
Yeah, we
Good luck
thank
to you.
You've inspired us so much, and I just appreciate you being so candid. Well, as Dr. Gupta mentioned a moment ago, he asked, hey, do you smoke? Have you ever smoked? Well, smoking is one of the biggest risk factors for PAD. And at the Way to My Heart, we have a certified addiction counselor who also has PAD to help support smoking cessation efforts. Before we get to our panelists, let me introduce my co-moderator, Douglas Salisbury, to share a few words. Douglas?
Yes, I'm here. So, yes, I have PAD and CAD, and I'm also in recovery. So I know about the addiction, and I got 39 years clean and sober this past June. So that's awesome. But what I learned, start off with what I learned about dealing with stress. It was said earlier, first thing I do when I get stressed is smoke a cigarette, because for some reason up here, it helps me relieve that stress. If I get bored, my hands get bored, the cigarette. If all kind, we talk about in smoking cessation, all reasons why we smoke. And the next thing I want to make sure, if you're a smoker in this group, in no way, shape, or form are we downgrading you in any condition whatsoever. It is a process of learning. It is a process of recovery. And there are no one simple solutions to stop it. But we will work with you, and I can work with you in any kind of situation to get you to a point where you can stop on your own, okay? So with that thought in mind, we got to remember smoking affects the arteries. It irritates the vessels, walls, leading to plaque buildup. That's a given. It also prevents oxygen from attaching itself to the blood vessels to be effectively carried throughout the body. We all know it's important that we want to stop all the progression of PAD, which is the number one thing is stopping smoking. So with that thought in mind, I would like to bring in one of our PAD warrior specialists that we really enjoy, Dr. Gupta. And from the state of Florida, who's a cardiologist, and he is set for the discussion. Now, Dr. Gupta, I have a simple question for you to start off with before we get into the conversation. How would you carry out this conversation with each of your patients about the importance of smoking cessation in dealing with PAD?
That's a good question, Doug. So I think the most important thing is to be not judgmental. When I talk to the patient and I'm getting their social history, so I will ask them about how much they're smoking, when did they start, to smoke, what is their smoking pack year history, if they're, doing any other drugs, alcohol, what have you. So as a physician, it's very important for me to be non-judgmental, first, most important. And then once I have the history, then after I have addressed the most important reason for their visit, whether it is coronary, cardiac issue or vascular issue. So after I've addressed that, then I will bring up what we can do to prevent an event from happening. So as part of the preventive strategy, we discuss smoking cessation in a lot of detail. So typically the first visit, I will just bring up, yes, that is an issue, and we bring up strategies. I don't tell them you need to quit right now. And then I will bring them back usually 4 to 6 weeks. Then I have another discussion. So slowly bringing up that level of trust between me and my patient, and then let them open up to me, and then we start talking about strategies to quit. And there are many, many, many different strategies to quit. What I have seen in my experience is that very close follow-ups, social support, and access to my patient helps them quit smoking, and if they're addicted to something else, then yes, that helps that as well. So it's
Well,
a slow and steady process.
It really is. And I want to bring in a couple of our patients to piggyback on that, it's really challenging and it has to be slow, but you could be scared out of your mind into quitting. So I want to jump in and bring in Kelsey. Kelsey, you want to share your story?
Hello.
There she is. Hi, Kelsey. Go ahead and
Hi.
and share your story. Thank you. It's good to hear your voice again.
Oh, thank you so much for having me. So, I'm 34 years old. I was diagnosed with PAD a couple of years ago. I've been a smoker since I was 13, so over half my life, which is a long time. And I had tried. Doctors can tell you, they tell you you need to quit smoking, but I don't think until you really commit to that process, you understand all the benefits that really come with it. And I tried everything. I mean, I had tried Chantix, which is a prescription. I had tried gum patches, and I was actually on my way to the emergency room for an emergency amputation. And I had my last cigarette and I threw it out the window. And it was a battle, after that. But I think the pure willpower and wanting to quit really was the drive that time. And after I did finally quit, the pain, I cannot even tell you how much it helped decrease that pain in my legs, that constricting feeling that I was feeling every time I had a cigarette. I could feel my pain increase, and that wasn't enough, at that time. So definitely, support from my family and friends was a big one. But I think just coming to that decision and really wanting to do it was the biggest thing that you have to do.
That's amazing. You're such an inspiration. I appreciate you sharing. When some people say, well, if it's your leg or a cigarette, why wouldn't people immediately choose the leg?
Mm-hmm.
Can you
It's
shed
an
some
addiction.
light on what goes through your mind and the addiction process and how hard it is to actually put that last cigarette?
For me personally, I felt like cigarettes was the last thing I had control of. I had lost control of everything medically. I had felt I was being, medically gaslit, which a lot of us are. I thought the cigarettes were helping with my pain because, I would get stressed. I would hurt. I would, immediately turn to that. But when I adapted other things in my life to, kind of take that support that I thought the cigarettes were giving me over, that's when it became less and less relevant. And I started going to those alternative, methods of getting that release, that relief.
Yeah, we do have some that actually say that pain is a trigger for actually smoking the cigarette because it eases the stress. But they don't realize that actually, as you're stating, the pain is exacerbated because of taking
it
that.
Was. And, I didn't realize it at the time. It actually started to be about the time that I was nearing my amputation and things were getting worse. And I was noticing, when I go out and not getting relief, that rubber band feeling around my leg is increasing. I can see my foot turning purple. but I'm still inhaling, you know, and it really wasn't until I was on my way to the hospital. It was 2 days before New Year's Eve. And you know, we had planned a New Year's Eve party, and I realized all that I was missing out on, and that I needed to do everything possible to save my limbs and save my life. And as hard as it wasn't even after I made that decision, I still struggled. When I was in the hospital, they used the patches. I did use them for a little bit when I got out, but as I said, as I replaced the need for a cigarette with actual like friends and family, reading, you know, and it sounds so silly, like I know it sounds silly, but you know, replacing that addiction with things that were beneficial to my health and to my life just really made it worth it. And it really made those cravings go away, because you started craving something better. And I tried before.
That's a great way to put that, Kelsey. You started craving something better.
Yeah.
Thank you. And how are you doing now?
I'm doing better. I found a wonderful podiatrist and still working with my doctors, but you know, my health has significantly improved since I quit smoking, and I'm on my way.
I appreciate you so much for sharing. Thank you again, Kelsey. And I'd like to bring in Judy. Judy, you go ahead and unmute and say hello.
Good afternoon, everyone, from a very wet and windy UK. Autumn has arrived.
Should I even ask who Mama Goose is?
No, don't even go there. And just rest assured that one of my daughters will be killed soon. Just saying. Just want you to know that, okay? Oh. Hey ho, 'tis what it is. Thank you so much for having me. I'm terrified I'm going to lower the tone here and be one of your really stupid patients, but I came on because I think it's important for people like me who have smoked for many, 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 many years. No excuse, but I have. And it's interesting, isn't it? Because for me, it's one of the only things that doesn't cause me pain. I found that really interesting. Most other things I do cause me pain. That doesn't. So it's sort of like, that's really interesting to me. I think with my diagnosis of PAD, the consultant has already told me there's not a lot they can do apart from a life-threatening operation, which, so you sort of think, okay, I don't really want that. But she also did say, and fair play to her, I was quite impressed with her, that for me to give up now after so many years would probably not be the wisest thing. So she has asked me to cut down, which I'm trying really hard to do. It does make me walk more because I don't smoke in the house. I go outside, so I have to walk to get there. I do get the thing about boredom. Yes, if I'm bored, it's the first thing I reach for. But I think here in the UK, it's really interesting listening to all the lovely people that have contributed on here. We do not have the same system as you. So basically, I'm just left now. I've got PAD, nothing you can do unless it gets really bad. I'm lucky if I get to see the GP once a year, really lucky. So we're sort of left to our own devices, I think. But the biggie, and this is where I am stupid, and I can hear you all thinking it, and you're right. You've really got to want to give up. And I guess the bottom line is, I can't see why I would give up, because to be honest, living with PAD for me, because it is quite bad for me, is an existence, not a life, if you get my meaning. And I'm not sounding pathetic or anything like that. It's a fact. It's an existence. So what basically I'm saying, I guess, is that I just hang on to something that A, I enjoy, and B, doesn't give me pain. So that makes me an idiot. It does, because we all know you you quite rightly stress the importance of giving up smoking. So I genuinely don't know what the answer is. I don't know if I'd ever, I guess if I was in the lady before situation where maybe I was on my way to theatre for an amputation, yeah, maybe I probably, but I can only say probably, I'm not definite, would give up.
So let me just jump in. Mama Goose, thanks for sharing your story. And, you know, this is not a story of somebody who lives across the pond. This is a story I hear every day from my patients on this side of the pond. So people, you know, who have been smoking for 40, 50, 60 years, it's very hard for them to quit. And it is truly, truly very difficult. And actually, smoking or the nicotine addiction is one of the most difficult addictions to get over with. So I think when I have a patient like that, and believe me, I have patient on the table going through the procedure, and typically when I'm intervening on somebody, those patients are lightly sedated so we can converse. And I will show them on the screen like what is going on. So for maybe 10 minutes, they will say, oh my God, I gotta quit. And literally 15 minutes later, I go outside and I see the same person in the waiting area or outside in the parking lot, post-procedure, having a hamburger and having a cigarette. so this is not unusual. So what happens is when I see that patient next time, we will have the same discussion, again being non-judgmental. And what is very important, and I think you are right, so it has to come from within yourself. So patients who are really, really addicted, you know, if they're smoking 20 cigarettes a day, right? So what I tell them, okay, what is the most important time when you really, really want the cigarette? And I can tell you because I used to smoke way back when. So, and I'll give my example. So when I used to smoke, my favorite time to smoke would be early in the morning. When you get up, you have your tea or coffee and you want to have your cigarette, and then you go do your daily business. Or typically after dinner, you know, you have a good meal and you want to have a smoke. So I tell my patients, okay, so if you have 2 times of the day where you really, really want to have a cigarette, go ahead and stick with those 2, you know, occasions, and then rest of the day, try to beat the habit. So again, giving my example, my biggest issue was having something in my hand, right? So what I started doing was I would hold a pencil or something to kind of ease that temptation of having a cigarette between my fingers. And then I would, you know, have a gum or cardamom or clove or something in my mouth to break that cycle. Okay. And then I did use Chantix, and it took me about 2.5, 3 months to get over it. And then the way I tested myself was that once I got to the point where I would not be able to stand the smell of the cigarette. So I would go and stand with my friends who I used to hang out with who were smoking, and I would not smoke. So when I got to that point, I knew I could beat that habit. So it was a slow process, but it is doable. So somebody like you who enjoys the cigarettes and has been smoking for many, many, many years, I think the first thing is to realize that it's a problem. And the second thing is minimize the problem and eventually get over the problem. So nobody is saying that you got to quit now, but I think reducing the number of cigarettes from 20 to 10 to 5 to 2 a day that should be the goal. So if you enjoy a cigarette with a drink once in a blue moon, okay. But you got to understand that smoking is a killer, especially when you have vascular disease, whether it is coronary, peripheral arterial disease, strokes, diabetes, what have you. So it's a problem, but you got to overcome the problem. You have to understand that you have a problem, and then find means to distract yourself and get over it. Many patients tell me, hey, doc, I've been smoking 60 years, and this is the only thing which gives me pleasure. True, but not true, because I think many times we are smoking to distract ourselves from other issues. So it's a distraction. So you have to identify the problem, identify the issue which you are trying to mask by smoking. And very importantly, I think this group is actually a great forum. So you guys can discuss amongst yourselves, like, okay, I have the urge to smoke. Get online, find somebody online who is in the same boat and talk. And then maybe that will help you get over it. Because alone, you can't do it. You have to have a good support system to overcome nicotine addiction, which is hard. And I can tell you from my own experience, it's not the easiest thing to do.
Yes.
I know Douglas wanted to jump in and make a comment as well before, but I want to get to Alan first. Alan, go ahead and unmute. We got to get you to unmute.
Well,
there you go. Unmute. You got to unmute, Alan. We see you. We don't hear you.
How's that?
There you go. We can hear you now.
I smoked 3 to 4 packs a day for almost 30 years. What I was a nervous smoker. It was more of a mental game with me because of not life problems, anything like that. I was just a nervous person. And I quit being wheeled into surgery, popped up, and I looked up at my surgeon and said, I'm done. We've been working on me for almost 15 years and begging me to quit. I went in that day for 2 thrombectomies and a tibial bypass on my right leg. While I was being wheeled into surgery, my left leg acted up and started to crash with clots and everything again. So more thrombectomies the next day. I was back in surgery. It is one of the most dangerous addictions that we have. I hear it's more addicting than cocaine. I implore anybody out there that is smoking, for your health, your family's health, to quit. Do the best you can. It can destroy lives with this disease and other diseases. And I'm discovering now what the ramifications for my years and years of smoking were. That's all I've got.
No, that really means a lot. Any advice for how to end the addiction? I know you struggled with it so much. We've had so many conversations. And
for me, it was, I used to drink a lot of beer too. So for me, it was a rock bottom situation. I hit my rock bottom. And for me, coming out of surgery, I had 5 or 6 days in the hospital. So I didn't do any Chantix, nothing in the hospital. I just made my mind up. Before that, I did not have the strength or the willpower to do it. So that's just how it worked for me. I have no secrets because I was the diehard smoker, probably one of the worst ones in here.
I
I
think
could
that's
smoke
that's
five.
the
I could smoke
key.
5 in a row.
I got a comment.
Yes, sir.
So let's talk about addiction real fast. Real addiction. Addiction is a habit, and what happens is, no matter what reason you smoke for, whatever that reason is, if you had that circumstance happen and you connect it to a cigarette, your brain connects those two together. So in recovery is we have to break that cycle like Dr. Gupta was talking about. So in 40 years, if you smoke 40 years, every morning you get up, have a drink, and smoke a cigarette. That 41st year, you don't even have to think about it anymore. That's what your brain says. That's addiction. That is why it is one of the most harmful parts about addiction is because for whatever reason you smoke, whatever it is, that's what addiction is, a habit. And eventually your brain connects those two things together. And that's where in recovery, when you stop smoking, you have to break that cycle. So when you get up tomorrow morning and drink a Dr. Pepper, read a book, read a paragraph, you have to do something different to break that cycle for whatever reason it is. Stress, boredom, I want my hands busy, whatever it is, you have to break that cycle. And that's what we have to work on in recovery.
Excellent point, Douglas. That's so true. And Alan, congratulations.
And I want to bring in Marie as well. Marie has been a longtime smoker and she courageously quit. I wanted to see if Marie wanted to jump in and share just a little bit. If you want to go ahead and unmute Marie, and I'm sure that your story would inspire so many as well.
I wasn't planning on jumping in, but no, I smoked 42 years, 3 packs a day, Newports, worst ones you can have. People would tell me, oh, those are crystallizing your lungs. I was like, oh, I'll just fall over and my lungs will shatter and I'll be gone. No worries. Well, it don't work like that. I quit last year and I wound up starting back up after about 5 months of not smoking, and I quit again. It's been over 6 months. I haven't had none. I think my key was I needed my significant other to quit as well, because it does no good to quit if you're going to sit there and smell it all day long, all night. But what I found worked for me is whatever my normal amount of smoking a day was. If it was a pack, then I'd buy a pack, put 10 in the freezer, 10 in my pack. That 10 had to last me all day. You just pick it up, hit it a few times, stub it out. And then every day, take away another cigarette. And just keep doing it that way, where you make that one cigarette last you 3-4 hours if you can. And eventually you find that you don't need to have that cigarette. And I mean, it may not work for everybody, but it's been over 6 months. I haven't had a cigarette. John hasn't had a cigarette. And my bank account has $15 more a day in it. So, I mean, that's just what I had to do.
Fantastic. I mean, it's amazing. I mean, you just exemplify it's really not easy. And how many procedures did you have before you ended up finally kicking the habit?
I think it was number 59 when I quit.
Wow, that's amazing.
I just last month on the 18th, I had my 65th, as most of you know. And I'll tell you what, to be perfectly honest, that depression and the pain gets you where it is so hard for me to not go to the store and buy a pack of cigarettes, but I refuse to do it. I won't do it. I'm not falling back into that trap
Mhm.
because I know eventually the pain will quit or ease. And I know eventually, I'm hoping eventually my mental part of this will be a lot better.
And I think that that's a big part of it, right? It's that mental grit that one of the earlier
Smokers,
speakers,
Kim, honestly, smokers, honest to God, believe that that cigarette helps them get through that pain or through that depression. They honestly do believe it, that it's helping them.
It does.
It's not, but they think in their head that it is.
Kim,
I want to jump in and get, who is 58890? Do you want to say a few words? Who do we have here?
Is it Shane?
That might be Shane. Is that Shane? Who is this?
It's Victoria, Kim. Hi.
Hello, Victoria. How are you?
I'm doing wonderful. This is a wonderful thing. I pray for you guys daily. Went through this with Shane, and just know that my prayers and thoughts are with you, each of you, every day.
Yeah, listening to some of the stories are really heartbreaking.
It's okay.
Yeah, Shane. And you've been
Yeah.
through, he's been through it. Would you want to share your story, Shane?
Yeah, I think I can. I just
Take your time. It's okay.
hearing some of the other stories, it's really touched me in a way because I thought I was the only one going through this. The pain, the phantom pain, even after, I tell people sometimes the phantom pain was worse than the actual pain.
That is so true.
Yes.
I push myself every day in every way but smoking. I push myself to walk, to do things, to stay busy. Smoking has been that one comfort that I've had that's so hard to let go of.
And how long have you been smoking?
40 years or better, I guess. No, I'm sorry. Yeah,
40 years.
close to 40 years.
And that's how you feel about when you smoke?
A big part of it is this helps. This eases my mind, or I'm so aggravated because I'm hurting all the time. I had a deal with my other leg. I just had a surgery on it. Mom, 2 months ago, to try to save it. And so I live in pain every day and night. And some of the other stories just hit so hard that I know how they feel. And I didn't know other people out there. I'm not a phone person. I couldn't do this if it wasn't for Victoria. So, I can't get on the phone and talk to you guys for help. I'm not phone savvy. I don't even know how to turn a computer on.
One of
we all struggle with that sometimes.
One of the things about his story that I guess is the hardest, for myself included as his wife. I've been a nurse for 22 years.
And when we started going down this road, of course, we heard many different diagnoses along the way, neuropathy, until it got to the point to where he literally could not any longer walk on his left leg. And I feel I let him make the decision on what he wanted to do, although I was against amputation. But at the same time, I had not even thought, because I had so many things going through my mind, I hadn't even thought about trying to reach out, trying to research, or doing any of those things. And so, I live with that guilt as his wife, as many of us probably do. And then he decided to do the amputation. And, what hurts me the most is that he still suffers every day, even though the leg's not there just as much as he did before. But, thank God for Kim. Had we not found her, the same surgeon was already 3 months in after this surgery talking about taking his other leg off. And so it's been a journey. It's been a very hard journey for both of us. And, I've reached out to Kim many times. And thank God I have a dear friend who researched, for me, because my mind was just going a million different directions and I just couldn't think. And she found this. It has been a godsend. It's really been a godsend. If not for this, then he would literally have no legs at all. So, and we're very thankful and blessed.
Yes.
Kim, for what you do.
Shane, how we're all at different levels in this process, and how one can carry the other one, and that's why we all are in this together, aren't we?
Yes, we are.
Yeah, I see that, and I guess we had did a thing with Kim before, but it was just us and her and a doctor, I think. But as these pictures pop up and I hear stories, they really just sunk in and hit me hard.
And one day you're going to be an inspiration of hope, courage, and strength to someone else who's coming up behind you.
That's we right. Are. We take this everywhere we go.
Yes.
Everywhere.
If I see somebody that's got trouble that I think in any way Kim can do something for, I approach and I talk to them and give them a little bit of a story, and I give them a card with the hopes that they reach out to Kim. And yeah, the smoking is, I heard someone say that they didn't smoke in the house, so that has helped me tremendously. 90% of the time when I'm in the house, I don't have my prosthetic on, so I don't want to go outside, and it's awful hot here. So I have really cut back on smoking.
Yes, you're doing phenomenal.
A whole lot, and I think somebody said it. You got to want to, and when you feel like that cigarette helps you with some pain or with some nerves or something that's going on, that's the first thing you go to.
I'm sorry, Chandra. I think the thing is, and the thing I try and abide by is I'll do my best.
That's
if
right.
I can't give up, tough, don't beat yourself up, try again. But I think you cannot put yourself under the stress of trying to live with this disease as well as trying to quit something you've done for 54 years, I think. So
yes,
my thing to everybody is do the best you can, and good for you. Brilliant. If you can give up, amazing. If you can't, just don't beat yourself up. There's enough toll taken emotionally and mentally with this illness.
Yes.
So heap any more on yourself. Just congratulate yourself for what you have achieved, not what you haven't.
That's exactly what I do to him every day. He is doing phenomenal right now.
Exactly. Good for
So,
you.
yes, I'm so proud of him, and
Yeah. And
that he'll.
that's what it should be. Exactly. I
And
don't
I think,
certainly in the
Victoria, I
Yes.
think that one thing that is important for that you and I have talked about, and I hope you don't mind
No, ma'am.
a little bit more.
No.
Okay. Because he had quit, my understanding was after his initial amputation.
Right.
And after you found us and Dr. Sid Rao out of North Carolina ended up with just simply a wire and a balloon opening up, I think it was just his iliac artery.
Mhm.
He literally left there and suddenly felt the feeling of regret that maybe he should have gotten a second opinion for his other leg. And that drove him, Shane, is that right? That drove you back to smoking again because you didn't know how else to process that information.
Yes, ma'am. I feel like the doctor was
We just needed a second opinion.
we needed a second opinion. You know, there was no preparedness for this. There was doctors telling me this wouldn't work. You know, don't do this. This is the only option. And when you have that many doctors coming at you with do's and don'ts,
And you couldn't walk. I mean,
and I literally couldn't walk. I felt like I had no other choice. But then when this doctor done this procedure on the other leg and it took 30 minutes
yes.
and I was climbing stairs and
Yeah.
and
He told him
you
to
know,
rest the rest of the day. I went up to the room where we were at in North Carolina and took a nap. And I woke up and he had not stopped walking the entire time because he had no pain. So it was absolutely amazing. But just the detriment of knowing, if only, but we finally had to get to a point. We have to let that go because it is what it is. I've never, ever, and I'm sure some of you guys can say the same. The doctors told us it would be 6 months to a year before he got his leg. He got his leg in 3 months, and he has been going as hard as he can go ever since. And it's been absolutely amazing. He made his mind up that he was going to make it work. And he does that. He does exactly that. And he's my hero. He's my hero.
It's amazing. You guys are such an inspiring team and really supporting each other. And I think Dr. Gupta also said it best. It's a process. It's one at a time. And even Marie furthered that by saying, hey, you know what? I just started with one less puff and another less puff and another less puff. And they got there. But the key is you can't pick yourself for the past. You can't pick yourself for taking a couple steps back because that's only going to exacerbate your desire for yet another cigarette, which it's habit to use it to ease your stress. It's in your mind that it eases your pain. It actually exacerbates the pain. But you have to let yourself be where you are in your journey. As Douglas rightly said, everyone has their own place in this journey, and it is okay where you are because every one of us knows where you desire to be. The fact that you're even here is a testament to the fact you have an incredible desire to live a better quality of life. And you know the things that you need to do to get there. And you are working towards that goal. Not going to change overnight. When my dad was diagnosed with heart disease, there was no way he was going to change 78 years of eating habits and cravings. It needed to be one substitution after another, little by little, baby steps, taking just one step and rewarding yourself just one step more each day. I think that's so important.
Yes,
Yeah,
I do.
Yeah, not beat yourself up. Absolutely well said, Kim. You cannot. This disease takes such an emotional toll, and I don't think enough is made, certainly over here, of the effect it has on your mental health and well-being. So don't add to that. Just do what you can. You'll get there in the end. Baby steps, Kim. You're so right.
Yes. And I know Marcia wants to jump in. Marcia, did you want to say something?
Well, after this discussion, maybe what I have to say won't be so well received.
We're all about honesty, and everyone's in their own place, and we're always inspired.
Yeah. Well, when I got diagnosed, and I was a heavy smoker. I loved my Marlboros. I was 3 packs a day since I was 15, probably 16. I didn't know how I was going to do it, but I was going to quit smoking, and I have. I look at it completely different. I don't look at it like, poor me, I have nothing else, the pain, I need a cigarette. I look at it like, these cigarettes did this to me, and by gosh, they're not my friend. I mean, I love them, but they don't love me, and I'm going to get rid of them. So I had a completely different outlook on it. If somebody had a gun pointed at me, I would do my darndest to get out of the way of that gun. Or if a car was barreling at me and going to kill me, I would try to get out of the way. And so I looked at it like, these cigarettes are my enemy, and they're trying to get me, and I'm going to ditch them. So I have
That's
a different,
a fantastic attitude and approach. I think it's about self-realization. So the way you approach it, it's important, and it works for many, many, many patients. So you have to.
It was the only thing I could control, because I have PAD. I can't get rid of it at this point, but I could control to some degree. I didn't know how I was going to do it, but I could control what I put in my body as far as my food. I could find motivation to walk, even if it was a few steps, and I could dig deep and with God. And for me, I'm not trying to push religion on anybody, but for me, my faith, I ask God, please, Jesus, take the wheel here on these cigarettes, because this is something I don't know how I'm going to do it. And and he did. I can't say that I quit smoking, because I loved my cigarettes, but they're not a part of my life anymore.
Great. And Tony wants to jump in and say something as well. Tony wanted to jump in. Tony, go ahead.
I just placed it in the chat. One of the things after my father died of heart disease, I wanted to quit. That was it. And what happened was, he had quit smoking. My mother was never a heavy smoker, but my mother started smoking, and I said, "What are you doing?" And anyway, that then prompted my dad to start smoking again. So once he passed, I said, "That's it. I'm going to quit." So I used the usual, nicotine product to help supplement, and I found I had nightmares with them. So what I finally did was, I said, instead of picking up a cigarette and putting it in my mouth, I would get a straw. And every beverage I drank that was cold went through a straw. That satisfied some of the oral fixations that I knew I was obviously doing with cigarettes, and it really helped. The other thing is, again, everybody has their own path and what they're dealing with. And I know at that time I was dealing with grief. So that helped prompt me to say that enough.
Yeah. Good for you. Good for you. Thank you so much for sharing. As you can see, all of us have different experiences, right? And there's no right or wrong. It's really about your desire. And I think that that's what's most important. Just be where you are in your journey and keep taking that one step, that one step, that one step. Douglas, do you want to give final thoughts on this particular session? Or anyone else want to give some final thoughts?
Well, this is Nita. Hi, guys.
Hi, Nita.
I wanted to talk. I just wanted to say something as far as, the will to keep going when you deal with something like I have peripheral artery disease, and the will to keep going is family. And the fact of knowing that sometimes you have to learn how to self-control. It is difficult. Self-control is difficult, but you have to wake up every day saying, today I'm going to do something or take a farther step in order to have self-control as far as my peripheral artery disease is concerned. I'm a diabetic as well. I'm an amputee. All of the things that you guys are discussing, I'm truly in with you on it, because a lot of the things that you guys have experienced, I'm still going through. So yeah.
Thank you so much, Nita. And we're going to hear more about your story in 2 minutes. I want to give Douglas the floor for the last minute that we have before we go into our next session. Douglas?
Yes, well, we've heard a lot this afternoon about the disease, about addiction, about where we each are. And I think the biggest thing as a certified addiction counselor is everyone is where they are. Everyone's going to find their own path to where they want to be. Now, I can talk all day about I don't like the word control myself. I don't use the word control in my recovery or my life. And there's a difference between the word control and manage. I manage my life today. Because when I say the word manage, it gives me every other option that I can use. When I say the word control, it either has to look one way or another. But that's a whole nother, that's how I have gotten where I am today. I took that word out because if I'm trying to control something, I don't have a lot of options. If I manage my life today, I have a whole bunch of options. So for me, that's what works for me. Now, everyone's going to find out what works for them. Every comment was right on point, and it was each and everyone's right on point moment. So we have to remember that. And that's where we're all at different levels. We all support each other. We're all going to bring each other along. That one person who's quit using nicotine patches will help somebody using nicotine patches. The one who quit just flapped out will help. So that's where I'm at.
Thank you
Sponsored
so
by
much,
The Way to
Douglas.
My Heart Incorporated.
Welcome to the Heart of Innovation. 60 minutes that could save life and limb, with new breakthrough ideas and innovation changing. Brought to you by patient advocacy group thewaytomyheart.org in partnership with Cardiovascular System Incorporated's patient advocacy campaign, Take a Stand Against Amputation. Here are your hosts for the Heart of Innovation, Emmy award-winning journalist and founder of The Way to My Heart, Kim McNicholas, and interventional cardiologist and founder of the Save My Piggies Health Education Series, Dr. John Phillips.
Hi, everyone, and welcome to the show. This is Peripheral Artery Disease Awareness Month. Peripheral artery disease is a circulation issue that mainly affects the leg arteries. Caught early, you could end up using just medicine and walking to improve your prognosis. But later on, stroke, heart attack, and even amputation could be imminent. So the key is early diagnosis with PAD and long-term management of this disorder, lifestyle modifications, and becoming a true partner in your care if you are the patient, because there's so much that you as the patient can do to improve your prognosis and help you to live a better quality of life. This particular show comes on the heels of a conference that we have been actually doing all morning long. It's called the Save My Piggies conference. And so we've been sharing the stories of so many people who have this disease, which affects 1 in 5 people over the age of 60, 1 in 3 diabetics over the age of 50, and 3 in 5 heart attack sufferers have it. And so many don't even know it, if at all, until it reaches advanced stages known as critical limb ischemia, where very few options may be available to keep your life and limb intact. We have a very special guest in this first half hour of the show who is courageously here to share her story. Nita, thank you so much for being here.
Hey, Kim, can I just say a couple of comments?
And John Phillips is actually here. Wow. Thank you so much. I wasn't sure.
Well, I've been listening in, and as you mentioned, the Save My Piggies conference that you've organized has been fantastic. I spent the last hour just kind of listening to patients tell their testimonials.
Yeah.
And you know, I hear people crying, laughing. I mean, the whole show. Fantastic job. Yes, I'm golfing actually right now. We're doing a little memorial for my father, and so we're doing a golf outing. So I'll be joining intermittently, but I just wanted to say hi and fantastic.
Thank you so much, John. We really appreciate you. And Nita, are you here with us as well? For those who don't know, we are actually on Zoom and we have so many people that have joined the conference. I'm trying to sort through all the participants and make sure everyone is actually here who should be here. And I believe Nita just jumped on a little bit ago. Nita. Well, maybe she fell off just a moment ago. So I'm going to see if she's actually on. John, do you want to jump in?
Sorry.
Oh, is she here? There you are, Nita. I was wondering, technology, we just started talking about that.
I'm not tech savvy. I'm not tech savvy. So you're lucky I'm here because I'm not tech savvy. Hi, guys.
We're lucky to have you here for so many reasons.
Thank you. Thank you.
Welcome to the show. Welcome to the show. I can't wait to hear your story.
Thank you. It's an interesting story. So let me know when you're ready.
Oh, we are ready. We want to know, where do you want to begin? I mean, what was life like for you? A day in the life of Nita prior to that first indication that something might be going on with your circulation?
Okay. A day in the life of Nita. I was a restaurant. I managed restaurants for over 30 some years. I was very active. I have 3 beautiful daughters. I have 3 beautiful grandkids. At that time, I was just a go-getter. I was always on the move. I was very active in the community. I was very active in my church. I was just an active person all around. And then I started getting symptoms. I didn't know what it was. For years, my legs would start hurting. And I said, well, back in the day, I'm from the South. So for us, everything was rub it a little salve on it and it'll be okay in a minute. Just give it the time. So I never could find out answers as to why my legs would always hurt. And it got to the point, I'm a fashionista. I had to stop wearing heels. I couldn't wear my shoes. And that was very devastating for me. So I moved to Maryland in 2011 to be closer to my family here. And when I got here, I was here for 3 years. And then the 3rd year, I found a bump. It was like a mosquito bite at the top of my foot, on my left foot. And it itched like a mosquito bite. I scratched it a couple of times. Then it started getting to the point of it was infected, but the infection was under the surface. It started turning yellow. Then it started spreading. So I started going to my primary care physician. No one could actually tell me what was going on. They couldn't put a name to anything. Now, the whole time I'm going through all of this process, I'm going back and forth to my doctors. My toes started turning black. All this time I'm going back and forth and my toes are turning black. I know there's somebody out there that could help me, but they didn't. So I got my first amputation in 2017.
So who did you complain to at this point? It sounds like you had gone back and forth with doctors, right? I'm sure you went to your primary care physician. You said,
primary care, my podiatrist, any and everybody that would listen. But no one could give me an answer for what was going on with me. No one. So by the time I got my first amputation, I still did not know or know anything about the word peripheral artery disease. I knew nothing. I found out about PAD when I left Maryland to go to Michigan to save my life. My daughter found Dr. Mustafa on Twitter. He was on vacation. She tweeted him and she said she didn't think he would hear back from him. 30 minutes later, he tweeted her back and said, "Tell me what's going on with your mom." She told him what was going on because at that time I was talking about a second amputation. I hadn't even gotten out of the hospital good from the first amputation. They sent me home. The podiatrist sent me home with my foot open. I had 3 stitches, one on each side and one in the middle. So it got infected. By the time I got to Michigan, I had to get my foot cut back twice more because of the poor care that I received here in Maryland. I got to Michigan, Dr. Mustafa, the staff, my family at ACV, they literally saved my life. He told me I had weeks to live. If I had not made it to them on time. So for the past 7 years, I have found a new reason to live, even though I'm a partial amputee. And I don't look at it as a partial amputee. I look at it, if you get something taken away that you was born with, it's gone. It's not coming back. So there's nothing partial about an amputation. It's there. So after living life, fighting for my life, fighting to save my leg for 7 years, I moved back to Maryland. Going through a horrific divorce, I came back to Maryland to be close to family. And
we're going to find out what happened next right after the break. So stay with us right here on the Heart of Innovation.
Thank you.
Leg health can indicate risk for heart attacks.
Everyone's clear.
Nita, I thought you might need just a moment, and it's fine if to get emotional. You're so wonderful, and your story is really powerful. So I just wanted to give you that moment, and it's fine if we tear, going into the next segment, because the emotions are real when it comes to peripheral artery disease. It's a roller coaster, right?
It is. It really is. It's an emotional roller coaster every day. And that's why when I see people with amputations and difficulties walking, I have to acknowledge them because I know the struggle. We all know the struggle, but it's just, yeah, I'm ready though.
You've been through so much, and I'm curious at what point you ended up learning that it was peripheral artery disease. I'm assuming that when your daughter went on Twitter, she only found Dr. Jihad Mustafa in Michigan at ACV because of searching for keywords, leg saving, leg saver, or something like that.
Yes. So when she found, she ended up being a vascular surgeon damn near herself from the research that she had did to find Dr. Mustafa. So I didn't know what peripheral artery disease was. Dr. Mustafa and his team taught me how to pay attention to my body.
Sorry to interrupt everyone. 10 seconds still air.
Okay. So we'll get to that in just a moment.
Okay.
Give us 1 second. We're going to head back. This is, live broadcast on the radio in the San Francisco Bay Area.
The Answer.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone, and welcome back to the broadcast. We are talking to Nita and hearing her powerful story. She was living in Maryland. She was on the verge of amputation. She ended up with, I believe, Nita, you had a toe amputated first in Maryland?
Yes, I had all 5 of my toes amputated first in Maryland.
So it was actually a transmetatarsal amputation in Maryland. The doctors did not even attempt prior to amputation to open up the blood vessels to carry critical nutrients and oxygen that are critical healing components to any sort of wound, and especially inline flow, according to the Society for Vascular Surgery and the American Heart Association, should at least be attempted prior to any amputation, but you weren't awarded that sort of opportunity there in Maryland.
No, I wasn't. I feared for my life because I had made the travel back from Michigan twice, back to Maryland. Before I finally decided the third trip, I checked myself out of the hospital the third trip, and I said midway between Michigan and Maryland, I wasn't going back to Maryland because I feared for my life. These people were not taking my life serious. So
right. So this was actually, so you went to Michigan first. You stayed there for 7 years with Dr. Mustafa. You had, every other year, one leg was done or the other. And then you decided after this divorce, you're moving back to Maryland. And that's where you've started the story in this segment. So continue on from there.
Okay. So,
Actually, Kim, if I could just, could I just interrupt for real quick? Because the point that you made about the number of procedures that you had, it's not common. I mean, the stuff that we do, particularly below the knee, it opens up and then it closes again. And so it's not uncommon for a patient to have multiple procedures on each leg over and over, and we do what we can, and we will do whatever we have to do in order to preserve the limb. So I just want to make that clear for the audience, because sometimes people are like, wow, you guys do a lot of procedures on these patients. Well, we do them because we have to.
Exactly.
Right. And I think Nita, I mean, having these procedures, it was something that you were willing to go through to maintain your legs.
Of course. I call them a tune-up is what I started calling them, because I would have to have them currently to maintain my lifestyle, my quality of life. So when I came back here, I decided to, maintain my self-care. I decided my primary care physician referred me to a podiatrist, because that was one of the first things I knew I needed to see was a podiatrist. I went to the podiatrist. I get corns on the bottom of my feet, because really the bottom of my foot is actually part of the top of my foot. It was a flap, and they flapped it over. So I have to go and get maintenance done on my foot. I went to go get maintenance done. The podiatrist sliced too close to my foot. I had a infection. I got a pus ball on the bottom, the size of a tennis ball. I got a pus ball on the top, right on top of the artery of my foot itself. I had to go back. I went to Johns Hopkins. They told me I had a bone infection. And in hearing I have a bone infection, that says I'm about to get my leg amputated below the knee. That was the first thing they wanted to do. Every time I come back to Maryland, they want to amputate. So I was trying to explain to Dr. Hicks, the vascular surgeon. I'm sorry.
That you wanted to have your leg flow restored. And so you checked yourself out against medical advice, AMA, because you were committed. You wanted to find a doctor that would attempt to restore blood flow. And that's really where you're at in your journey, is you are now getting ready to see a second opinion. We always suggest a second opinion prior to any procedure. And you're getting a second opinion, and from a different doctor who is willing to attempt to restore inline flow once again, correct?
That is correct. And as a matter of fact, the procedures I'm having the procedure on the 3rd, which I'm excited for, because I know that having this procedure, I don't have the back pain. I don't have the hip pain. I don't have the leg pain. I can walk. I have my mobility back. And without it, my mobility is off. My body is off. And when your doctor takes time to explain what your feelings, what your body will go through, knowing what you need in order to keep your health, you listen to those doctors because they take care of you. You know that what they're telling you is sincere. When you find a doctor that is willing to let go of himself to send his patient to somebody else to say, I can't do this, but I know somebody that can, then you have physicians that love you and you know that will listen to you. When you have a doctor that says, no, I can do it all, and if I can't do it, it cannot be done, that's not true. It's always somebody out there. And with all of the conferences, think about it, all of the conferences these doctors go through, all of these new people, all of these more innovative doctors that they meet, and they can say, I can't do this, but I know somebody that can. I can't make that decision, but let me introduce you to somebody that can help you make that decision. What I'm saying is, give us as patients the option to say, allow me to go somewhere where I know I can get the care that I need. Don't hold me back from getting from what I need because of what your status might look like in your medical society. Don't do that. Love on your patients, because when you love on your patients, believe it or not, your patients love back on you and they trust you with so many things. In order for you to know your patients, you have to ask questions. I'm not going to tell you right off the bat that this is happening in my life if you can't tell me something about yourself. I want to know you just like you want to know me. So this procedure that I'm about to have, I've been fighting to have this procedure done ever since May. And I'm finally getting it done. But you know what happened with me? My doctors in Michigan, my family in Michigan, you know what they did? They make sure they do the research for me. If I call them in Michigan and say, I can't find, they'll say, Nita, we're gonna look for you. Now I found that same thing in Kim. If I call Kim and say, Kim, I can't find, Kim is gonna be on it until we find it. She tires me out sometimes with all these text messages, but I love this woman to the hilt because now Kim is a part of my medical family. If you cannot say you have a medical family, a team, then you don't have it. With all these different doctors coming at you at one time, you're already anxiety, you're already pumped with medication, you're already pumped with pain pills. You get people trickling into your room one by one. You don't know who you've talked to. When they tell you you have a team, you want to see everybody from the head of that team down to housekeeping. If I need to talk to housekeeping, I know the head of housekeeping. That's how far I want my team to go. That's how deep a medical team should go. I don't want to be nobody's number. I don't want to be just another file in a cabinet. I want to be Nita's coming in today. Get ready. Nita needs this done. Nita, I don't want to be patient 992. I want to be personable. I want that hug. I want that hug from that nurse. I want that hug from that doctor if I need it. Show me the attention. That's what you went to school for. That's what you planned for this. That you went to school to save lives. You didn't go to school for money. You can't, because I'm sure you're still on school bills. You went to school to save lives. Help us save our lives. Stop ignoring us as people. Stop ignoring us. This disease, I'm sorry, this disease does not make us. who we are as people.
Nope.
Take time to know me. I'm Nita.
And
And I
Nita,
have
we're
a
going to hear more of
reputation.
your story and inspiration in just a moment. Let's take a break.
Anita making me bawl like this, and I ain't got nobody at home to give a hug to.
I want hugs. At least you know, yeah,
I'm
all your
home all by
family.
myself, and she's just got me over here bawling.
I'm sorry. It's true. It's
Anita,
true.
I love you, honey. I'll
love
be
you.
part of your team. Don't you worry.
Thank you so much. I appreciate that. We all need a team.
And I'll
We
tell you
all-
what, most people don't know, but if you call Kim while you're at your appointment, she will go on Facebook Live or, just with the speaker, anything. She'll be in that appointment with you.
Yeah, she will. I know.
So
she
anybody listening, you need somebody in that room with you, call Kim. I'm telling you,
Well,
I
see-
would not have two legs if it was not for that lady.
Thank you. I feel the same way. Let me tell you something. When you can pick up the phone and call your doctor and say, talk to this doctor without having to go through, hold please. Oh, he'll get back with you. Can you send us an email? When you can pick up a phone and say, Doc, can you explain my situation to this new physician? And they say, sure. Nita has this. Nita does this. That's when you know.
I just went through this last month, and Dr. Saab found me a surgeon to do all that crap into my leg, and one doesn't make a move without the other one knowing right now, because
Everybody put your arms out. Group hug. We all got a group hug going on.
Yes.
Yeah, that's an amazing group. Yes.
Yes. I like that.
Yeah,
Ooh,
I needed to put
that
us.
felt good, didn't it?
Thanks,
It
Nita.
Like that. Thank you, guys.
Even if it's an air hug, I can certainly feel the intention and the energy
Me too.
of everyone. And I wanted, in the next segment, let's not, talk about specific facilities, but
Okay.
during you were very careful as well. But during the this part, I want to finish off your segment, but I want to let you have a moment when you were at our conference near Chicago. You had a very powerful message about being an African American woman with PAD, and and a message to physicians, and a message even more to other African American individuals, that you need to stand up. You need to not settle in, and just because your mom, just because your dad, just because your grandfather, just because they had an amputation doesn't mean that that's your fate. There are options now available, and you need to push for them. So I'm going to start in there, and I think Dr. Antizana, are you here?
Yes, Kim, I am. I've been listening on for a couple hours, and I am just so impressed.
Here we go. I'm going to bring you in,
everything
Doctor.
that's been said. It's
Hold on,
back
Doctor.
to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone, and welcome back to the show. We've been hearing Nita's story, and I wanted to bring in Dr. James Antizana from North Carolina, Charlotte, North Carolina, a vascular surgeon. You've been listening into Nita's story. Any thoughts before we hear her final thoughts?
No, I am very moved with what she says, and she's pretty accurate in that regard. And I believe that, first and foremost, we're all brothers and sisters. We're all human beings linked by our great creator. And if we put everything aside and just focus on those things that I just said, I think the world would be a better place. We would be taking care of each other, and we would be manifesting that four-letter word that I believe has been passed down to us, and it's our responsibility to uphold, and that's loving one another. So that's all I have.
I totally agree. And with that, Nita, you attended The Way to My Heart patient conference near Chicago recently, and you had a very powerful message about the experience as an African American woman with PAD. And African Americans do get their legs amputated at 3 to 4 times the rate of their white counterparts. And you have a very strong message in that regard, not only for other African American individuals who might be at risk, but also physicians as well. I'll let you take the floor.
Well, my take on that is a lot of Black people in poverty, they get their situations amputated faster because they don't get the care that they need. They feel as though they are disposable. They're not as informed. And the first thing, and because we are so trusting of our physicians, our primary cares, we are so trusting and believe in what they say, especially our elderly Black. As soon as they say amputation, they believe that. If they tell them you need an amputation for a better quality of life, they believe that. They don't second guess their physicians. And this is the thing that physicians need to understand. We don't second guess you because we trust that you're telling us what's right. But now I tell everybody, I don't care Black, white, purple, or green, stop believing and taking the first option. There are always better options out there. The medical society has been it's amazing at what they can do. Prosthetics, they look like real. My prosthesis, people can't believe it. But that's because I had people that I believed in and I put my faith in them. So just know, African American people, we fight for so much. Please, please help us fight for our limbs. Don't just take them just because you don't want to be bothered. Protect us, please.
Thank you so
Powerful
much,
words.
Nita. We will be back here
Thank you.
on the Heart of Innovation on 860 AM. The Answer.
Nita, we love you.
I love you guys.
Everyone's clear.
Wow, what a story.
I know. It's be amazing. I mean, I'm so glad I got to hug you when I was in Chicago, because now I know what it feels like to hug you. And I'm giving you the biggest hug right now.
Thank you, my love. I'm sending all of my love, prayers, powerful energy to each and every one of you. Because let me tell you, baby, we got to fight. We've been fighting and we're still here. We're telling other people how to fight. Let's teach them how to fight. Don't give up. Peripheral artery disease is a beast. Diabetes is a beast. And amputation, it's horrific. It's a beast. But we're still here to share our stories. We're still here to teach others. Always, always get a second opinion. Love on yourselves. Don't be ashamed to love on yourselves and say, no, you're lying to me. I don't believe you. Show me the proof. Show me the money. When it comes to your health, show me the reports. Don't just believe the first thing. I love you guys, and I thank you for listening to me.
You're amazing. Thank you, Nita. We just love you dearly, and you're inspiring so many people. And as Marie is putting in chat, she wishes she had your strength, and you're truly amazing. And Marie, we know you are so much stronger than you think. You wouldn't be where you are today if you didn't have all the strength in the world, right, Nita?
That's right. Marie, you got it. You got it, baby. Don't let nothing or nobody tell you don't.
Mentally, I'm not, I'm losing it more and more. Mentally, it's just breaking me.
Fight, mama. Call me. You can call me. You can talk to me. Fight. Don't give up.
We are all here. But sometimes it's good to talk to someone that you can fight right alongside of. And the two of you, I know you bonded at the conference as well. And it's really good to have friends in health, right?
It is. Call me, girl. You need to talk. Call me. I'll make you laugh. I promise.
And I want to check to see if Dr. Phillips is still here and how his sound is doing from where he's at.
Okay.
Before we go
Can you
into
guys
the
hear
next.
me?
We can hear you right where you are.
Yeah. All right. It's pretty sketchy here, but I'm listening in. Fantastic story.
Well, the spot you're at right now, you can be heard quite well and quite clearly.
Yes.
Perfect. That's our producer, Colin, in case anyone is just joining in. Colin has a great voice for radio.
Yeah. Hi, Colin.
How you doing, Auntie Anita?
Oh, I love it.
We're all family, you see. She's my big sis too. So we already determined that. Sister from another mister.
We've got it holding down with ringleader, big cousin, Kim McNichols. We got great uncle on the side, Douglas. He keeps it down. I've seen my doctor, Dr. John Phillips. He's not my actual doctor, but I call him Doc nonetheless. And we got everybody else in the family. Y'all aunts, uncles, and cousins. We have love, nothing but love here.
Nothing but love. I love it.
Well, Nita, we're going to move to the next story with Karen and Axel. So we appreciate you're welcome to stick around. We do have another session starting in 20 minutes, talking about life after amputation. If you want to stay and continue to inspire and be a part of that conversation as well.
Yeah, I love it. Love it.
But I want to just test the microphone of Karen and Axel before we get into the next break. So I want you to go ahead and unmute.
Hey, Kim, sorry to interrupt you real quick. Want to let you know we got about 2 minutes till we're on air for anything you have to describe to folks.
Perfect. I just want to.
We are.
Oh, perfect. There you are. It's so great to see you guys. I don't think we've ever had a face-to-face. It's always been an audio, and it's so good because we are also family. We're right across the Bay Area from each other, but we've been through so much.
Shock to you. Hope it's not a shock to you. See the faces.
No, not at all. Not at all. You're both beautiful and wonderful. I'm going to have Dr. Phillips bring us in. And Dr. Phillips, if you can also introduce Dr. James Anazana, who's here as well to help us with the conversation and can chime in. But I'll let you start. So, Karen, it's Karen and Axel, and they live here in the San Francisco Bay Area. And they're locked into an HMO. We don't have to name the HMO. We'll just call it an HMO. But because I know that they are on my LinkedIn, and so I would just prefer to leave it as is, right? Dr. Phillips, are you ready for the next segment?
I am. Can you hear me okay?
I can. So you're going to take us in?
God willing.
Just let everyone know we have about 40 seconds. Also, Dr. John Phillips, are you doing your moment of inspiration?
No, we've had plenty of moments of inspiration today. You don't need anything from me.
Copy that.
We've had tears, we've had laughter. Yeah, it's been so incredible. And I appreciate everyone who has stuck around, and especially those who are, we're supposed to speak prior to the show, that are waiting around Dawn, Marie, and Sunshine, and Alan, and everyone who's waiting for the next segment.
We have about 10 seconds, everyone.
So I appreciate you guys so much. I'll let Dr. Phillips have the floor, and he's going to take us in.
Special report. I'm Jason Walker. 8:60 a.m. The Answer.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody, to a special Save My Piggies podcast episode. We're live on the radio and we're talking to our new guests today, Karen and Axel. Karen and Axel, you guys have a story that you want to share with us about perseverance and fighting through PAD. So please introduce yourselves, and the floor is yours.
Hi, I'm Karen.
And I'm Axel.
Welcome. We really appreciate you. And I wanted to bring in also and let Dr. James Anazana know that he's welcome to jump in with questions throughout your story as well, because it's really compelling. You are a cancer survivor, and that was the start of this whole journey to plaque buildup in your arteries. Let's start there, Karen.
Yeah.
So I think Karen kind of wants me to talk.
You have the radio voice.
Let's make this very quick because it's otherwise a pretty lengthy story. In 2020, we started out with Karen, or with us finding out Karen had sinus cancer, and which is an extremely unusual cancer. With that, obviously, all kinds of diagnoses came up, including her constantly having cold feet, and they had turned blue. So therefore, we were told to see a vascular surgeon. Then our HMO, you said, and so we did. They ran tests and found out that her iliacs were plugged up. And the next thing was that they pretty much right away suggested to do an axial bypass, meaning a plastic tube from the
shoulder.
underarm area, yes, all the way down, bypassing everything, going down to the iliacs. Now, with that in mind, and that being a big shock, I think that was about the time that Karen ended up in touch with you via Facebook, I believe. And
Yes.
You then much suggested to see that we get another opinion. And so within our HMO, we asked for another opinion from another vascular surgeon, which was in this case in San Francisco, who replied to the CAT scans and you name it, whatever was done, and immediately brought up something that we didn't even know about, which was that apparently one of Karen's kidneys was shriveled up, and that one should look at her renals along with the iliacs. So going back to our surgeon they said we will look into that. They did sonograms and all sorts of different things in order to find out what was wrong with the renals, and they didn't seem to think that there was a problem. So, but again, going back to the bypass for the iliacs to get blood back down into her legs, and it just still, it wasn't enough of a response, not even talking about the renals, even though we were told that one of her kidneys shriveled up. So
right,
in
you
any
had a
event,
situation where you have the one vascular surgeon that was only a year out of fellowship, who is the deciding person on your team. You tried to get a second opinion from the superior. The superior only agreed with what the original vascular surgeon would do. A third vascular surgeon in the same HMO that I happen to be working with for another patient, and he ended up educating us about the renal arteries being plugged up as well. And when you went back to the other team, your original team, they weren't going to, there was nothing wrong. Your only option is going to be this axillobifemoral bypass. bypassing everything. And you know, in the reading, you're reading that, oh my gosh, in the United Kingdom, it's considered palliative care. It has a very high mortality rate, and you're a mom.
Right.
A mom of
Well,
3 kids, right?
Yeah. This obviously was a huge concern. Therefore, a third vascular surgeon came in, and he then said, yes, this is about the only option with that bypass. And again, not going into the whole renal problem. Now, when we brought it up to him, he said, well, we don't think that this is too big of a problem. You know, if it comes down to it, dialysis is not that bad of a thing anymore. Can't even do it home days. So, I mean, that was not a good enough answer to have a good and life to be there for the kids and to have any kind of longevity. So with that, we were able to hook up with Dr. Joy at Bay Area Vascular and Vein and Vascular.
You know what was really disconcerting is that we tried multiple ways within this HMO to find a second, you know, to allow you, you know, a second opinion outside of the HMO, because there weren't any advanced options available. But because they offered you options, these invasive surgical options in the form of the axillobifemoral bypass as frontline treatment, there was no question you didn't need to go anywhere else. So coming up right here on the Heart of Innovation, we're going to hear what they ended up having to do in order to save not only Karen's limb, but also her life. So stay with us. You don't want to miss that.
Attention Medicare recipients and anyone turning 65.
Everyone's clear.
Colin, do we have even an extra minute in here on this last break?
You may not be getting all of the benefits you're entitled to, including in-home aid.
To actually,
hold on, give me 2 seconds.
This is really powerful, and so I want to get into the part of the story where you ended up having to make that decision to dive into the life savings, to say, you know what's, you know, we won't need it if we can't get her there. So you needed to do it in order to.
Hey, Kim, just to let you know, for the last segment, we got about 6 minutes.
Oh, perfect. Okay. So
we can wrap that up within 6 minutes.
Yeah, and if you guys want, you can actually
in about 5 seconds.
Okay, so we're going to wrap this up pretty. We have 6 minutes.
316-3280.
This is 860 AM. The Answer.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone, and welcome back to the show. We are talking to Karen and Axel here in the San Francisco Bay Area. They belong to a large HMO, and Karen was told she needed what many doctors in the United Kingdom in particular consider palliative care and axillobifemoral bypass as frontline treatment for blocked iliac arteries. I would imagine at the same time, part of that aorta must have been blocked as well, because if they weren't going to do an aortobifemoral bypass, which is obviously, it is frontline treatment versus an axillobifemoral bypass for most, it's rarely done these days, and usually done when all other options are exhausted. But that was being offered as frontline treatment. HMO would not let you even get an outside opinion outside of the HMO, and so you made a really tough decision, Karen and Axel. What was that?
Well, basically that we. And it did not matter. A life is worth $1 million or more. But we made the decision to pay out of pocket to get her the best care that was available, which we were able to obtain through Dr. Joey. Now, going in, initially we had a consultation and we asked if he could help us. And looking at our records, he said yes, that he could. And with that, we scheduled the first procedure, which he thought was most important to start with, which was to take care of the renals. Now, after that procedure and stenting the renals, he came into the recovery room and talked to me and said, you know, it's a good thing that we did this because one of them was plugged by 95% and the other one 91%.
Wow.
That means he was going to go into kidney failure at any time. So with that, we then waited, a couple of months or whatever we had to wait in order to then get going on the next procedure, which was going to be one of the iliacs. He was going to do this in stages that it's not so invasive. In any event, so going into the next procedure, when he was done with that, he came out to me and said, you know, this was a heck of a lot worse than I initially thought. I ended up having to stent literally the whole aorta from the heart on down. And then I believe it was initially the right iliac. Then that all worked out well. It was hardly invasive at all. I mean, she came through that with flying colors. And so then the last procedure was to take care of the left iliac, which was still tricky, but this man is, I can't say enough. So
Dr.
in any
James
event,
Joy.
yes. So in any event, this all got done, and she got warmth back into her feet. They no longer were blue. Her kidneys were working properly. The shriveled up kidneys started getting a bigger shape again. So it came back on board. And with that, all the procedures were done. And then we just went into follow-up ultrasounds every 3 months. Now, meanwhile, at the same time, they had suggested to take Xarelto as a blood thinner. Now, we, through our HMO, being on the best plan that was available to us, we tried to order that, and we were able to order it, but then we found out it was going to be what, $1,300?
$1,300 for 30 days.
For 30 days. And so meanwhile, every time we went to the ultrasound at Dr. Joey's office, Nima, his sidekick, or whatever you want to call her,
Wonderful.
she's fantastic. She would give us Xarelto samples.
Yeah.
To this day, we've been getting Xarelto samples from them without having to pay a dime.
And we have about 30 seconds left.
Okay.
Where is she? How long are we since the procedures, and how are you doing? We have about 30 seconds.
It's been a good year since I've had everything done. I'm doing really well. I'm doing great thanks to you and thanks to Dr. Joey. And the walking, I mean, that helped so much to get the blood back in my foot. That helped so much. That the challenge was really cool. And I thank you so much, and Doug too, because if we had a little moment when I was feeling sorry for myself in bed, I never met all of you, or this wouldn't have worked out. So I thank you all.
It did. And thank you so much for sharing.
So
you mean
the
a
only
lot
problem is, let me just say one more thing. The only thing is, it's a big problem that as long as you have money, you can live. If you don't have money, you're down. And that's wrong. Something needs to be done about that in general.
Yep,
that's pretty much all I've got to say about that.
Powerful words.
Thank you.
But thank you, Kim, for everything that you've done.
And thank you everyone for listening into the Heart of Innovation.
There you go.
and high touch advocacy in partnership with the Way to My Heart
Everyone on that
.org,
side's clear.
and take a stand against
And thank you
amputation.
so much, Karen and Axel. I mean, it's amazing for those who are still listening. I want to bring you in before we move on to the next session. Just in that, if you're in an HMO, you do get locked in, and there needs to be more freedom. That if a patient is not comfortable with the options being offered and they see another option elsewhere, that a consult should be covered by that HMO, especially in a situation like yours, where actually the diagnosis was even wrong. They were brushing off your shriveled up kidney, saying, well, that's something that you might have had since you were a kid. We don't know that, so we're not going to do anything about that. And yet when you went and got this outside opinion from Dr. James Joy, you ended up discovering that one of your renal arteries was 95%, another one was 91%. And all he had to do was go in and he stented them.
Yes, correct.
And I remember the text that you sent me literally just weeks afterwards. It was, I have my wife back. Just after that one procedure to open up those renal arteries. Axel, what did you say?
Pretty much what you just said. I mean, I want to have a long term, not short term. So therefore, we did what we needed to do in order to hopefully live still a long life and have some fun after retirement here. So that's what it's all about. Stay healthy and keep on going. We got to be there for the kids.
Walk.
Yes, that's it.
And stay hydrated.
So
thank you so much, you both, for joining us. We really appreciate you. Your story has been so incredibly inspiring.
Thanks, Kim.
It's all doable. It's all doable for anybody out there. You just got to find the right people.
Yeah. Well, many doctors amputate legs for PAD without even a second thought, thinking it's the easiest for them, viewing amputation as treatment. So many as frontline treatment, with more than 50% of people who undergo a PAD-related amputation having this amputation with not even a proper vascular assessment prior to that amputation to ensure there's even enough blood flow to heal the wound following that amputation. But patients tell us that they would like a doctor to always make sure to think twice and do everything possible to save that limb before amputation, because it really is not as easy as it is for them to amputate to actually live as an amputee. And so we have a contingency of PAD warriors who are here to share their story. And I'd like to start with Dawn Marie. Dawn Marie, thank you so much for being here and your courage to share your story and your inspiration.
Already in tears. All right, so where do I start? So I can remember laying in the hospital bed, hearing the doctor say to me, don't worry, not these exact words, but she was much kinder than this, but don't worry, when your leg gets amputated, you'll be able to walk. We'll just put it that way. You'll be able to walk again. To probably the point of this December will make, I believe it's 3 years now that my leg is gone and I haven't walked. So that is untrue. I've had so many obstacles since day one. I went into surgery knowing I had PAD, but didn't know I had another condition, which was a severe blood clotting disease, which took my leg during surgery, in which I was at a highly skilled facility with a highly skilled doctor, which Kim found me. And I traveled states to have my legs fixed. Not to any part of the hospital, but due to this little disorder called lipoprotein little a. So my condition has my body in a state of an 80-year-old, and I'm only 45. So it's altered my life in like every aspect. And it's living with no leg or any other part of your body, with no arm. I'm sure it's the same way, but it's a learning process till the day you die. So every single thing you have to do out there, you have to think about how you're going to do it. So like they teach you in rehab, hey, you're going to learn how to take a bath. You're going to learn how to put your clothes on. You're going to learn how to get in your car. Like I can drive. But they don't teach you about when you come home and you have 3 kids and it's time to take care of your kids and you're in a wheelchair. They don't tell you that, hey, someone might not be around when you got to go to that appointment. So guess what? You got to learn how to get there and get every piece of equipment you need into that car so you can get to that appointment on time. Because guess what? They don't care if you're in a wheelchair. They don't care if you need to carry your prosthetic because you're going to therapy. They give you 15 minutes to be late. And guess what? So sorry, you might have had to go to the bathroom. And now you got to unload all your equipment to go to the bathroom before your appointment. So what I found is amputation is also a different way of life, but it's also a different way. It affects your mind. It's a game with your mind. Your body, your leg is gone yesterday, but your body does not know. Your mind does not know your leg is not there. I fell on my face in my bathroom because you know what? I got up out of my wheelchair, stood up so I could grab my walker and hop. But my brain said, hey, there's a leg there because I have the sensation. I don't have the pain that goes along with it. Thankfully, I don't have that because I don't know how my life would be with a phantom pain. But I do have a phantom sensation that, hey, my leg is there. It's just broken. It's in an immobilizer. Never had a broken leg, never been in an immobilizer, but that's what my brain is telling me. My left leg is still there. Slept to pee, and where did I go? Right to the floor on my face, into the ER, thought hip and femur bone. Thankfully, I didn't do anything but strain all the muscles. So to this day, as I said, I'm almost 3 years out. Sensation. So to me, it's also learning to live life with no leg, but it's also training your mind to know that the leg is not there. And then like to go into like physically, okay, your leg is not there. You have to do everything emotionally. It hasn't gotten better in the 3 years. As you can see now, I cry. Mentally, it messes with me every day. Spiritually, I have a lot of faith, but I still to this day will question him. And do I have love for him or do I have hate for him? That can go in different ways, depending on what kind of day I'm having, because I'm physically tired. I still have to, like I said, food shop, do the laundry, clean my house, chase my kids. But it's all done from a wheelchair because you don't just get up and walk. It doesn't happen like that. Sexually, that's a whole nother series in its own. You have to learn different ways now to do the things you did with your partner, because having a leg in those kind of situations is kind of important. This is things they don't think about. Visually, I had a hard time looking at a picture of myself, because when I look at that picture of me standing up, this whole part of me not there anymore. And it took a long time to be able to look at a picture and say that's me, because I know that me not having a leg doesn't define who I am, but losing a piece of you does take something away. Sorry. I already knew it was going to be a mess.
No, and there's so many people that relate to you.
Do you know how degrading it is to be 45? And I didn't know if I wanted to share this, but I'm going to, because the doctors need to realize there's so many different aspects of losing a limb. They tried everything they could for me, but do I still question if there was more? I sure do. But I don't know if there could have been, because I was so complicated, and I'm still complicated. I'm like Marie. with this severe blood clotting disorder. She went into my body and my leg just reclotted like bubble gum all over the place. As she was working, I was clotting. As she was clearing a clot, I was clotting. So, and then when they tried to bust the clot, I was going to have a stroke. So the quality of my life at that point had to be decided if me having a stroke and saving my leg or losing my leg and not having a stroke was where I had to decide. It was up to me, not the doctor. It was my decision. And I asked him, can we decide in the morning? He looked at me like, honey, at this point, we're at a point where we cut off right here. You'll get a prosthetic. But if we wait till tomorrow, you might not have enough leg to ever walk again. So that was a decision I had to make it like 2, 3 o'clock in the morning. It was life or death at that point. But like I was saying before, like it's degrading. 45 years old, I sometimes pee myself. Isn't that great? Nice, right? Got to yell to kids, hey, can someone bring me some pants and underwear so I can clean up because I peed myself? They don't tell you that when you're hopping around on one leg to get to the bathroom, your bladder is going up and down along with you. And after 3 kids, my bladder isn't the strongest it's ever been. And I've had pelvic muscle surgery like 4 times. So there's probably no great muscles there anymore. They don't tell you, oh, you're getting sick, you're getting diarrhea. You better stay in the bathroom, because trying to get back in the bathroom out of a wheelchair to your walker to hop to the toilet, you're not going to make it. And then I have to ask my boyfriend, hey, I had an accident. Can you come help me? Of course he does, because he loves me. But at 45 years old, that's degrading. The other night, I had to throw up. I wasn't going to make it. Thankfully, the dog pad was on the floor next to me. So I vomited on the dog pad because nobody was home. I would have had to clean it up on my own. You see, so these are all different aspects of losing your leg that these doctors don't look at. I'm tired of hearing about, oh, you're going to walk. Or it's great when you go to physical therapy and you got your leg on and they say, well, don't you remember how your leg swings when you used to walk? I know I didn't go to school to be a doctor. I didn't watch how my leg swung or what angle it swung or how it bent. When I walked, I got up and walked when I learned to walk. And been walking since then. So there's so many things. I have a $90,000 leg that I still am unable to use because they tell me it's me, that I'm not swinging enough. I need to use this muscle. But we don't know. Mine's computerized. It could be the leg itself. So now they're evaluating the leg itself to see if that. But almost 3 years in, I still don't walk. But it does not stop me from living my life. That is the main key of it all. I still do everything I can with my children. If it's raining outside and I had to crawl down the stairs, I've learned to develop techniques and ways to not let me having no leg hinder my life. Yes, it does make me emotional. Yes, I will be out in public and I will cry. But I don't care anymore what anybody out there has to say about me. I've gotten this tough skin where you could say whatever you want, but let me take your leg off and tell you that tomorrow when you're all better in your home, you have to go back to that life you had when you had the 2 legs. Nobody's going to be there helping you unless you have help. I was thankful to have my 24-year-old son and his girlfriend be there for me because for 1 year, I was in another state after losing my leg. I was away from my family. It was during COVID. It was lonely. I couldn't have visitors. It was very lonely. But it just irks me when the doctors think that, yes, amputation is it. Let's just take it off because your life will be just right back to the beginning. I was lucky to be on disability for other reasons. So I was still financially okay when I lost my leg. Some people aren't. Some people can't go back to work. So who's going to pay their bills? Now they're homeless because they don't have an income. For me, I was a degree in the OR. If I wasn't disabled before I lost my leg for other conditions, I would have not been able to be in the OR anymore with no leg because of sterility. So I would have been financially with no money. So there's so many aspects of an amputation that the doctors do not look at. And I know it sounds so mean, but I don't care when someone says to me, I'm sorry, I know what you're going through. No, you do not know what I'm going through unless you are in the same thing. Like Sunshine knows what I'm going through. We're the same age. We both have the amputation. We still have kids we have to take care of. She's a grandma. We're both young and we both got this terrible disease that's gotten us. The doctor said, for somebody, I smoked. I don't smoke anymore. I will be honest, I smoke other little things because that's my stressor. It's not anything major, but in my state, it's legal. So to each his own, what your opinion is on that. But that is what I do. Some people drink, some people do other things. I have that. Yes, it's wrong because I smoke and I shouldn't. But just like everybody else, I can't quit. That's the only thing I have that keeps my sanity. So I could relate on everybody's topic today, everybody's topic. And even when I did have legs before I found the specialist, my doctor down here never once said walk. He never once said walk. And I was the same boat. I'd walk, cramp up and think if I went any further, I was doing more damage than good. So I would stop walking. And then that's when I found Kim and I went to the doctors and, had all the procedures. But due to this unknown, terrible blood clotting disorder that they still can't name, I am on Coumadin because they can't take me off Coumadin because my levels go all over the place. They're never, ever in constant regulation. So for me, I have to stay on the Coumadin, and that's just how my life is. But to have no leg, you can still live life. Believe me, I cried. Depression for the first couple months. I cried. Why me? Why not that lady over there that's smoking them cigarettes? Why not her that's eating the greasy cheeseburger? Just so many things. I was mad at the world, but then I had to say, this is not going to get me nowhere. And I don't remember the other lady's name from earlier. And she was saying, I feel sick all the time. And I could tell you I felt like that, but it was more so because I had that attitude of, I got this disease, I got no leg. My right leg is still diseased. The doctors don't want to touch me. They don't want to fix my right leg because they're afraid. They don't know what to do with me. I went to the top skilled person and she could not save my leg because of this blood clotting condition. So I have to learn to walk with a prosthetic with a diseased right leg still that's never been touched, that used to cramp up and feel like someone was snapping it in half as I'm trying to walk on it. So it's just, they have to think. They need to look at other options. Exhaust every option you can do before an amputation. That's all I can say. Exhaust every option. I did it, like I said, due to the blood clotting disorder is why I lost my leg. So I don't discourage anybody to not go with which way, they want to go with it. Want to wait. You want to have surgery. You can't take the pain. You need to have it taken off. I never got to that area where I had pain. Please take it off. So I can't ever say I understand how someone felt their leg was gangrene. Mine happened after the procedure while I was still in the hospital. It happened fast. I went from a normal looking foot to gangrene in a day and a half. So I was very quick moving because of the clotting disorder. And I think Marie asked me if they found out why I have it or if they have a name for it. And the answer is no. It's still an unknown blood clotting disorder with no name that my 8-year-old also has. Now we found out because it's hereditary. And all they can do is watch her. And I know that someone did mention statins, some gentlemen, about sometimes they're bad for you. But in my situation with my condition with the lipoprotein, little a, statins is what's keeping me safe. My cholesterol was never high in my life, never diabetic, overweight, high blood pressure, but never had bad cholesterol. Had about 13 surgeries, had stents put in my heart, and never got a blood clot, but went to fix my leg and lost my leg. So, I mean, you just don't know, but
No,
I think
it was
that's
like
all I
poking
think.
the
I talked a
beehive.
lot. Sorry, but
It was like poking the beehive, right? They poked the clot and it just showered clot all the way down and trashed your foot immediately.
yeah, she said it literally looked like they pulled bubble gum. Every time they pulled it out, it was just like stringy. And the more she looked around in the leg, it was just reappearing everywhere. And it's weird because, like I said, I have 3 stents in my heart because I had a heart attack and then I had symptoms. So they had to go and put it in. And that's another thing. I had coronary artery disease since the age of 37. I lost my leg 3 years ago. They never put 2 and 2 together. I had cold feet for years, cramps in my calves for years. They said the calves was dehydration because I didn't drink enough water. And the cold feet was because I was anemic. I needed to eat more iron. But instead, we knew it was the pad creeping in slowly. The only reason they knew is I got a sore on my foot and it would not heal. That was the reason for that.
And you know who can relate is Sunshine as well, because she too had a similar clotting mishap that her doctors didn't get to soon enough. And she was the same with the poking the beehive and the showering of clots that just trashed her foot, right, Sunshine?
Yeah, I mean, I was told that I had blood pressure, even though I was told I had the wrong one. Angioplasty. I literally showered a bunch of clots down into my foot, and they were trying to clear them out, and as fast as they were clearing them out, more were producing.
Can I say something real quick?
Sure.
Did they ever check if by chance you have Leiden factor 5? Because this is what Karen has, and only 5% of the population gets that blood clotting disorder. And therefore, with that, we only found out because we lost our very first baby to that. So,
And all the kids have it.
yes.
Yeah,
And
I
my
was
mother
told
had it.
5 back in 2012, and then I was told last year that I do not have factor 5. So at this point, I'm really unsure. I see a new hematologist later this month, so.
Not to
I've
cut her
had
off.
7 hematologists and none of them can figure out where my clots come from.
Yeah,
And I gotta get off here because I mean, your story, Sunshine and Dawn Marie, I mean, it's great to have out there, but I have a clotting disorder they can't figure out either. And you guys both have amputations, and I can't deal with it right now. But you two are very strong, and I'll be thinking of you.
No,
That's
we appreciate you,
understandable.
Marie. No, we all understand, and that's why we're all here for each other. And we're rooting for you every step of the way. And we're going to be here to fight for you, just like with everyone else, Marie, every single step. So you just keep, working on that recovery. And Judy, who's been here throughout the morning as well, messaged me and said, I could be really vocal about the mental aspect, the mental health issue that is related to PAD. And that is not something that I think that physicians also consider when they diagnose you and they refer you to a specialist to treat the vascular disorder. But they should also, I think, with any chronic illness diagnosis, a referral should be immediately made to a psychologist to be able to have a conversation that'll help you develop a strategy, right, for handling the disease mentally, because it's really that mindset that could either make you or break you. And this is literally one of those diseases that can really, really break you.
Cam, can
Can I say something?
Of course.
So, talking about mental, I'm ecstatic because I finally got my first meeting right there because I know it's something I need. And listening to your story, you break my heart, but you are so courageous. I admire you and your strength. I'd never heard of anything. Every time I meet with you guys, I learn something new, not just about myself, but about you guys. And I've never heard anything like that before in my life. And I'm praying for you every moment of your breath, praying for you, because I know it's somebody out there that can help you with this situation. Don't give up, baby. Please don't give up. I'm going to start looking for you. Don't give up, please. And I thank you. I appreciate that. But I just wanted to say again, mental health, we need it. We have to have it. And in order for us to get what we need, we have to ask for it. And sometimes we fight for it because sometimes it's not easily given to us. So we have to fight for it. So for all of you guys, please continue to fight. I'm fighting right along with you. And little mama with them babies, and you're gonna walk. You are. You just keep holding on to that. Keep stepping out on what I call faith. Step out on it, mama, because one day you're gonna be walking. You're gonna have that process working for you. I'm praying for you every day. Thank you again for sharing your story. Each of you, the ones I've heard, thank you. But for you especially, thank you for sharing your story.
Yeah. It is so powerful and so courageous. And, John Marie, it breaks my heart every single time, you message me and you say, gosh, I wanted to push my daughter in the swing. And when my daughter asked me to be pushed in the swing and I couldn't do it because I was in a wheelchair when the park wasn't designed for those who are in a wheelchair. And you told me that you broke down. Tears are actually the sign of strength.
Yeah.
There is so many, you could go on a whole segment of there are so many places that a handicapped person does not have the easiest access in public.
Yeah.
There is. And you don't realize it until you're in a wheelchair.
That's
They
right.
put the handicap spot furthest away. The ramp is at the end of the store. A porta potty, if I ever use a porta potty, I ain't getting in it. There's so many things. You go to Walmart, there's 19 pickup areas for the people who don't want to go in the store and use your legs. Yeah, sorry. I get very upset when I can't find and then they'll have 5 handicap spots. It's like 19 pickup spots and only 5 handicap spots. Sorry, somebody's coming in my door. But there's so many issues once you're handicapped, whether you have a leg or not, because some people are just handicapped, they can't walk far.
Yeah.
It's just they don't think about it because they're not in the situation. And that's what I try to express all the time. You do not know what someone is going through until you are in that situation.
Right. That's right.
Mm-hmm.
I agree.
And
Sunshine.
Who wants to jump in?
Hi, yeah, this is Lawrence Styler. Wondering if I can jump in with what you guys are saying quickly. Just a point of motivation. As far as advocating and advocating for services, especially for accessible services for people with disabilities, you gotta keep pushing. Because if you don't keep pushing, you don't get. And if you need to go to your legislators to do that, you gotta keep pushing because quickly, without Kim's organization, Weight to My Heart, I don't think, in terms of my wife's situation being recent amputee, I don't think I would have been able to do this on my own. So you've got to keep pushing and motivate others to, be the most powerful advocate you can be. That's all I wanted to. That's all I wanted to say.
Thank you, Lawrence. Appreciate it.
Welcome. You're welcome.
Can I chime in for just a second?
Of course, John. Sheriff John.
Dawn, I'm on borrowed time for when I have to go out to work this evening, but I want to say to you directly, hearing you talk gave me chills. People like you are the reason why I'm in the gym every morning at 6 o'clock, why I'm in the gym again at 5 o'clock in the evening, because the doctors want to tell me, as strong as you are, you'll be fine. No, I don't want to piss on a puppy pad. I don't want my life to be affected. And to hear your story, for you to be honest with us right now, and I know that has to be humbling, absolutely humbling, especially when people talk about their intimate parts of their life.
Yes.
But for you to care enough about my well-being to speak that to me means the world to me. And when I hear that, people tell me all the time, you can do this, you can do anything you want to, but when someone says, this happened to me, and I don't want it to happen to me, that drives me harder than anything in the world. And your story, the few minutes that I could hear you speak, really touched my heart, and I really appreciate you.
Yes.
Thank you.
And
I mean, it's nothing to be embarrassed about. This is it. It is what it is. This is, like I always say, it's like a poker game. This is the hand that was drawn. Am I going to put the hand down and walk away and not live the rest of my life because of what has happened to me, or what the future brings? I may not have any legs. I mean, my disease is not going to get better. It's going to stay at the level it's at with what I do in my life to keep it there, or it's going to get worse. No matter how many stars I wish upon the sky, nothing is going to change in that aspect. The disease is going to progress in my body faster than anyone else because of the conditions I have. Like, I feel bad because Marie left us, but I didn't want to upset anybody. But this is the true, what I've said to you is the true, what's happening behind the scenes.
Yeah.
When they cut your leg off and you go home, they don't tell you all this stuff. You have to find it all out on your own.
Your own. Speak your truth. Continue to speak your truth. Don't ever stop. And Marie, she understands. She does.
Right.
She's just
right. And she's going through more than because I know Marie through the site and stuff.
Yeah.
I think she is stronger than me.
Yeah.
You know, she seems to be having a little bit more issues than me, and she's strong. She hasn't given up. I know it's hard. Like right now, I'm crying again. Later on, I'll cry. Tomorrow, I cry. At night, I cry. I cry all the time because it sucks. Sorry to use the word, but it sucks.
It
sucks. But I'm not going to stop living. Do I want to go into depression? It's just going to depress everybody else in my house.
That's right.
We're just not going to get anywhere. And the more you're depressed, the sicker your body gets. You don't realize that depression puts more illness into your body.
Yes,
it does. And I realize that. I just didn't not walk out of the bed. We'll say roll out of the bed. I didn't just roll out of the bed after my amputation. It took a lot for me to get to this mindset, because I don't know if tomorrow is promised, but I know till I get to that day that's never promised, I want to at least live the best I can and enjoy my kids and everybody around me. That's just, I've had so much trauma in my life. I think it's taken a long time to get where I'm at. And I understand not everybody can have the mindset that I have. I hear it a lot, like, well, I wish I could think like you or act like you or be as strong as you. It didn't just develop overnight. It took a lot for me personally in life to get where I'm at. It's like I say, it's doable. You have to find the support. You can't do it alone. And that's why I try to tell that lady, stop saying you feel alone, because you're not alone. You just have to get it in you to say, you know what, maybe you aren't a phone person. You know, write down something, get a journal, write down how you're feeling. There's different ways to get through, but everything is doable. Everything is doable. But I'm going to stop talking because I feel like I keep cutting people off. Like I said to Kim, I could go on for hours. I could teach you tricks.
There's no time limit. We're here. And this is what this discussion is all about. It's to educate one another. It's to raise your voice. And that's what's the beauty of being online, is that you have the time. And I want to make sure that you have the time that you need in order to share your experience and to, as John said, inspire others through your experience. It's easy to laugh with other people, but you know what? It's also really important to cry with one another. Yes. And that's an even stronger bond that you create through tears, right?
Just being vulnerable is the word that nobody likes.
No.
And I definitely understand that, like, to be able to sit and explain how you really feel and what's like you said, for me to come on and say, hey, yeah, I peed myself, pooped myself, threw up on the floor, and I probably will do it again later. I can't promise you I won't, at least. And it's not pee my full pants, but it starts to come out because my muscles are no longer there. Yeah. So much has happened, and I haven't walked, so those muscles are not strong. And but it's reality. This is life. This is it. Like, why sweep it under the rug? I hope that when I open up, if someone else ever comes to this, they say, oh, well, someone else is going through that too. Yeah. I thought maybe I had something wrong with my kidneys because I was peeing myself. And then I've talked to other people and they're like, hey, that happens to me because I'm hopping to the bathroom and I waited all day to go, because it's not easy to just get into the bathroom. It's a project getting into the bathroom. And not every facility is meant for someone in a wheelchair. I've gone in handicapped stalls that I've had to leave my wheelchair outside and hop in and hope I'm not going to slip and fall, because they say it's handicapped, but it doesn't even fit a wheelchair to close the door. So
no, and even if you fit it in, you can't turn it around.
Exactly. And then you get in there and you go in and you got to pee. You're finally getting into that bathroom, and there's the girl who doesn't want to use the little stall, got nothing wrong with her. And you have to wait because she's in the handicap stall, because she didn't want to take a poop in the little stall because she needed her room. Oh yeah. It's just, and I just look at them when they come out and they're like, I'm sorry. I'm like, no, you're not sorry. You should have thought about that. Like, hey, what if a handicapped person comes in here? But that's the mindset nobody has until you become handicapped. And that's why I said, when you see buildings and places, the engineer was never handicapped before he made that entrance, or thought about that parking spot, or thought about how wide that door opening is.
Yep.
Dawn, I promise you, if I write another ticket for someone parking in a handicapped spot, I'm putting your name on it.
Oh no. Do you know a man parked his truck, his trailer with his grandson, so he was showing him a great lesson, across 5 spots.
Oh, wow.
And I tried to get him a ticket, and they wouldn't ticket him because they came before he moved. They came after he moved his truck. I even took a picture. It would have been over $1,000 fine. Yeah. He was on the ramp too. On the ramp. Like, honestly, they see it all the time. Like, I'll be in this gas station. There'll be people without handicap things in the spot. And I just look at them when I'm getting out of my wheelchair. And then they're like, I'm sorry. No, you weren't sorry until you saw me in the wheelchair and realized
you got caught.
Yeah. So
that's a likely story.
A lot of it is
until they're caught, they're not sorry.
Yeah.
For so many different things.
Exactly. Yeah.
Mm-hmm. And John, while he's here, I wanted him to just share, because he's saying how inspired he is, with all of you and in your stories. He literally was on the verge of amputation, and he was on the force when he was stricken with PAD, and he literally almost lost his leg and has had to, fight back. And probably, I would imagine, John, the mental aspect of, being away from the force and not being able to do the job that you dreamed of all your life, and to keep up with your buddies out there, the colleagues that are out there, challenging themselves every day. That must have been really wearing on you.
Fortunately for me, I've always been the kind of person when there's and adversity, it drives me and it fuels me. I've always been fortunate with that. Growing up, I wasn't always the best kid. I was mean. I wasn't mean like getting in trouble a lot, but I really didn't have a whole lot of fear. And when my mom was a police officer, and when I told her I might do that, she said, well, that little orneriness in you is what's going to get you through life. And when I'm going to try to say this without crying, every time I say this to somebody, I don't share it very much, I start crying. My mother was in the room when they were talking about my amputation. The very first time they were going to do it in the ER that night. It was they were ready to do it. And my mom said, she looked at my dad and she said, I'm too old to help him. He's going to need me to help him get to the bathroom and to stand up. Well, my God, that went right through me. So that's when it started. I was like, nah, that's not happening. And when I came in, they told me, like, well, you're not going to be a police officer anymore. I thought, well, that's not happening either. And no matter what they told me, I just knew in the back of my mind that I could work through this. I have to work through this. And I had done research, and they were police officers who were amputees. They had one leg. Of course, their duties were shortened, but I knew, well, somebody did it. If somebody can do it, I can do it. And it's hard. It's the hardest journey I've ever been on in my life. I've been in about anything that you can imagine that's a scary situation or a hard situation. This is the hardest fight I've ever been in. And I'm still winning. I'm still on two legs. Luckily, every day I think about the people. I saw a thing on the internet. So what motivates you when you don't have the motivation? Well, mine is whenever I know that when I lay down today, what's going to happen to me? If I decide I'm going to take some time off, I know what's going to happen to me. Every doctor I visited kept telling me about when they do amputate me. And I'm like, it's not happening. You're not cutting my leg off. And I was told, well, I'll see you in 6 months. When the doctor at the Cleveland Clinic told me, he said, I'm not taking your leg off until you're ready. And I said, well, you'll never see me again. And he said, I'll see you in 6 months. That was about 4 years ago, and I still haven't talked to him. I did send him a Christmas card once, though, just to let him know that I was still up and running. But my stubbornness is what's kept me from listening to the doctors when they tell me I have no other option. I had a heart attack at one time, and they were like, your days in the gym are done. And, I would call a friend of mine, and he would come pick me up when my wife went to work, and he'd drop me off the gym. That was my secret affair, was going to the gym. So and when I hear people like Dawn talk, man, it just, wow, you couldn't light a fire under me with a match any more than what she just did. Knowing her pain, and that's the road I'm on, makes me fight even harder, because I'm sitting here thinking, you know what? The biggest fear that I have right now, she's lived it. She's done it. And she survived. Yeah, it wasn't a pretty road. And yes, she's sad, and her story is, you can take it two ways. It can put you in a dark spot, or it can captivate you. And she captivates me. And I know that that's a road that I could very well be on. And I'm going to be thinking about her whenever the next time that I've got a minute, and I'm like, well, I'm going to the gym this evening, or I'm going to try to walk, or I'm going to run up these stairs, or one of my crazy workouts I throw together where I'll put a punching bag on my shoulder and run up and down a couple of flights of steps. I'll be thinking about you, Don, because you motivated me. And the sharing of one another's stories is captivating to me. Whenever I see someone very positive, and then the next day they're like, they're having a bad day, then they're positive again. It shows the world that that's what you go through. Yep. And whenever I was being told, well, we've got a light duty spot for you, and I'm like, you're trying to tell me, oh, you're going to let me come back, but I'm going to be on the desk. And the whole time I'm thinking to myself, how am I going to get back on the SWAT team? That's what I was thinking about. I wasn't thinking about coming back to work. How am I going to get back to the SWAT team with the 25-year-old guys and all that are breaking doors down? That's where I belong. And they had the tryouts again, and they were like, we'll take care of you. I was like, what do you mean you'll take care of me? Well, we'll cut your push-ups down. I was like, there's not a kid in this building right now that can do more push-ups than me. Then when we had to do the run, I made the time barely, but I made it, and I wanted to cry. I've never felt so much pain in my calves, but I did it. And, no matter what they told me, it wasn't going to stop. And every day I hear someone try to extend the courtesy of, well, you got those bad legs and you got that foot thing going on and your blood's all jacked up. And then it makes me sad when people are treating me that way, but they'll park in Don's parking spot. It's like, it's sad to think that there's so many people in the world who are just inconsiderate to people who have a disease that's not quite visible. But when you see someone in a wheelchair, they need that spot, not you. But the original question that you asked me was, what kind of mental toll did it play on me? It was tough. It was hard whenever I would come home and again, fortunately for me, I would be mad because I would think I couldn't do what they did. I would lay there and it would fester in my mind and it would build up until I thought, I don't care what it takes. I'm going to do what they're doing. I'm going to beat somebody at what we're doing. And then years ago, I taught defensive tactics to military and police, and I thought that was done. And then they called me and they were like, hey, man, we're looking to bring some of the old instructors back to kind of change things around a little bit. And my sheriff told him, well, he's going through some medical issues. And I was like, well, what are those medical issues that I can't go and teach class? Well, you got to qualify. Well, I can qualify. I can beat anybody there. And I did. And I showed up and I made sure that the little things, we had to be there at 6 o'clock in the morning. I was there at 5. I didn't like it. I didn't like getting out of bed. I was mad. But I knew that I had a point to prove. And that's what drove me was I don't care if they're telling me you're too old. You can't be a defensive tactics instructor. I don't care about that. If they tell me you're too old to be on SWAT, I don't care about that. But if you tell me it's because I have peripheral artery disease, I can't do it. Yeah, I'm going to fight you and I'm going to win. And each person's story is different. And I'm fortunate when I found out I was able to immediately start fighting back. A lot of people like Dawn's situation, she was already down, and I was able, it just came on me so quick with a blood clot and everything just went south real fast, but I was able to rebound quick that way too. A lot of people were like, I knew it was coming. I was on a long road, but it hit me like a ton of bricks. And luckily I had the mindset and the mentality to be able to stay with it.
Yeah.
And, and I see like Doug, I see where Doug's walking his dog in the parks and, I'm like, yeah, this guy's not laying down. He's fighting no matter what your fight is, you may not get up and run a marathon. Shoot, his name just slipped my mind. Kevin, like Kevin does. Yeah. You may not run a marathon, but what if you walked a little more today than you did yesterday? What if it's 2 steps? What if the next day it's 3 steps? Every little thing that you do to push yourself forward is going to beat this disease. And fortunately, I don't know anybody with peripheral artery disease in my neighborhood, in my state. So finding this webpage or Facebook page really helped get me to where I had a community of people I could talk to. And if I say something, little, like, I put in some work at the gym today and someone says, good job, that's enough to make me go back. That's enough every day to make me drive. And again, like I said, I could run through names of people, but I'm not good with names that I seen them post one thing that I was like, that's going to drive me today. And it's not always, Doug had a good day in the park walking. What's your dog's name, Doug? I can't remember.
Stella.
Stella. Yeah, Stella. It's not always good that drives me. Sometimes when I see someone saying, I don't want to go on anymore, my toes are black, my feet hurt.
Yeah.
That makes me want to go just as hard. So the mentality is, my wife's in her holiday, hey, you're supposed to leave in 5 minutes, and I'm not even dressed all the way. But I just want everyone to know that if you're in that place when we have these talks and you're in that place where you want to cry or you want to, woe is me. That's what we're here for. But if you want to toot your horn about how hard you work today, do that too. Just be there for each other. And again, Dawn, I can't thank you enough. I didn't get to hear a lot of stuff today. It's been a crazy day for me. But I was able to get in here and slide in and Dawn, it really meant a lot to me to hear you talk and to hear you say the things that you said that really motivated me and it touched me. And man, I hope you fight, and I hope you fight, and I hope you fight. And I know that those things are bearing hard on you. But there's a lot of people now that are listening to you now. They're listening to your story. I may not be able to get you a new parking space or get people out of it, but I can push myself to be better because of you. Thank you.
It's so amazing.
Hey, John.
Yes, sir.
I got I don't know why I'm gonna say this, but I'm gonna say this. If I was on the patrol with you,
yes,
I would just pick you up and run through the door with you. Instead of trying to kick the door down, I'm just gonna pick you up and run head first through the door.
Yeah. I spent a lot of times being the front guy until someone told me, they were like, you're the first one to get shot if we go in the door, right? I was like, yeah, I realize that. But yeah, I appreciate that, Doug. That makes me feel good, because I try to put in a lot of work. I never want to be the small guy in the group anymore. And that makes me feel good. Thank you, Doug.
And we're with you every step. And thank you for serving your community and fighting to serve the community. So we're so proud of you. And one more quick thing. You ended up with some accolade from a magazine. I think you got, into the final round or into the semifinals.
Yeah, I made it. I started out, it was actually to motivate my wife because she has very low self-esteem. She's absolutely beautiful. And I told her, I said, let's just try it. And we did. And I made it to the first out of 70,000. I ended up in the top 50. So I was pretty excited about that. It was worldwide. I was kind of like, I'm still in this thing. How am I still in this? But I was still there. And I missed out on the 40 grand I could have won. But it was a lot of fun. A lot of the people that were in the competition would message me and trash talk me. And it was kind of fun. They were just like, oh yeah, you're a cop. You're going to beat somebody on the street with your money. And I'm like, really? Okay. But it was a lot of fun. I really enjoyed it. And they meant it all in good. There wasn't nobody being mean. It was a lot of ribbing and a lot of things. But
I think it also been hearing your story, and it really means a lot to everyone. And I remember it really struck me when you were posting in the group, all of your milestones in the gym. And I said, wow, this is really, amazing. And you said, but what's even more amazing is the comments, because I didn't realize, for someone like you just seem so strong and, mentally tough as well. And that you needed our affirmation or support. Really, it was like eye-opening, and it meant the world, not only to me, but others that you shared that with. So thank you. And we're always here for you every step.
I'm not above admitting that I love attention. I'm not above that.
You know what? We are all. Thank you. It's all about finding what drives you, and everyone's different, right? Sunshine, you've had, you've gone through so much, just like Dawn, and you are, you're one of the most amazingly strong women that I know. We've been through so much together between you and me, and also nurse practitioner Kay right along your side, fighting for you every step of the way. But we couldn't do it. We're just there as facilitators to your desire, to your perseverance, to your courage.
It's definitely been a tough road, but like you said, you just have to keep persevering. I relate so much to a lot of what Dawn said. And her and I have kind of, we went through this together. I've peed my pants, I've pooped my pants, I've thrown up all over myself, I've fallen countless times. everything that I do is a chore. And doctors told me I would be walking in, 3 to 4 months. And here we are coming up on 2 years, and it's not as easy as they think that it is.
More than 60% of all amputees still don't have a prosthetic here in the US.
Well, and even if you get a prosthetic, there's no, all prosthetics, they're different. It's different for every person. They don't fit right, or you get skin tears, or it's always something, or they break. And it's just, you take, 5 steps forward, but then 10 steps back. And that's constant, like that, back and forth.
And for you, what some don't realize, they think that an amputation is the end all be all. And for you, you ended up with multiple amputations because it almost seemed like this revolving door due to lack of proper wound care.
Yeah, I had the toe amputation with the bypass, and it failed within days, and I knew that it did. But they swore up and down no, that it didn't, and then they just left me lay there for 5 days. No doctor, no nothing, came to my room until it was too late, till the sepsis was running through my body, and I had no choice but to amputate that leg.
And that was the most disconcerting thing about that whole experience, because we were right with you, and no one could get a hold of the vascular surgeon for days and days. And it was like, well, where's the on-call surgeon? Where is his fill-in? Is there a fellow? Is there someone that will answer the phone? And so finally there was an outside interventional cardiologist that called the hospital and said, hey, I'll take her. Just if she needs to be on antibiotics, just keep her on our lines and ambulance her over. I will open up her vessels and get blood flow to the point where the amputation occurred to help heal the wound. And I'll get her back within hours to the hospital. But can't we just try? His request was even ignored. You still had to wait even a couple more days before the vascular surgeon finally answered our cries for help. And by then it was too late. As you said, the sepsis had already started to flow through other parts of your body, and you needed an immediate below the knee.
Yeah. And it was the same thing when I went from the below the knee to above the knee. Although I did, get to go home, they just kept ignoring the signs that something was wrong, and let it get to a point where, my bone was infected, that all the tissue was necrotic. There was nothing that they could do. They had to take my knee off, and they had 4 weeks that they just didn't do anything in those 4 weeks to save my leg.
No, and I was surprised, and I just hope that in hearing your story and hearing Dawn's story, that physicians take a step back for a moment and make sure that they've exhausted all efforts, all limb salvage efforts, whether they have the skills, whether they align with the tools and techniques being used. So you know what? If amputation is on deck anyway, give up the patient to someone who might have a different option. There is a device even that just got FDA clearance. It's called LimFlow, and it's for deep vein arterialization. It is the Hail Mary of all Hail Marys, where they can hijack a vein and be able to reroute blood flow into the foot to help to heal a wound and give the patient even one last opportunity to get back on their feet and start building their collateral network. And so there are so many more options available. There's almost no excuse these days for a doctor to use amputation as frontline treatment, or to delay any other potential frontline treatment, endovascular bypass or medicine, and just go straight to amputation, right? They need to exhaust all of those first. And if they can't, give up the patient and say to that patient, not if I can't do it, no one else can, but to say, you know what, I can't do it, but it is possible. Different doctors, different tools, different techniques, different philosophies. Maybe something else can be done. This is the option I'm offering you. And if that is your choice and you choose to pursue this option, I am here for you. Even if you don't know the other option, allow the patient the courtesy to explore and see if there's anything else out there. I understand if life is on the line, such as in your case, Sunshine, it ultimately got to the point where either it was limb or life. And so you had to make that determination, that point, to save your life. But if life isn't on the line at that point, let the patient explore other options. Or as Juanita, who shared her story earlier, said, hey, you know what? My doctor actually helped me to find another option. My doctor explored those options with me. They're my family and health. And I think that that's really important.
I think so too.
And so where are you at now in your journey?
Well, I just got a new socket for my prosthetic not too long ago. I was having a lot of issues with skin tears, so I wasn't able to wear my other prosthetic very often. So I have a brand new socket, and I'm walking a lot more with it. I'm back in physical therapy. Yeah, that's where I'm at. I mean, I'm not walking unassisted by any means. I'm not living nowhere near the way that I lived before I lost my leg, but there's hope. I mean, it's slow coming, but there's hope.
And that's amazing to hear you say that. It is inspiring, that you can have a life, but it's not as easy. Even Dawn described, as a physician might think, it takes 10 minutes to cut off a leg, but it takes the rest of a lifetime to learn how to live without it.
Yeah, and there's always going to be something new that you have to learn how to do for the rest of our lives. There's always going to be an obstacle at some level. Anytime we try to do anything, there's always going to be a learning curve to it.
Yeah.
So we don't get up and just get up out of bed and get dressed and go to the bathroom and do all these things like everybody else does. Like, it's so much more than that. It's hopping around on one foot. It's using all of these devices to help us do the things that we need to do. Like, it's so much. It's never ending. You're muted. I see you trying to talk. There you go.
Dawn, feel free to jump in.
No, because the baby had to tell her to be quiet. She was next to me. But even like I was saying before, with the prosthetic leg, like she said, we can't just get up and go pee.
No.
You have to put powder on my before I slide up my leg into the sock 9 times. My leg came off 9 times because when I sit down, the leg changes shape. So it's not you just get a leg, like she said, and off you go. You learn to walk. You have to also learn how to adjust this leg, because so many times your leg is changing shape. And then guess what happens after you get to 10 socks that you have applied? They use socks inside. You have to get a whole new socket. So guess what? You're out without a leg because they got to make you a new socket. So it's not like you just get a prosthetic and you're happy to go. That's it. It is a lifetime process. You have to keep having it redone. They might have to, new technology comes out. Like my leg is more sophisticated than Sunshine's, but I think Sunshine's looks like she's walking better than I am on it. And we're at the same pace right now with prosthetic. Like me and her have been neck and everything. Exactly. I've lost the left leg. I have the right. She lost the right. She has the left. We are the twins. If you look us, we are the PAD twins. We have the same type of blood clotting disorder. We've gone through the same thing with infections after amputation. Had to have vacuums attached to our legs and walk around with purses sucking out pus. I mean, it's just the whole process is a never-ending learning. It's a learning process. Like when I got home after the hospital, how do you get down the stairs when you're crawling down the stairs in the pouring rain? Now I got to go out with soggy drawers because my clothes are wet because the stairs were wet. So I had to learn to get a trash bag, cut the top of the trash bag, put it on, wear it as a skirt. So as I'm climbing down the stairs, my pants aren't getting wet. But after that, you got to learn how to get the trash bag off without falling over with one leg. Like there are so many things with amputation that I told him we could go on for hours. I could talk for hours about all the trials and everything you go through with having one leg. I can't imagine how it is to be without two.
And the pain that they don't even consider when we had Larry Shorty Coleman on Legendary Harlem Globetrotter earlier today talking about living life as an amputee. And he said, how many falls that you have as you're learning and how painful they are.
My tailbone.
I fell and couldn't use my leg for 6 months. Yeah, she broke her tailbone. I mean, they don't think about all these things. And now you want me to trust in this foreign thing that you're strapping to my leg and say to me, now you have to learn to put all your body weight on this thing. You know what they told me? I told I'm afraid I'm going to break my hip. And you know what told me? I'm more safer in my prosthetic. But you're telling me that's not showing me that I'm more safe in my prosthetic.
Yeah.
So I don't even, you have to trust it.
You know, I don't mean to interrupt, but
telling me that I have to, that's the thing.
I don't mean to interrupt, but thank you for having us. And I need to go. My 16-year-old has a birthday party today, so I'm sorry.
Thank you. We really appreciate you both sharing the story, and thank you for advocating for Karen, your wife. It's
good
really
luck
inspiring
for everyone, and ask more questions than you can get answers for.
Oh, happy.
And that's basically all I can say.
Thank you. And Sunshine, we missed what you had said you had cut out with your internet.
I think I was saying, it's people with two legs telling us we have to trust the prosthetic. Like if you've never done it before, then no, you can't sit there and tell me, and it feels like belittling me because I'm not trusting the prosthetic. When you're walking on two flesh legs, or tell me how much pain
that are attached to your body and might not possibly fall off.
Right.
They say they're not supposed to, but I've gotten up and it's come off.
Right.
Yeah.
I mean, it's like when they try to tell me after and that I shouldn't be in this much pain, but you're standing there on two flesh legs telling me the amount of pain that I should be in. No, probably not.
It's
like
really
I know
a
what
lot.
you're going
I think
through.
it takes.
No, you do not until you're going through it.
Exactly. You don't know until you're going through it.
And I think that's a good spot to end the conversation, because I think that should inspire people to take a moment to listen and try to understand and have respect for how someone is feeling. I think that that's so important. Thank you so much, Sunshine and Dawn Marie, for sharing your story.
My last thing I can say is, if you have legs, the one thing I have learned through Kim and all of this is, if you have two legs, like everyone else said, just walk, because if I knew about walking, I would have tried it. I would have pushed through, and I wouldn't have had surgery as fast, but I thought surgery was going to fix me all up and I was going to go back to dancing. So just walk, use what you have, because if you don't use it, you lose it. And my 90-something-year-old grandmother used to say that. You don't use it, you lose it. So use those feet if you have them.
Thank you, everyone, for joining us in our first inaugural Save My Piggies